have some preliminary discussion about the day and how it will go. It's kind of up to us. We do have some folks here. If we have questions, we can ask questions, but we're not at this point asking for full presentation or review of programs. We're just answering questions. So we'll ask the question and we'll get an answer and we'll move on. So all in the interest of time, this morning we're reviewing special requests. We do have a break in there. And at lunch, we will have the citizen members stay local and have a discussion about the elected officials compensation committee and all the issues related to that. Final decisions we'll try to make after that lunch break and move through those decisions one by one and get approval. So we're not sure how long this discussion will take, but we'll get launched into it. So a review of special requests. Dan, are you helping us launch that?
Yes, I'd be happy to help launch that. So we kind of have special requests and budget decisions, and I think we can hold off on the budget decisions separate of the special requests for the budget deliberations at 12. But right now we have a lot of health services staff here, and I think we should start with just in the proposed budget, there's 4 health services requests, and if anybody has any questions about those, let's just start with the first one on 201, the harm reduction public health educator 2.
Page 201. You said
201?
201. And if there's no questions, you know, these are in the proposed budget. If there's no questions, we can just move on and get to the ones that are not included in the proposed.
Oh, it's in the, okay, I'm going like, on 201, it's just,
Oh, yeah, we're looking at that one.
this is really, okay, got it.
So this is page 214.
He's texted. Yep.
That's where the special request
5 minutes.
201.
He'll be here any minute.
It's above the line, it's already
201 has
included.
The master list, and then 214 is the detailed special.
Yes, 214 would have the detail.
214 through 21 are the four in budget health services.
I mean, I would just say the 4 that are in the proposed budget that have no general fund implications, I don't see any reason I don't have any questions about any of those 4.
Nor do I.
Okay. Judy's shaking her head.
Yes, agreed.
I agree with that.
Okay. Well, then let's get,
That's good.
So 233 are the not in budget ones, or is where they start.
okay, well then let's just start with the first one here on the, not included in the proposed budget, we're listed on 201, which is the behavioral health front office admin support technician, which is, vital to the services that they provide. In order, when I worked in behavioral health, they kind of called that the captain of the ship. And if you don't have a behavioral health front staff person, it's very hard to have an orderly flow with clients, and there's some efficiencies there. So,
Is that their number 9 priority?
I would. It's yes.
It's your last priority.
Well,
It-
the way we have to prioritize is across 2 service areas, very speaking, so yes, it shows up as number 9.
I know. It didn't seem to make sense to be last, because truly
my-
it is the front door.
That's my fault. That's my fault. I had to prioritize. It was difficult for me to prioritize across the different divisions, so I wouldn't put too much weight into the prioritization because of me not knowing the operations that well.
A good leader jumps on the sword first. Good job. I guess the only question I had on this, and it's just a clarification, this is the front office, not an additional front office technician for the main clinic, correct?
I think it's an additional.
So, going
know if you want us to be up front or.
Yeah.
Somewhere
Get
near a
caught on.
microphone.
Yeah, if you guys want to head up front, that would be.
I believe this was one of the positions that was discussed as it's very valuable to have two people up front at the front desk at
Two people
behavioral
in
health.
the building was what I heard, so I'm just checking. So this is an additional so that you have two in the main building also?
So this is an additional FTE to a team of 10, so we're going from 10 to 11, and we're serving 6 buildings. And I neglected to say 6 buildings, and we're also in support of 7 school-based health centers. So we do that work remotely, meaning the therapists are in the schools, but we're working with scheduling using the front office staff.
It's just, the way that it's written in here is this is a front office staff specifically for the main clinic. And I know resources move around, but the cube or whatever is in a visible place in the main clinic.
Yeah, that is the problem we're trying to solve. If we can place a new FTE back in the Courtney Clinic, it will solve our problem of drawing other front office staff from other locations, which then undermines those operations in the other locations.
So this is really, the face in the front office of the main clinic.
Yep, absolutely.
Okay. But thank you, that answered my question.
And from my understanding, it was a safety issue as well.
Right.
Just having one person up front.
Well, inherently, people come into the lobby dysregulated, anxious, and we have a mixture of children and adults in different mental states, and we're trying to provide the most certainty and stability that we possibly can. And sometimes what we're also trying to do is have the same friendly face, the people that they're just normally accustomed to. What's happening with moving people around, and it's not terrible, all of our staff are wonderful, but there's nothing like coming into your appointment and people already know you and talk to you, and that very much is what happens when you can stabilize the front office.
Thank you.
And you said that you had already 3 people that do float around, and the supervisor's Spanish bilingual? Is that, so you're not looking for a bilingual person to fill this?
We're always looking
Yes.
For a
for
Oh,
staff who
yes.
can speak Spanish.
That is a preference.
Right, okay.
Yeah.
I would think you guys would make that a preference,
Yes.
just
Yeah.
for continuity.
Yeah.
And while there's not necessarily 2 people sitting up front, one of the benefits of this is that it would be more likely that there would be a person up front and then someone else nearby so that they could support each other and dealing with some of those stressful situations that you described.
Yeah, so physically the desk may be just slightly behind the front office person, but in most cases you'll see the people at the front desk because they're sharing the responsibility of greeting the people that are in the line and then somebody else is also taking the phone calls that may be occurring.
And so operationally, so you can visualize it, we have 2 desks for which somebody may enter. And we have 3 people at the main clinic in terms of that front office. So any one time you might have 1 person at that front office desk because there are 2. So when somebody isn't there, you get that imbalance.
The adult and child waiting room are separated at Courtney. It's a large, busy clinic, and we felt it was wise to have a place families and kids can check in that's separate from where we might have adults check in who are doing things that are okay, but might make people uncomfortable. Or, occasionally we get folks who are pretty feisty. So having 2 people up there, and on busy days, having the 3rd person come from the back and be at the adult front desk has been really critical for safety and continuity for clients. We do groups when things are normal in the world. That can mean a line of 10 people at the front desk on the adult serving side of the waiting area.
And will this help when folks are on vacation or need to take
Yes.
a break or?
Or get sick.
Well, that's another part of the problem is inevitably somebody's going to get sick and they take vacations. And so it just draws down from what we already have. So coverage is the number one priority. We have to be able to serve the public. And with 10 people and knowing that people do get sick and knowing that people do need vacations, we're already running a deficit. But historically, we've always had 11 in this position. And we've been able to make it work. But I think we had mentioned earlier that, one of the responsibilities that we take seriously in admin services is doing the most with what we have. And I think we took a chance during COVID thinking we couldn't be sure how COVID was going to affect the front office. And it just turned out that, in fact, it's just as busy, and we actually need to return back to the levels if we're going to sustain any kind of continuity at the front office.
Does
It's like
anyone,
we have support.
does anyone not support this position? I think we're good to go.
Thank you very much.
Thank you.
So then moving on, just as long as Janice is up there, so we don't have to mix and match staff and everything, let's move on to the IDD positions. That's the fourth request on the not included in the proposed budget, the intellectual and disabilities, regular, 3.5 new regular positions, matched with county general fund here. And that's on page 239, so.
Thank you.
It's also on this
Last
spreadsheet,
year.
which
Yes.
is really actually better, I think.
Can you give the title of it again?
The intellectual and developmental disabilities, it's a increase of 3.5 positions there, based on, I believe, a state study, right? Or the state funding population.
It's based on the workload model, projected need, and recommended staffing levels, and then the manager's assessment as well of specific need around people to help establish and certify foster care placements for IDD service population.
And we're truly lacking on enough foster homes in Deschutes County, because I did that count, and from Paul, and it really, and I'd heard from some people in the community that had 19-year-olds that were ready to move out somewhere, because that's legally what we're supposed to provide. It was a mandate from the state on some level.
Yeah, and I don't want to pretend that adding staff is going to create additional foster placements, because foster placements require people that are willing to do it at the current rates. But one of the barriers to establishing foster care placements is that the state level bureaucracy for doing that is incredibly, as you all can imagine and have probably experienced in other walks of life, it's burdensome. And so when we have staff that can help people get through that process, we're much more likely to have success establishing foster placements. And that's what these staff do, is they really help ensure that people can navigate the complexity of the bureaucracy of getting certified to provide a home for these individuals.
Well, the state keeps adding more rules. You've got to have the sprinklers in, and if you really don't have that big of a home, it's extremely burdensome. So,
Yeah.
it's really a hard game.
It is a hard game.
So that was my question in the scenario that was written. It says statutorily derived formula, and it sounded like, well, the formula says, and so we better add somebody, but it sounds like there's actual work to be done. And
Oh, yes, there's actual work to be done, and there are years when we've added fewer staff than the formula recommended, and there are years that we've added 1 or 2 additional staff than the formula recommended. So the formula is sort of a baseline. Here's what we think the workload is. Here's our best guess at the positions you need, and then we have some local control over deciding what the actual need is and deploying staff accordingly.
so I can justify given the opportunity to help people come up with service. I mean, that's pretty valuable, and I think that's a good health service role to fill.
Thank
So
you.
I'm in favor of this one.
I'm supportive also.
Me as well.
I really like the federal leveraging, the investment of $111,000, which leverages another 260.
We like that too.
So one question about location, home base for the staff, is this, I know they're based over here, is there going to be Redmond presence or anything, or is it one team dispatched out of Bend, or what does the future look like there? I know space needs is always tricky.
We are out of space. There is a plan for IDD staff to be in Redmond actually relatively soon, I think within the next 12 to 18 months, if not sooner. And we will still be out of space, frankly, and we have some conversations and plans in the works, and thankfully some possible revenue available through behavioral health to address space needs. But you will likely hear from all of us in the near term about plans to maybe move some folks around and take advantage of some opportunities for space.
And we're working with Christie in property and Lee in facilities.
Yeah.
So that, because they're looking at all the pieces for all the departments that are facing space needs. So we're working closely with them.
All right, is there anybody not in favor of this position? Thank you.
Thank you.
Dan?
Yeah, let's move on to the conversion of the public information officer, limited duration to regular duration, and there was some preliminary talk about this kind of decentralized versus centralized positions with specialties and that sort of nature. I just want to open up that conversation now, and this request is on page 241.
One of the light bulbs that went off for me yesterday when we started talking about the Cannabis Advisory Panel's recommendations for marijuana tax revenue was that they had suggested that the cap, the panel suggested that we send $70,000 of the marijuana tax revenue that we're receiving each year, we anticipate receiving each year, to health services to do prevention and treatment type education for people, and that immediately made me say, well, gee, who's going to help us communicate that out to the public if we are trying to get some prevention messages out there, or to help people understand treatment opportunities, and that led me back to this PIO position again, which it was just another example of something that we will, a communications capacity that we'll need over at health services that we maybe aren't even thinking about yet in our current budget.
But is a position like Lindy Perry's, has that been evaporated? Remember, she was out at the sister school like 2 years ago, and then COVID hit. She was actually had a room in the school and was working on drug information.
And Hod may be able to speak to that, or Jessica.
Yes.
And can you repeat your question?
Well, I just want to know, has that position disappeared?
No, we still have that position. Heather Stewart is in that position now. It's funded through Behavioral Health Fund 270.
Okay, so that, and she's still working Sisters and Lapine, or where?
It is, yes, and we've been, because of Healthy Schools, we've been able to expand that position's work to Redmond School District, primarily focusing on Upshift, which is alternatives to out-of-school suspension.
Okay.
So maybe it would be helpful to just explain the mechanics of how this role really works within our department. So we have people doing prevention in multiple settings. We have emergencies that occur across multiple domains. We have efforts to communicate critical information to people in the community about our services, about suicide prevention, about how to access crisis services, about substance use prevention. Currently, our PIO, I wish you could see his list of projects. So his role is to really ensure that all of those efforts get centralized and coordinated and organized, so that not only are we doing those efforts in our little unique locations, but they're also being communicated broadly to the community, so that the community understands, how do you find us? How can we help you? What is some important key core information that we're getting out when we're in a school, or about this particular emergency or that particular health crisis? So our PIO has a kind of public-facing, expediting, communicating role, and really ensures that the media and community partners have a trusted person to reach out to get help with critical, very immediate communication needs. In behavioral health, we get it constantly. You all have seen the Stabilization Center and other programs in the media. Frankly, we're grateful for the coverage, and it is a workload, and having a person who has tracked that over time, understands it, understands the requests, it's just invaluable for us. So I'm just trying to explain the mechanics of how this works, because it's hard to know when you're not, in our agency doing it every day, how we're using that service. That person works closely with Whitney or whomever the county's PIO is, and also helps relieve some workload burden for county admin, which has its own set of communications and media coverage that it needs to respond to. So.
Yeah, thanks, Janice. I would just offer that administration is fully supportive of this request.
Yep.
I think the mechanics of whether it's centralized or decentralized is a discussion for later. I mean, the key is our commitment to this position to make it permanent, and then we can coordinate on the reporting structure, the coordination structure, if the budget committee supports the position. No question, Whitney, as our communications director, is going to be essential to how the position functions and operates within the county if it's supported. So I just wanted to share our perspective on the position, and if Eric or Whitney have anything else.
I would just like to add, I completely agree, Nick. It's really a kind of administrative decision on where the position should be. There's a human HR analyst in health services that's kind of, you could have a similar discussion. And really what happened with that position is when it was first added, Kathleen, our HR director, was very supportive of adding the position. It started out in the health department. Then through discussions with Kathleen, it actually moved to the HR department and reported to her. Then for various reasons, that structure didn't work great. We just hired a new person in the position, and it's back in the health department. So those conversations are ongoing and can be evaluated throughout the process. And really what, the budget question for here is converting a limited duration to a regular position.
The position's already supported through another funding stream.
Right.
Yes.
Yeah. OHA and behavioral health.
If I could add to that thought, I think it's actually helpful for us not to get hung up on where the position is located, because you think about the work that the communications work that this person will be doing. It actually supports a lot of other departments in the county. If this person is working with Ed Keith on keeping people who are vulnerable receptors to smoke from inhaling wildfire smoke during the summer, that is a health function, but it's also a natural resources function for the county. If this person is helping to promote the Stabilization Center or mobile crisis assessment team, that's a valuable service for behavioral health, but it also provides huge benefits to the sheriff's office and law enforcement agencies in the region. So the work that this communications capacity will be targeted at is in a lot of ways beneficial across departments or countywide in that sense. And so I just because the request is coming from health services, I don't want to just I don't want us to think about this as this siloed communication capacity that only serves health services.
So I'm supportive of this function and this position. Looks like it's not general fund supported. It'll be built in through other avenues. It brings to mind the fact that we're going to be working on a health administrator, right? So that's where the team's going to be coming together. The board is the local public health authority. We need to be up to speed and knowledgeable as we can. Obviously, you don't run for a commission seat to say, I am the authority here. We're the local public health authority as a board. So as I say, it is that dynamic of the information flowing internally, the leadership, the sharing of information as the public hears about it, and having, as I say, us as commissioners up to speed also. So, yeah, let's work together on that.
I agree with the commissioner and am in support of converting this to a regular position.
Here we go.
Anybody not agree with that? Thank you.
Thank you.
Okay, moving on, let's go to more public health oriented, the addition of .5 health officer. Here, yeah, you guys can.
Page is that, Dan?
Sorry, Dan, I got distracted. What?
No, the addition of a .5 health officer.
234.
Thank you, Jim.
It's priority number one, if that mattered.
So I'll start off the same concept. You know, when we have a health administrator, that'll give us kind of the leadership of the organization. Is the health administrator going to have some of those credentials, or is it going to be more the business administrator, which is the future? We don't know yet. Any thoughts, Eric, I guess?
Yeah, the health services director is more the administrator. You know, most likely when we hire the next director, they will have background in health as opposed to me, which is more of a generalist. But really, there's lots of options because we have the knowledge and expertise in the divisions. The health officer is more the medical doctor, the medical piece. On the behavioral health side, we have the medical director, Dr. Will Berry. As we know, he's leaving, but he provides the medical direction and advice on that side. The health officer is really that on the public health side, and we're actually seeing the need of the position right now as we look at monkeypox and responding to that. Nahad and his team have put together kind of a group that will be working on, or is working on, information about monkeypox, and using that health officer for medical information is really important. The position will also advise community providers about things like monkeypox. So that's something that I've been learning. I don't know if you want to add anything, Nahad?
It's a great point. In fact, whoa, there you go. Sorry about that. Yeah, in fact, providers are reaching out and trying to find out where they can get their source of information about monkeypox right now. So Dr. Fawcett, who is our infectious disease expert, is offering some of his time to the providers to build their capacity in terms of how to identify a case, diagnose, collect specimen, send it, follow up, all of that. So it's a resource. Commissioner DeBone, the model that you mentioned is in place in a number of counties throughout the U.S., where the administrator / physician or health officer, first of all, that position is almost double the salary. And second of all, the vision that we have for this position is partly to provide clinical services. And I think it would be quite difficult to be both administering a huge department of 400 plus and provide clinical services and the other functions of that role.
But I was more thinking through the concept of if we have that health administrator in place, maybe that would, give us a better feel for who's going to be the good fit as the health officer. So I wasn't saying that both jobs had to be there. I was saying maybe this is time to stand by for, 6 months or next year's fiscal year just to get the organization in place. That's more what I was thinking.
Gotcha. I'd be very comfortable moving ahead now because the health officer will work closely with the public health director. I'd probably be involved in the interviews more for the fit and the communication piece of it. But I really see this as a similar position on the public health side that we have on the behavioral health side.
Are we going to have 10% of the salaries coming from OHA COVID vaccine funds? We were getting some more vaccine funds, but is it going to last through next year, June 30th next year? Cheryl?
That 10% will last through June 30th of next year, yeah.
Okay.
So this is where my concern comes in. So again, I'm not the expert in public health. You're advocating very strongly for this. In fact, I think the first thing that we heard is this was probably a more important position than some of the very senior filled positions that already exist. That's a very strong statement. If it's so important, what worries me is that you're essentially tin cupping this position for the foreseeable future. There's a steady funding from the general fund that's coming in, and we talked about, well, maybe next year that general fund contribution comes in, but now we're gonna go try and find these funds to pay for it. And I don't even know what the 5-year plan is on this. So if it's so important, why is it so difficult to be able to say we have an identified source of funding that we can deliver on this over time?
One thing I'd like to say about that is that the general fund contribution to health services may be $5-6 million, and this is like a $60 million department. So we're tin cupping everything. It's not just this position. So I mean, you know, that department lives or dies on federal and state funding. So you know, the fact that this is 50% general fund with, you know, hopefully some predictability to that makes the funding for this in some ways a lot more predictable than many of the programs that we have in health services. Right, so just like looking at it from a different perspective.
That's a fair perspective. It would be nice to see maybe a 5-year thought process of funding from general funding, and this is the directional thing that we want to do in order to be able to ensconce this, so we don't have to worry about it as much. And maybe the answer is you're moving general fund over to support this 100% and starting to find other options in other ways. But it would just be, if this, I mean, this is a senior important position, and I'm believing you on that. It would just be interesting to me to really see the commitment of the county, and that includes myself as a member of the budget committee, that says that, yeah, this is so important, it can't go away.
And we're having those conversations right now. Even last week, we were talking about if the opioid settlement dollars come through, is that a potential use of some of those funds, which is longer term, 20 years-ish. And this is quite honestly what we do every year throughout the year. And as positions become vacant, what is the priority and how do we fund it more sustainably?
Yeah. And I want to also add, I think it's somehow following the same theme. As an agency, and especially as public health, we are trying to be as opportunistic as possible. So we have funds coming in that are going to expire next year. We have funds coming in that will expire 2 years from now. Some of those funds can legitimately be applied to this position. So if we can free up a percentage of the support for this position to address other needs that we have in the department or in the county, then we are trying to do our part in supporting that effort. But would it have been better if we could come to you and say, please, we are asking for 100% general fund support for this position? Absolutely. It's that critical, and that predictability is important. And maybe next year we will come forth and put this request on the table for your consideration.
But originally, this position was Dr. Fawcett's, right? Richard Fawcett originally served half-time.
Dr. Fawcett has been on-call commissioner, so a number of hours provided throughout the month, which ebbs and flows. So for example, recent month was about 30 hours. Pre-pandemic was a few hours a week. So it really never amounted to part-time, though perhaps during the pandemic there were some weeks where it went above and beyond what we usually asked of him.
But we're trying to hire an MD for this position?
This is someone with medical training and license, correct?
Okay, so for $248,000, that's the salary.
The package is going to be roughly $400,000, $360 to $400,000, the entire package. It's an important, significant investment from the county for a community of our size, growing population, aging population, changing demographics. changing disease patterns, injuries. So it's an investment for today and the next 20 years.
I just want to add some thoughts, mainly because we have two new Budget Committee members who may not be as familiar with the history of public health funding versus behavioral health funding. So I'm speaking a little bit as an outsider, and just hope you'll be patient with these thoughts. But I have watched public health cobble together resources like a Tetris game for the 5 years I've been here. They do not have the robust revenue-generating capacity that behavioral health has had. And in recent years, because the community has become so concerned about the issues impacted by behavioral health, there's been some real investments at the state level that have really benefited us, and we became a CCBHC. So for all those reasons, we've been quite fortunate in our capacity to generate revenue, to build up a reserve that really helps buffer us. Public health has not had that luxury. Not only that, but they just spent the last 2 years nearly killing themselves trying to save lives in this community, and doing that with a really very fragilely funded system. So I know I will be accused of passion here, so I apologize, but that's who I am. And I think it's a little bit difficult for them to respond to questions about why didn't you commit resources, when I know they have struggled to bring resources to the table for years and had to bring them together and piece them together. And we've tried to help them do that with some behavioral health resource for this position. So I'm just here to say I think they're really trying to get this role on board, and the way the funding is put together really is a reflection of the realities that public health faces every year, and not the investment in the role.
So let me, because I was going to have a longer term request. Maybe there's a different way to position this. If the public health, if the way that public health is built is effectively the county needs to fund this, i.e., effectively general fund, and public health creates and finds a series of offsets in any given year to reduce the general fund outlay, maybe that would be a better way long-term, or at least a summary way to be able to present a public health budget. So, okay, personnel-wise, this is really the implication that's going on with the county, and here's the offsets that we found to defer the need on the general fund. And then, because that's a trackable thing over time to determine whether the county needs to go help the health department find ways to defer that, or whether the health department is getting more successful on its own.
Sounds like a great thing for Cheryl to think about strategically going forward.
I support
that would be another fun discussion.
I support the current proposal with the funding streams, and it would give us a better look next year to understand the position and the benefits to the county, and if that request comes before the group next year, we'd have a better insight on it.
I support it too, but I honestly think we're going to have to look at it in like 4 months if we don't get any applicants, because, you know, I'm just thinking how the world is, and I know it's, you know, there's a lot of doctors in town, but nobody really wants to do this half-time, so now we're trying to offer it full-time, but are we actually going to attract someone? And okay, you said it's a package of 400,000, but.
Well, and
well said by our advisors here that that is kind of the scenario in the health department. I don't know what position you'd look at that, you know, there may be some, but that's kind of standard approach.
Standard approach for what, I'm sorry?
The funding package, just as was explained to us, that's kind of the approach in the health department to come up with funding mechanisms. So it's not unlike how other positions are funded.
Yeah.
But Commissioner Adair was expressing concern about the recruitment process.
Yeah, and that's okay.
Well, I mean, recruitment as a
I think I heard from Nahad the other day that you had a candidate who then backed out when they heard about the funding base for the position, which now we're responding to with a different funding mix, which will hopefully provide a little bit more assurance to people.
Yeah, when it comes to recruitment, there are some things that we can control and there are some things that we cannot control, right? We cannot control the labor landscape at this point and how many people are coming out of medical schools and so on, right? But what we can control is bring some predictability to this position, changing the label of LTD to regular, so giving a great sales pitch to the candidates when we have them. So those are the things we can control, and that's what we're bringing to the table for your consideration.
I'm sympathetic to the need for a future policy discussion, but from a financial standpoint, I have enough information on this. You're getting emotional.
So I would like to, just the concept of the health administrator and the big picture, I mean, I'd stand by, so I mean, I'd be possibly a no, but it doesn't look like it's, yeah.
Yeah, and there doesn't need to be consensus at this point in time. This is really just to make sure that we get all the questions out so that individually you guys know, kind of what you want to do in budget deliberations. So I would just emphasize that.
I just have a nuts and bolts question. So this role, is this where Dr. Conway is currently serving?
Yes, and go ahead, Eric.
And
yes.
how long is he going to be willing to do that? And could we negotiate like a ramp down? Like, I mean, if we wanted to like have, if we wanted to try to do, half-time for X amount of time,
I've been talking to Dr. Conway. He's in a limited duration health officer position with COVID funds. The limited duration position ends June 30th. And Dr. Conway is retiring at the end of June, at the end of June 30th.
Okay. And that's a hard stop. He wouldn't like taper off with us for a little while.
He submitted his retirement notice for June 30th, and then we'll open up. I mean, if the board approves the position, we'll open up a recruitment for the position.
And Dr. Fawcett would step up, would he not?
We don't know. I mean, we certainly.
I'll call his father. I'm good friends with his dad. I'll call him and say,
I mean, I know that
"We need to step up."
Yeah, he still has his practice. I mean, we would advertise the position, do a national recruitment. Certainly, if Dr. Fawcett applied, he's a strong candidate, but we would do a national recruitment. And the key is it's a full-time position.
I know, but I mean, he would step up for half-time or something. I mean.
On call?
You mean in the meantime?
On call.
I think I cannot imagine our department without Dr. Fawcett.
Yeah, I
in
can't
one way or another. So I think no matter what happens with this position, we're going to, as long as Dr. Fawcett is available to the county, to the department, we're going to rely on his expertise. Yesterday, we had a 3-hour meeting with him trying to figure out how to organize ourselves around monkeypox. He is the expert.
Well, I think it was on the news, Monday morning or something, talking about monkey.
Absolutely.
Yeah.
So his
Yeah, he's
involvement is not
definitely in
going
the
away.
community.
Yeah, he's a treasure in the community, and we intend to leverage that, abuse that.
All right, let's move on, Dan.
Okay. So the next one would be the.
We're going to come back to that.
Yeah, we're going to come back to all of these for actual decisions at budget deliberation. Do you have a question for that one still?
Okay. It seems like it would make more sense. Okay, we vote on it now, it passes. So then we go on to the next one, or it doesn't pass, but, okay, you're saying that we're voting, but we're not really voting, and then we're going to repeat it?
We're not really voting at this point. We're just getting consensus to
Okay.
move on.
Yeah, we're just asking any questions that you may need to vote in the afternoon. We're happy to, look into the schedule next year if we think there's a better way to do that.
But for a number of the special requests we've just looked at,
We did vote.
we didn't, it wasn't a formal vote, but we got a feel
We got
for where people were.
We have a sensibility of where the
Yeah.
vote is going.
Yeah, and it's not always some of these might be not as consensus-based, so that's where we would do that at the budget deliberation and just make sure that we have all the questions out on the table right now.
Yeah, we don't want to hold these people up indefinitely, so we're asking questions and.
Well, I mean, I guess before we move on from this one, I would just say that, to give people a feel, like I'm supportive of this proposal.
I'm supportive of, I don't know if I'd want my employment contract to say based on offsets, but for future policy. So anyway, that's my thought.
So, it would be the Healthy Schools request now of 2.4 FTE. I believe that is on page 236 in your budget binder for more detail.
So I have enough information to debate this when we get to debating and deciding on it. I'm going to make an observation here while we're not debating or deciding on it, which is, this is not the totality of the program. The 3-year thing that we've been discussing is not the totality of the program, because there are other school districts that are coming in. There's an expansion down to the grade schools. This is a new thing that the county is doing. And I was thinking about this when I saw my other favorite thing that came from solid waste, the 10-year chart out of what the program is and some of the various offsets and some of the guardrails that might go into it. I think that that's something that needs to be done to track an initiative and an effort like this, because this is potentially I'm just going to throw out probably a 20 FTE department within within the health department of the county in a very short period of time. That's not what's in front of us, and like I said, I think I have enough to debate what's in front of us and make a case or a call one way or the other. But I think we just, as the budget committee, I think we need to recognize that we're looking at what could be a very substantial program, and this is just a piece that's a start, and there's some decision points that are going to come in on how we're going to have to decide that as a budget committee over some number of years.
And if I could bound that a little bit, but also kind of flesh it out. This, when the Ben Lapine School District came to us with this proposal, it is a 3-year ramp up, and this is only year 2. So the next year, the same staff that we're talking about this year would come forward, and there would still be an addition of another school at that point. It was 2 people or one more person next year.
One person to add.
So even just
5 schools.
Even just for this, to bound this, this current program to the Ben Lapine School District, that's the eventual build out, and we're not, you're not seeing the 10-year plan the way that solid waste presented to us with it's basically, it's like a pro forma. I mean, so to add that, but then also to bound this, I don't think we can count on the other school districts wanting to do the exact same thing. I mentioned the other day how Dr. Klein, the superintendent at Redmond Schools, his big interest is partnering with the behavioral health division for clinical services in the schools, and that's that like one-to-one intensive work is really different than population level education and prevention work, and that's his thing. So I agree that we should kind of be able to look at the Ben Lapine Healthy Schools partnership in a longitudinal kind of way, but I also don't think that we can extrapolate to say that, and we're going to do this with the sisters and the Redmond school districts too.
Let me adjust the language a little bit. So yes, I think when we go to deliberation, we're going to be deliberating year 2 of a 3-year program and what we want to do as a budget committee around that. I think at some point or another, when you have a hammer of a program, the whole world looks like a nail. There might be other programs that other districts are going to request or try and do, and that might come up for a future debate, and I'm not going to worry about any of that. I'm just looking at where this program can go and how it's gonna go, and some of the, and that follows along with some of the conversations of how other counties are starting to look at this as the bellwether model of the way that we do things. And I think the county long-term needs to think about, if I'm driving this as a bellwether program, how am I doing it? How am I converting that from, or how am I offsetting the program? Because we're talking about offsets with state funding that we're gonna go lobby for, or with federal funding that we're gonna go lobby for, or any of the other things. So that was where I came with the 10-year thing of, show me some of the permutations of how this thing is gonna go, so that it's not gonna suddenly turn into, another, $5 million sitting currently on the county taxpayers. That is for later, and that won't come into how I would deliberate on this, but I just think that, I'm just recommending that the county really think about that, because this is something new, and it's something pretty substantial.
Jim, from a historical perspective, when I started as a commissioner, Deschutes County kids were always at the high end of things that you don't want them to be at the high end. Vaping, drug use, alcohol use. Our kids were always at the higher end, and so that was why I had originally thought that, we've got to do something to change what's happening in Deschutes County. This is really trendy. I don't know what school it was that had 400 of the 1,200 kids vaping, but truly, we usually have a lot of, our kids are way more exposed.
My little note that I wrote when I first read this, a week ago, was get them early before we have to pay extra late. So, yes, I see where you are on that.
I know, yeah.
The model that we're using establishes a 0.5 FTE at each middle and high school. And so if you're thinking of scale, it wouldn't be to the extent that you're thinking of with a public health specialist at each of the elementary schools. We're really...
And I didn't say that I expected that, but I expected that at some point or another, this program would have to extend into the elementary schools, and I'd like to see the permutations of how that would happen.
Yeah. Yeah.
So maybe a note for Cheryl for some complex financial modeling.
I took mental note of that. That kind of modeling is helpful on many levels for us. And the way I think of things is really, from an economics perspective, is on the margins. What's the marginal gain here, right? So I appreciate the question, and we need to do further modeling to unpack that, for sure.
And you're not the only one that's going to get my request to do this. It's, again, I just found a really cool tool as we were having the discussion. Yeah, I think it's to the benefit of the county, and as a result, to the benefit of the county budget planning process, to think more like that as we move forward in certain areas.
Yeah, thinking along the margins. I totally agree.
Yeah.
I totally agree. Yeah, makes sense.
So in the big picture, this was corporate activity tax. State legislature says, oh, don't worry, it's not a sales tax, it's just corporate activity. And here's money for the schools. Then the money came to the county and said, hey, we're going to do a partnership program. We've got a great idea. How about you guys kick in and help fund this program 50% with us? And now it's year 2, we're talking about 56% at the county. So as I say, I voted no on this last year. It was supported by the budget committee. But now we're in a spot where, just a little bit more from the county. It's very frustrating for me. And this is only the financials, obviously. That's the bad part. Obviously, it'd be great, let's invest in the kids and do this. But the school district's great idea, and now we're already taking on a little bit more of the responsibility.
That might be helpful to explain, Cheryl, why it's 56% now, or the proposal.
Yeah, and it's 56% this year because we are increasing the FTE to full-time. And Ben Lapine School, I don't want to speak for them, but I do understand that they have a maximum of what they can contribute for year 2. So we would be absorbing that additional FTE to implement the program based on year 1 lessons learned. But it does go back to 50-50 in year 3.
And we are reducing 1 position as well. So we're saying instead of 6 part-time positions, we're asking for 5 full-time positions, but there is a front cost to that, front-end cost, front-load cost, what do you call that? There's a cost at the beginning to this shift. Yeah.
And we'll save on PERS and health insurance,
Right.
retirement health insurance later.
And from an evaluation standpoint, in order to be able to assess how effective our program is, we have to be able to implement it fully. And so currently, we're implementing at 80% with our current staffing model. And so in order to be able to really measure the effectiveness of our program, we have to get to that full implementation.
Well, and it's a shame, it says, due to significant budget deficits expected in the school district. So, last year it was, hey, we got some money, why don't you partner with us? This year's like, oh, woe is us, we're not sure we can do this. So I'm just pointing out that it's kind of awkward partnership at this point.
And that will likely fluctuate with the changes in student enrollment because the schools get their funding based on how many students are enrolled, and they had a loss of enrollment this last year. And so we'll see the budget impact for them next year, and then their enrollment's going to be increasing next year. So then they're going to be even more stretched because they have a lower budget with more students because of the way that budgets for schools works.
Commissioner, you're right. I think it's a fair point, really, and I want to acknowledge it. Yeah, it's a fair point that it should be 50-50. We're trying to not lose the baby with the bathwater here. We need to restructure a bit, get ourselves well positioned to reach the youth. And this is the best model for it. And I realize the county would be absorbing the additional $80,000 this year. And it may not seem fair, but is it good for our youth? Yes. So I hear you, and I wish it were a different model.
I did approach Laura with this question about year 3, and she did indicate, if you look at our table, we're actually coming under our projected costs, and I asked, could Ben Lapine Schools continue to dedicate the resources that they had originally identified, which was actually, no, 385, 430, which would then put them at year 3 supporting 51% and the county 49%. So just wanted to put that out there.
Round out the big picture here, and it's just the funding, obviously, I'm talking about.
Yeah. Fair enough.
Would it be helpful, it's still relatively early on Thursday, would it be helpful to get some kind of letter from the Ben Lapine School District laying out their intentions, if not commitment, to 50% or more next year?
No, we don't need to take it any farther.
I don't have any further questions.
Okay, Dan.
Okay. I think that's it for health. Thank you.
Thank you.
Thank you
so much.
I certainly appreciate all the time that Health is putting in. Again, it's my first time here, but I get the impression that so far you've spent about 2x the time that you have in previous years sitting in front of us.
Did we discuss the CCBHC? It was on the list.
It's in the proposed.
Okay, but you did do some of the others that were up above the line.
Yeah,
The 5 positions you did, I thought we discussed that.
We in the beginning, I said the four items that have no general fund implications, I didn't have any questions.
Nor do I.
But if you want to ask questions about some of those now, then let's do it before we lose.
No, the CCBHC wasn't on that.
Are you talking about the?
The 337?
Priority 7.
Yes, priority 7.
That was among the 4 that are above if you look on page 201.
No, it's not above the line. It's below the line because it's on their sheet of special requests.
So you're.
It's down
We're
here.
looking at different lists. So in our main binder,
Right, I'm looking at the main binder and it's below the line and it's $337 or something, isn't it?
That's the health officer.
Oh, that's the officer, okay. Well, it was on their list here. And I don't see it up above the line.
You're talking about item number 7?
Oh, there's no price with it, yes, item 7. So that's not, it's above the line without a price? Is that what we're?
Yeah, because it's a conversion of limited term to regular.
And it's funded by behavioral health, correct? As opposed to general fund, so it was in the proposed budget.
Okay.
The total cost is that, you're right, that total cost is at $377,695, but I believe that is being covered by CCBHC and other funds for behavioral health.
Yeah, it's a mixture of capitation and aid and assist funds.
But on this sheet, it says that they're adding 1 FTE from the proposed. And yet, up here, it's talking about 3 positions. So there's some inconsistency.
There's 2 limited term duration positions and 1 added position that is currently filled that terms June 30th, 2022, and we were requesting to add it and convert to regular, and it's fully funded. It's the aid and assist peer support specialist. The other 2 positions are also currently filled, also budgeted, and are limited term, ending next September, and we were asking to convert to regular.
So on item number 7, then you're saying that 1, that's not for, what's that one for, Janice? On item number 7?
It's for behavioral health.
Right.
And it's a current limited duration position that ends June 30th, 2022. It's an aid and assist peer.
And it's not limited duration, but it does end on June 30th, as currently scheduled.
All 3 positions are limited duration. 2 of them end September of 2023, so they're in our budget, don't technically need to be approved in terms of legal FTE. That 1, that is also at the pier, ends at the end of this fiscal year, so June 30th.
Okay.
The expense is in the proposed, but we have to legally approve that 1 FTE to add it in terms of FTE numbers.
You're just trying to make this a 1-year thing rather than drag it out over a couple of years.
No, we're trying to add the aid and assist peer FTE.
There's the 1.
The 1, and then make them all regular positions because they're funded.
So you're trying to
Yeah.
address everything this year rather
Yes.
than drag it out over some number of years.
Correct.
The 2 you could deal with
Yes.
in September, theoretically, but we'll just get it done now.
Correct. And we have people in those roles who I think, would love to know that we can pay for them and they're part of our budget and they're in a regular position and we're going to go forward.
Thank you.
Commissioners.
Thank you.
Jim, thanks for your kind words.
Thank you.
Appreciate it.
Okay, Dan.
No, it's just rather
I'm actually gonna, just so we can
consistently.
kill 2 birds with 1 stone, maybe if Cheryl and Janice could stick around for the budget decision. I had briefly brought up yesterday, kind of the idea of an as-needed general fund transfer to Fund 270, which is the behavioral health reserve fund, which is projected to end at $12.3 million or so in fiscal year 23. So I just want to speak to this idea real quick. Health submitted a proposal. I appreciate them working with me on this because I know it's a difficult conversation. But the idea is that our general fund is decreasing for operations. In some years, we transfer, on average, around $2 million to the behavioral health fund, and at times their reserve, Fund 270, which is specifically used for behavioral health, grows at a rate greater than the general fund that we've sent in. And so what this does is it would funnel excess, or not excess, but additional general fund based on a number that behavioral health has decided is okay with them for an operational reserve level. It would fund that back if their reserve hits that level. So Cheryl sent a proposal of $12.2 million, which is the ending fund balance in Fund 270, plus a beginning working capital of $6 million in the behavioral health division within health services, which is an increase of beginning working capital of approximately $1.2 million for next year to cover contingency and other requirements for them. And so what that would mean is that if, at the end of the year, those funding sources that we saw came in, and maybe there were vacancies or something else, because, to be frank, the reserve has grown, and at times we've seen a projection of it going down, that if it came in over those numbers, then the general fund amount over that, not including IDD, because that has to be a general fund match, so there's about $1.1 million eligible, would flow then back to the general fund. And we do this with
Yes.
CDD as well. And it helps decrease the volatility of our general fund. It ensures that we're not, and actually kind of stabilizes reserves as well for behavioral health. So those are kind of the pros and the cons of that, and just want to open that up for discussion and let health services speak to that as well.
And just as we get started, Dan, I want to agree with your comments, because the whole intent of the general fund is to provide support where it's needed. And if it's not spent, then it's not needed in that fiscal year. And if it needs to be requested the subsequent fiscal year, it can be requested then. And having experienced this in the community development department for years, where money was returned, and it's not to say that it wouldn't be funded in the subsequent year. It would be.
Right.
But yeah, I agree with your
Right.
recommendation.
Because the general fund supports not only the departments within the general fund, but also 20 million in transfers out to other operations. So it's just saying, if we think this is a healthy level, and it's certainly not going to impact service levels for behavioral health, and in the next year, fiscal year 24, then this would come back to the general fund, and it would be an ongoing conversation about that number, so that we make sure that we're being cognizant and respectful of the needs that health services has in their reserve level as well. So it wouldn't just be, okay, this is we're always going to be set at 12.2. Behavioral health continues to expand and grow, and that's a need, and so there'd be a conversation every year around that. And if there is some volatility around health services revenue, and they have to transfer $4 or $5 million out of their Fund 270 just to support behavioral health services, then I think there'd be an expectation that, we wouldn't have this conversation, or we need to fund more general fund, just like any other department. But it's kind of a way to, as Nick spoke to, just make sure that we're able to have the money in the general fund to fund those operations at the time when we need them. Try to make everything secure. So those are the kind of the pros, and I want to have health services talk about it, because it's a big deal.
Are you sure you want me to?
You're the one that's passionate about it. You just said that.
I'll let you do.
I understand the need for the proposal, and I think the proposal is fair. I think the caveat I have is that the reason we generated this much reserve was because we made smart decisions about applying for grants, because we weren't sure we would get CCBHC prospective payment revenue. So we generated this reserve as an accident of good planning. And at some point, we do have to spend some of those dollars on addressing the needs identified in the Certified Community Behavioral Health Needs Assessment. So that's just my one caveat, is right now it looks like this glowing amount. I don't think it's going to stay there for lots of reasons. Hopefully it doesn't go away completely. Our commitment is to be good stewards, but we have a commitment as a certified community behavioral health entity to assess community need and meet that need. So that means we may spend down some of those dollars bringing a proposal back to this group after we've had a certification site visit, finished our needs assessment, identified the unmet need, and returned with a proposal. So that's my caveat, is in the end, those dollars are intended for services, either to protect existing services or add where need demands. But I think the proposal itself is fair. If we end up not needing that additional revenue, why would we not return it to the general fund when there's need elsewhere?
I mean, I do want to connect this to tin cupping, which we just discussed earlier. I mean, as Jen just described, this reserve exists because of aggressive tin cupping.
Yeah.
And this budget committee and this board of commissioners has placed that expectation upon health services for many years, that you want to do something cool, you want, or that you think is important, or you think is innovative, go find someone else to pay for it. We'll maybe contribute a little bit. And that is the approach that we have taken to health services. And that is why, on a certain year, or on certain years when revenue that behavioral health was tin cupping came in addition to being reimbursed for services, this reserve was built. And so in some ways I see this reserve as as the money that behavioral health has to do those things that they think are high priorities and to do things that they think are innovative in advance of when the Board of Commissioners or past budget committees have been open to them. And, I wouldn't want to, I want to protect that capacity because our behavioral health division does do incredibly important work that that we have evidence has impact, and they are innovating on a regular basis, and we're recognized for that around the state. So I understand what we're trying to achieve with this policy, but I guess I want to push back a little bit, or potentially advocate for the threshold that we set to be a little higher, because we want to leave room for that prioritization and innovation to happen.
Sure. Yeah, and I've asked health services what, that wasn't my threshold, that came from them, so I don't know if that allows for the innovation. I don't know that off the top of my head, but I think behavioral health budget is usually around 40 million, and it's $12.2 million reserve, so that's a 20, or no, that's actually a 36 or 30, yeah, 36 or so % reserve on the operational budget. I think, which is, if we look at other counties, and I think Cheryl spoke to that, that's a healthy, that would be over most other reserves, and I'm comfortable with the 12.2. And also, the only other thing I would say is that because we're having this conversation now, the idea is health services, and I was there when health service had to come and kind of ask for general fund, is that there's a collaboration between finance and health, and we take this frequently, so that if health services is ever in a spot where there's volatility and they're saying we have to get rid of $4 or $5 million in transfers, and we're not sure we're going to have enough to do those innovative things, then finance can come and collaborate, and it doesn't just come to the budget committee all of a sudden and surprise everyone, because we're working together and know that. But I hear what you're saying is that they've done some incredible innovation and have just been real leaders in the state and in the country, frankly, with the stabilization center and stuff. And we want to make sure there's enough not to cap that innovation.
Sometimes doing a good job means you're covering for the mediocre around you.
Their actual beginning net working capital from July 1st of 2020 has increased 6.7 million. So if you look back,
Sorry, Patty, I didn't hear you.
it increased 6.7 million from July 1st of 2020. If you look at the beginning net working capital for Fund 270. So truly, the last couple of years, it's built up more funding.
Yeah, and a couple of thoughts around that. One, vacancy rates were much higher than anticipated. Obviously, we've talked about that quite a bit. But also in beginning working capital around COVID funds, you're going to see that drop in there for funds that were basically given to us, but we're carrying and then drawing down on. So those two things make up a lot of that beginning working capital. This is very much a compromise that we've been in conversations with the finance department around what that number could look like. And so I think that this is a fair compromise. Do I love it? I don't. But it doesn't put us any worse off for fiscal year '23 than what we know today. financially if we come to that agreement. The impact is that, or the reality is, we know that we need to expand based on our preliminary needs assessment, and we also know we have space concerns. My hope would be that when we do come forward with some of those proposals or recommendations, it's a healthy discussion around expending those funds with that consideration, also knowing that we're coming to this agreement today about potentially returning county general funds that may or may not be needed, depending on what perspective you may be coming from.
Nick, do you see CDD a little bit different because it's based on fees versus health, which is based on grants?
Yeah, thank you. Good question. Dan and I were just kind of chatting offline over here just a moment ago. I really think it's going to be the case for a lot of departments, is if we're providing general fund support for something, it's because they need help. They don't have the revenues, or whatever the case may be. And this is going to be a conversation we're going to have as the day goes on, just with the declining general fund levels. And it's just going to be important to keep that healthy. And so, it's a good question, and I think it's going to be really a policy question for the budget committee today and going forward, of whether we ask not just health services or CDD to return those funds if they're not spent in the fiscal year, and then to include those in the next fiscal year, or is it kind of a department by department, case by case basis?
And part of it, and just part of it is we do have departments that cannot leverage fees that are getting substantial transfers out from the general fund, and they may need to expand in the future too. So it's just saying, if we can agree that there's some additional revenue, which may not happen, behavioral health could quite likely potentially decline their Fund 270, in which case nothing would be returned, right? We're giving it all to them. It's allowing that to go to those other 20 or so departments that we transfer out funds to general fund if it's needed for that. So that's kind of the pro and the con there. The con is that it's not maybe increasing health services reserve to an even higher level. And I would say, though, that this doesn't mean we're capping health services reserve, because health service could quite potentially, and they've done it in the past, so nothing surprises me anymore with CCBHC or capitation numbers. Their revenue has gone to $4 or $5 million, and we've sent $2 million behavioral, or $2 million in general fund, and they've had been able to put that whole full $4 million into the reserve in the past. So this is really just looking at that general fund access. So, but as Nick said, it's a budget decision committee. It is a compromise. I just appreciate having the conversation. So.
And I think what I will ask respectfully is that history be recorded and remembered for future. Because, we live in a world where we are bringing these decisions to boards made up of elected officials, and as we all know, that configuration can change and history can get lost in the discussion. And what I want to reflect is, for the last 3 years, we've either given back actual county general fund. I think we gave $500,000 back one year, not that long ago. And we have reduced our percent of general fund commitment in behavioral health every single year. So what I really want you to hear is, we are trying to be fair. We take our stewardship of public resource really seriously, and we want you to be here for us when we need you, and we want this conversation remembered. That's our real ask.
I think that's a very good point, and that might be a good item for the budget message. Ultimately, we were talking about what should be in a budget message, and this type of decision, policy decision, is a great item to put in the program budget message from the budget officer.
That's a good way to put it, and then that's also a great thing to be able to store on a PowerPoint slide so you can throw it back in somebody's face later on. May or may not.
Put the date in the bottom corner, too.
We try not to throw it back, but we do remember it.
Well, don't write it in pencil. I always write things in pen. I need to save it and date it.
I wanted to ask about Cheryl's point about the future facilities needs of behavioral health, and ask if there wasn't some way. I mean, the reserve that you have is broad, it's not so bounded, right? So, if there's money flowing back to the county general fund, or if there's, if the reserve is building beyond a certain threshold, is there a way for us to start kind of putting some funds specifically into a capital reserve for behavioral health needs moving forward?
I mean, there certainly would be a way to do that, and that could be a conversation with Lee and Fund 463. I would say in the past, the purchase of the North County came from the Property Management Fund, which came out of General Capital Reserve. The North County Expansion Building came out of the 463. So we have historically, recently done that. The General Capital Reserve has funded health services in their expansion as opposed to their personal behavioral health reserve. Although I know that we have asked them for about $1 million, or I think they're
We've
supplying
budgeted $1 million for furniture and
furniture,
fixtures.
right?
Yeah.
Because that was something
And
463
remodel
when it funded
this year.
remodel,
Yeah.
right? So, but I think you could always certainly, when you transfer out that capital reserve to from Fund 60, our general capital reserve, to Fund 463, it could be earmarked for, this is for a health services project. They have space expansion. Sure, as part of our 5-year plan.
That's one way to remember things.
Yes, it is.
To create a dedicated account, or.
And that would be, that would be another budget committee decision.
So is 463 supposed to be in our binder?
Yeah, we handed that page to you.
That was the page that was missing.
Yeah. It was in
Okay.
there. I was just going to say that some of our other departments, like solid waste and even CDD has had a facility reserve. So it's not uncommon for departments to set aside revenues that they don't need for operations, knowing they're going to have some space need or some facility remodel needs or something. So I could see, that could operate here. We could add a reserve fund for facilities to health, and then they could figure out which revenues would be eligible to set aside to meet that need in the future. And I don't know how much, resource would really be available to kind of shave off and send to a reserve like that, but it could be one way to do it.
Right.
And that would be clearly earmarked for health. It would be in their series of funds, and it would be kind of their decision each year about how much to put in there and what the character of that revenue might be.
I would just add, if we're talking about another building right now, I think just our initial conversation with Lee kind of around that potential health need was about, it was far more than you could fund in liquid capital, right? It would have to be debt service too, which would also be another potentially debt service in the future, depending on where our revenues are. But I would just point that out as well. If you're talking about a major expansion or something the size of Courtney or slightly less than Courtney, then you would have to do something like that. So, and then we need to look at debt service reserve levels to make sure that that's our full faith and obligation. We have to pay that off first. So, and those are some kind of like future long-term planning discussions that we probably need to have with facilities and the board and health services if that's a priority. And
Actually, facilities is kicking that off. They're looking at kind of different master plans. You've heard about the public safety master plan, and they're looking at doing a kind of a downtown master plan because of the space needs at the DA's office and others in the downtown core. So the health department is very much at the table, or will be at the table, but the effort will be led by Lee and Christie.
So can this discussion of some kind of capital reserve be integrated into the policy that we're considering, or complementary to what we're talking about right now?
Well, I mean, the Budget Committee's purpose really is to, appropriate funds, and, I think there need to be some discussion about what kind of funds might be set aside and how much and how relevant that might be over time.
I mean, because the policy we're talking about, this kind of threshold for reserves, that's speculative, right? We're not talking about, I mean, I guess it's speculative for this year, but I don't see how discussion of another place those reserves could be going is any different than.
I would just say if you're saying it would be in the details, but if you're saying, okay, if it's over and above the 12.2 and the 6 million, then that would be the additional general fund revenue. And so if you're only assigning it to a health services capital fund, then it cannot flow into community justice juvenile or victims advocate or DAs or something, or any of those that need it if our operating continues to drop. And, I think there's about 500,000 in general fund requests, 800,000 in general fund requests today. If they're approved, that will drop our general reserve level to 1.2 million. So we need to have a revenue influx to keep supporting operations and things like that, as will be discussed this afternoon. So I just think that's important to realize. The concept is that if there's additional revenue that isn't affecting behavioral health service levels and expansionary needs for next year, that it goes back and flows to maybe other areas that might need it. And an additional capital reserve for them would essentially kind of defeat the purpose of having that revenue go back that way.
So could I just do a quick reality check here? Because there's a lot of conversation I want to make sure I'm tracking. We're not capping the behavioral health reserve. What we're saying is we're capping how much general fund we keep if we get to a certain level. So what I want to make sure Budget Committee members understand is the total general fund revenue in behavioral health right now is 2.1 million. So we're not talking huge, it's a substantial amount, but what I'm saying is that's not going to buy us a building. So maybe we're incredibly fortunate and we generate a lot of additional revenue. We end up with reserve. We can't find a reasonable way to spend it. We can spend those dollars on behavioral health services, but health services capital expenditures are bigger and broader than behavioral health. And so even if we returned all of the general fund we received now in behavioral health, the county still has, clearly thinking to do about space needs and costs associated that will far exceed that 2 million that might be returned in some amazing scenario where we're returning. So I just want to make sure we're grounding this whole policy discussion in real numbers and, what it actually means in the real world, what dollars we're talking about.
I would agree with Janice. The original proposal is basically just for operations. Are we sending it back for operations for the general fund? Because
right.
The reality is with our general capital reserve, we need to build it up to start paying off the debt service next year for the courthouse. To even add another building into that is a long-term kind of plan around revenue and expenditures and capital planning that we don't have the answers to that today.
The way that I would think of it is there are capital building needs in front of the Budget Committee this year. None of them involve behavioral health. At this point, there's a recognition that at some point or another there will be something in front of the Budget Committee that will involve space planning that includes behavioral health. But I think that's going to come from a policy-based master plan that is going to be driven elsewhere in the county processes.
But
there's some short-term needs too that'll probably come to the board.
Isn't North County campus part of our budget discussion, capital discussions for this year?
It's built into Fund 463 from the general fund capital reserve to conclude this year. Right. So it should be done this year based on that general fund capital reserve transfer.
Yeah, and we had that presentation and discussion.
One of the things I'm getting hung up on here is, so we're talking about working around a certain threshold for behavioral health reserves, but if we literally decided at this moment, well, you could take a chunk of those behavioral health reserves and put those into the North County campus building, where behavioral health will have some, will have some space and offer some services, then it throws your initial number, the number that we're kicking around, into question, doesn't it?
I guess I'm I'm not understanding that. We've budgeted for the North County expansion out of 463, and health services is budgeted for the remodel out of Fund 270. There's a transfer out. So I'm not sure what we would throw more. I'm sorry, I don't understand, Commissioner.
I think the space considerations that are under discussion now are in addition to, maybe I'm not supposed to say that, but we're, even with the North County campus, which brings some significant relief, we have some, I know that the DA's office is out of space, our DCDC clinic is out of space and has overflowed into other space, and our Wall Street Services building is completely, we literally don't have places for staff to go. So we've had internal discussions about short-term planning, which may involve coming to our elected officials and asking permission to use reserve dollars to rent space, which is not ideal, but oh my gosh, we have to figure out how to serve people. And then I know that Lee and Christy and Eric and Nick are involved in a longer-term plan for space, and I think that's maybe what Dan is thinking about. And again, because the total amount of county general fund and behavioral health is not going to solve a space problem, but it could offset operational costs when you're in a year where you're really talking about difficult long-term commitments financially to resolve countywide space issues. So I get it. Like, I get the ask. I just,
Well, if I can summarize a little bit, there's a proposal and a discussion that we're going to have around potential return of behavioral health general fund as a finance decision. There's a statement of, we don't love it, but we're not going to oppose it. The budget committee at some point or another needs to deliberate, hopefully today, because we won't have time tomorrow, on the exact numbers and the exact number on how that's going to go this year, with a promise that it's going to get addressed every year moving forward. Is there other things that we need to do to put it nicely, waste your time, or or are we good?
I'm good.
I appreciated the discussion because it really matters to us, and I appreciate having a chance to hear you all think about it and talk about it, and so thank you. Didn't feel like a waste of time to me.
All right, thanks. Yeah, I think we've got enough to make a clear decision, and we'll let you folks go.
Okay, thank you. Thank you for your service on this committee.
Can we take a short break?
Sure.
Let's do that right now.
Okay.
I may not be putting a
We used to have what we call the strategic line, and we also had our budgeting process, our product and business.
Just a reminder that by 11:30 or so, we'll need to have a hard break. The compensation committee needs to meet at that point, so let's go ahead and Dan, lead us off.
There had been some discussion yesterday at the end of the day about folks we might need here to ask questions to regarding special requests. And Joe Brundage is here from the sheriff's office. Oh. And so let's just open it up. The sheriff's office has, are there any questions regarding, well, first off, let's just ask, what are their questions for the sheriff's office?
I got to admit, I think I was the one that requested it, and it was going to be some questions around the legal assistant. And we had the conversation earlier about the PIO in terms of make a decision and decide the organization later. I think that same conversation applies to the questions that I had about the legal assistant.
Maybe take a moment for introductions, because now we have new people.
Oh, okay. Hi, I'm Jim.
I'm Joe Brundage, the business manager for the sheriff's office.
Kerry Coliani, counsel for the sheriff's office. I apologize for my my appearance today. I cough uncontrollably because I have an allergy, and I just went to doc to get medication. Hope I don't fall asleep, but I'm fine. So if I start coughing, I have this. So,
Thank you for coming.
good morning, everyone. You bet.
Is it juniper?
Yes.
Okay, we need to start getting rid of all the juniper. We just got a.
There's another reason to get rid of it.
I would vote
250,000.
yes on that.
Yes.
So, Commissioner, I grew up in Pocatello, Idaho. Junipers, I had allergies. I moved to Boise for many years. No junipers, I was fine. Now I'm here.
Yes, it takes a while to accumulate.
It does, it does. Thank you.
So, yeah, Jim Pfister, public member, Judy Trigo, public member, and Bruce Barrett, chairing this is our public member, so just so you have a feel.
So, actually, while we have you, so can you give me just a paragraph, a quick statement or two on what the need is for the legal assistant and why very specifically that legal assistant should sit in the sheriff's office as opposed to elsewhere in a legal organization?
Yes, sir. So maybe the best way is to give everyone a snapshot and then stand for questions on it. But it's pretty straightforward. It's simple. The business of the sheriff's office has changed dramatically in the 4 years that I've been here, and here are the areas: gun rights and gun rights hearings, public records. For instance, now we've got a whole other area of public records requests we haven't had before: body camera footage, and folks have figured it out. And the problem with those two areas, and there are others, keeping them with the paralegal, is that it swamps her immediately. I mean, we need her for research and doing pleadings and helping with things that are paralegal things, but doing background checks for gun rights and the public records piece, that requires a lot of searching and working with our IT folks. You wouldn't want to keep those on the paralegal because that's more expensive time. You need somebody to do more of the clerical piece of those things. And we didn't have this book of business 4 years ago. At least we didn't have it to the extent that we have it now. It has ballooned in a way I didn't imagine, and prior counsel, Daryl Nakahira, we didn't see those things mounting the way they did. There's two pieces of it. Here's a third piece. As you all know, evictions and the things that go on in our civil division, dealing with evictions and sheriff sales, that's increased as well, and those are more clerical functions, those kinds of technical functions. And again, if you add all that to the paralegal's plate, pretty soon they become overwhelmed. And I've become overwhelmed. I actually, at some points, have to type things because of that very problem. And so this was a way to address that. You wouldn't normally think, and I understand, I mean, I've worked in sheriff's offices in other states and city attorney's offices. you wouldn't really think that that's going to be something that the embedded sheriff's lawyer's office would have to deal with, or those things would expand. But I think everybody's facing it. When I check with my colleagues in Boise, Ada County government, the same thing. The lawyer who's embedded with the sheriff there said, yeah, we're adding those same kinds of functions because the world has changed.
Okay.
Public records. So with that.
I have no more questions on that particular one. I have one more question otherwise, but.
Okay. Are there any questions, any other related sheriff's office questions related to any of the special requests on page 201 there?
So the one, just a general thing, basically, well, I guess there's 4 of the 6 requests, are a change in FTE, and these are all District 1 FTE, correct?
Yes.
So you're adding District 1 FTE, but you're managing to do that within the envelope of District 1, because I don't think you're requesting a raise in.
We're not requesting, yeah, we have enough capacity to add those people.
Okay. So just, again, briefly, a couple seconds on why the request to do the, I believe, 9-cent increase on District 2?
The 9-cent increase is because the rate previously, from inception in 2008 through 2018, was at $1.40. That was creating too large of a reserve. The reserve kept growing. We were getting close to 9 months of reserve. So we cut the rate specifically to drain the reserve. We were taking in less than we were spending. That was intended to be a short-term process. It lasted 4 years instead of 3, and now we're done. We need to move the rate back. But looking at the growth and what's ahead, we think 143, or that 3 cents higher, is appropriate to capture the growth we'll need going forward.
All right, thank you. I have no other questions on that.
Are there any other questions regarding special requests for the sheriffs?
I just wanted, Joe, you just said it lasted 4 years instead of 3 years?
Yes.
Okay, all right, so it started in what, tax year 18 then?
Fiscal year 19, 20, and 21 were what it was that was the original plan, was we'll cut it for 3 years. And then when we looked, we thought, we could maybe hold on a 4th year and not raise it. It'll be tight, and it has been tight.
Okay, so it really lasted 3 years then?
Yes.
3, okay.
Well, we've through the 4th year. This is 4 years. It's gone 4 years. 19, 20, 21, 22. Now we're talking about raising it in 23.
Okay. It'll raise it this fall.
Yes.
So that's actually 22.
Well,
Fiscal year.
Fiscal year. The fiscal year 19 started in July 18. So we started, the rate cut became effective in July 18.
Okay.
I have a little bit broader question. So, seeing this, what the legal assistant request, triggered for me, but which, I fully understand the specifics around this request, and I'm pretty comfortable with that. But we have seen a number of requests for positions in certain functional areas this week across multiple departments. So, like a lot of departments are asking for IT. A lot of departments are asking about, at least more than one department is saying that they need communications capacity, PIO capacity. The legal is one that there have been, legal capacity has been an area where there have been questions about what should county legal counsel be doing for the sheriff's office, and what specialized functions, legal functions, need to happen within the sheriff's office. And the third piece has been the use of outside legal counsel for some litigation. So I guess I would like to ask, as we're thinking about what functions should happen in which legal department, what the expectations are for future litigation with the sheriff's office, and use of outside legal counsel, and the financial estimates that have been placed around that.
So, Commissioner, excellent questions. And I guess my answer might be the same as what I gave before, and here's what I mean. So the nature of all that has changed, and the kind of litigation that goes with sheriff's office or police departments has become so much more specialized that in this country, people that do that on a daily basis and not much more, say versus planning and zoning or some of the other things, that's a specialty. And you'd want that, particularly if you're in federal court in the state of Oregon or any other federal court in this country, and you have to defend, for instance, a Section 1983 civil rights case. Just one piece of that, for instance, let's say there's a qualified immunity question, which I've handled in the federal courts in this country. People just do nothing but that. And they have specialists on attorney's fees in civil rights cases. And so in terms of this is my view, and I don't want to speak completely for the sheriff, I think he shares this. My view is that you want those kind of experts in those cases. It's like brain surgery versus pediatrics, in my opinion. If you're faced with a Section 1983 civil rights case over the jail, I think you'd want, again, I'm not saying that county council doesn't do a great job, they do, but maybe you'd want to think about having somebody that litigates jail cases in the Ninth Circuit Court of Appeals. Not to pat myself on the back, but if you Google, I've done that for both the city of Boise and Ada County, Idaho for many years, and I wouldn't let myself do that again. That's how specialized these areas have become, and that's just one book of business. And I guess it's a fair conversation to have between the sheriff's office and county council about how we think of that, including outside counsel, Commissioner, going forward. I'm ready to have that discussion. I think it's time to have that discussion. But when I look at it from my experience, I spent decades in it, and I wouldn't let myself litigate a jail case anymore.
I can appreciate that for, say, civil rights jail cases.
Yep.
What about human resource issues?
So obviously, those are different in the law enforcement context than personnel issues may be for another department of county government. Again, I find that being more and more specialized in this country. There are people in Oregon I know now that have helped us in other cases that do nothing but this kind of litigation for law enforcement, police departments and sheriff's offices. And if people ask my opinion, I would rather rely on people who are doing that every day in the federal court system than people like me, I'm picking on myself, that now I'd be a dabbler in that. I know those things, I've litigated those too, but I would say I would prefer to have somebody with a specialized knowledge in that area. Now, it's a great question, Commissioner. What about the average fender bender? Sheriff's office gets into and we have one right now, an accident because we're chasing somebody. And it's just a fender bender, but maybe there's a personal injury. That, I think that's less, at least in my opinion right now, specialized. That's something county council could do every single day because they would have to do that if, again, someone from planning and zoning got in an accident and somebody got hurt. Those things are different in my view in terms of civil litigation and defense work. But I think it's time. We're at the crossroads of saying, let's talk about that in more detail, about what cases we should keep in-house, what should be outsourced. I think it's time. I think that's a little above my pay grade maybe. I can certainly give advice. But I agree with you, Commissioner. Maybe it's time to talk about those things.
And can you give us any kind of budget expectations for what you're anticipating expending on external legal counsel for the coming fiscal year?
I'd have to get back to you on what we budgeted for that. I don't have that off the top of my head.
I don't. I can comment about this. I think it was yesterday, I was interacting with county council about the number of active cases we have because we get public records requests about that. And we have 3 or 4 pending cases right now. That's the smallest number in any institution I've ever represented. I think that says something about county and the sheriff's office. That's a pretty small number. Any given week, in my prior jobs, I had 30 to 40 cases for police departments and for sheriff's offices. And this is one of the fastest growing counties in the country, and I think it shows good management that we only have a few cases. Now, they may be more high profile, and they may cost more. They do. When we get into the more high profile civil rights litigation, you're talking very quickly 6 figures. Just to get a case to sometimes summary judgment, as Eric and I know, or to trial, you get into that number pretty quickly. But to have only 4 active cases right now, that's a pretty good thing. Now, I would defer to Joe on what the coming year looks like in terms of dollar figures for what is essentially a very small roster of cases.
And, you know, I see a couple people are pulling out their blue binder and looking at line items.
I've got some.
Can you describe for us the pathways? Like what, you know, if you are retaining external legal counsel, what line items or what cost centers are does that flow through?
It's gonna be, I think, in either legal services or contracted services. And the way we constantly are Carrie's in contact with Dave Doyle, and a lot of the things that that we get will come to the county first, and Dave says, this is you guys. We don't want this stuff. This is for you. And so that's where with our legal assistant, like for example, she's getting overwhelmed where when she doesn't have anybody to give that to, it's going up to more expensive people to help cover her workload. And that's one of the reasons we want to put this legal assistant in there so it can be passed down to someone who can do the legwork a little more cheaply. But we try to have everything in-house except for with a couple people that we know, have served us, and there's cases in the pipeline that we have ready to do this. But we don't plan to spend an enormous amount of money. I think our budget, I want to say it's about $70,000, but I'd have to look for sure to see how much we've budgeted in there for that.
Thank you.
So half a step back, you were talking about how the cameras and the public records requests, the same justification goes for that IT position also. It looks like they go together.
Yes, we had kind of laid our intention when we presented the body cam project of we will need to hire someone, and we put that off as long as we can. And we're fortunate, we feel there's some jail medical software that right now has a lot of back-end support. We're switching to software that does not have that support, and we've been told you'll need an IT guy on site to deal with this, but it's going to save us about $35,000, $40,000 to switch to this software. So switching will allow that savings to go towards this IT person who will be part-time in the jail monitoring this program, but then we'll have other free time to work on body cams and do any of the other IT duties that are required.
Can I follow up, Joe? Commissioner, again, that's a very good point, and that was the point I probably didn't make as eloquently as Joe. You wouldn't want that IT time searching for body camera footage for the paralegal to be doing that. You'd want somebody who is doing that on a regular basis. You wouldn't want the IT lieutenant to be doing that either. His job is to run that department. So same reason. Somebody chasing or doing the research to get that information, that would be maybe at this level versus here, if you're going to do it effectively and efficiently and as cheaply as possible.
Well, making sure it's backed up and recreatable and archived appropriately, even if it doesn't come out. Yeah.
Yes, Commissioner. Now we have law in Oregon that tells us with body cam footage, and when it's requested, that kicks in a whole other area in public records requests that didn't exist before, and requiring people to actually do the search for these things. Paralegal searching for that for 2 hours, or the lieutenant, not as efficient and effective and thoughtful with the money. So I think we've done a good job planning for that. Seeing this come at us very rapidly, this entire area of body camera footage and the public records requests, this came along pretty quickly for the sheriff's office to onboard the system, body camera system in such quick order, and I think, in my opinion, well done. We weren't able to do it in my old agencies, cost, whatever else. I'm impressed, but then work comes with that, Commissioner.
So Carrie, the number in the finances for Fund 255 says legal research has gone up from, let's say, like 20,000 to 108,000. So this is for something for next year. You actually spent 81,000 the past year on it. So you didn't actually allocate enough, so you're putting in a little more funding. So what's that going to cover? Do you have any idea? It's called legal research.
Yeah, I don't have the details in front of me. I'll have to get back to
We
you on
can-
that.
Okay.
We can get our heads together and,
Yeah, legal, you've only allocated for a little less than $12,000.
yeah, that's,
Yeah,
talk about that.
okay. It seems like it's the research here that
The
you're,
research is probably where the line is.
right, it's where you
And here's
feel
the
it's an
interesting
issue.
thing that you probably wouldn't hear very much. So Dave Doyle's office and my office, we share for the recognized legal research tool, Westlaw, electronic research tool. I use that almost on a weekly basis. It's the same as Dave's office. Dave sets all that up, so we're working in conjunction with that, and we can respond immediately if we have a Section 1983 civil rights issue, find out what the latest Ninth Circuit case law is, if there's anything new out there, and Dave and I have been doing that for 4 years, and I think that's a very efficient way to do it, so we're sharing that resource.
And you even have an allocation for veterinary services. Is that for the dogs?
Which org is it in?
Well, it's in 255.
Yeah, either for the dogs or for the ranch.
Okay, that's what I was thinking.
I hope it's not for the lawyers.
No. Okay, thanks, Jim.
All right, any other questions for these folks? All right, if not, we appreciate it. Thank you.
Thank you very much for
Thank you very
joining
much
us.
for coming back.
Hope you feel better.
And then just
Fine, it's just uncontrollable when it starts up.
Just
Thank you.
one more decision point here, that there may or may not be questions. It's included in the proposed budget, but it's the $500,000 ongoing transfer in the future of that TRT to get Sheriff's Office up to 3.6. And while they're here, I just wanted to see if anyone had any questions for the Sheriff's Office again on that before we go to get a decision on that later this afternoon.
I don't have any further questions.
I don't have any further questions. Like I said, I had concerns about the supplemental TRT request last year, but this year, we're seeing, I think I've seen better data about, the rationale for that, and B, the Sheriff's Office is also coming forward with a 9-cent assessed rate increase for rural District 2, and I think that demonstrates that they're not just trying to solve their fiscal shortfall by asking for TRT funds, they're taking a holistic approach.
Thank you.
Thank you.
All right, Dan.
Yeah.
Lead on.
Well, that was, sure, based on yesterday's end-of-day conversation, that was all the questions for special requests, so we might actually be running a little ahead of schedule, or at least be able to start budget deliberations here. And I was thinking we'd start off budget deliberations with,
The 3.5 million to transfer to capital reserve, is that going to be?
Yeah.
Okay.
Yeah, so we'll have about, we will have 7 separate kind of budget decisions to make before we go down the list of special request proposals at the end of the day here. That'll be it. And then we'll be good to go. So I'll let the chair, if we need to take a micro break or.
Oh, I'm always up for break.
Or if we feel like we can keep going.
So what's next up for your discussion?
Well, we would actually have a vote on the TRT 500K to sheriff's office ongoing. There,
Ticking items off here.
we are at the end of
So
this.
you're
and ticking
going
things.
down to the portion that's set for 12-15?
Yes. This
Okay,
is-
so
this
you're
would
ready
be-
to,
And in some of these budget deliberations, it sounds like that first deliberation might go pretty quickly, but some of these others, this would be the opportunity for folks to kind of talk it out and to
well, so
express their opinion.
the other option then would be to do move up the compensation discussion, if Kathleen was available.
She should be. One question I have, this is my first time going through this whole process. Is it helpful to have your list printed out so everybody can kind of
Yeah,
see
I think it would be.
where we're going?
Actually, yeah, I think it would be very helpful to have. the
I
list.
love my paper.
We will.
Is that like an understatement or what?
So then take time to, kind of document it all or print it out for each one of us.
Sure. Yeah, we can do that right now.
There's no rush now.
So, yeah, if we took a break and if we could get Kathleen sooner than later, we could get that out of the way and then we'd have the rest of the time left.
Great. Okay, I'll coordinate with.
I just did.
Oh, you did? Whitney just did. Of course, she's always a step ahead.
Well, I know.
Yeah,
So then we'll
postpone that to the
reconvene at
discussion with, Ben.
12:15 after the whole thing, or try to do something before that?
So I'd recommend if we could get Kathleen now, we could have that conversation. That'd leave us
I
the rest
see.
of the time to
Got it.
have that uninterrupted discussion.
Oh, gosh, okay.
Which is the elected officials' compensation discussion, you're saying?
Well, we'd do that now if we could get that out of the way. Then
What time
we'd-
do you want us back then?
So that's scheduled for what, 45 minutes?
Yeah, so maybe in 10 minutes, if we're able to get Kathleen down and.
So an hour.
Come back in an
That'd
hour.
give you a 10-minute break plus whatever else you want to do.
So you want us back at,
11:45?
Yes.
Come back
11:45 is
11:45
good because I left so early this morning. My husband goes, is he ever going to see me again? I go, it's okay.
Can you go
We
to the
have-
bank for me?
Yeah, I'm going to the bank. Do you want me to go to the bank?
We have, that OSU
Oh, yeah.
letter is
Oh, yeah.
waiting
Give me your-
upstairs.
Give me your banking.
Commissioner, the commissioners indicated individually that they.
Yeah, so-
were supportive of signing.
So, yeah, I signed it, but as I was reading the bottom
Are you going inside?
Yeah, I have to go
I don't know if you want to say it like that, because the Board of Commissioners is advocating, but then
we have some auxiliary information to share and have a discussion.
Great. And I think we need to open as,
Do
or
we?
convene as
Officials compensation.
board.
It doesn't say that, but Wayne?
Man, I don't remember how that used to work.
I don't remember doing that.
I mean, I don't see an open public meeting, so it sounds like so it looks like this is just part of the agenda of the existing meeting.
Okay.
So we're reconvening.
That's the way I understand it, yeah.
In the existing meeting.
No, I don't think there's a separate meeting here necessarily.
Okay. Yep. And we are, and just to confirm, this is a public meeting, so it is being recorded, same as before.
And it's on Zoom?
It is. Yes, we have an audience. So I provided the committee some packet of information, as we do every year, and I know that we have some newer committee folks, so I also provided an overview just to kind of let folks know this is the Elected Official Compensation Board. And, you know, per the ORS, the county is required to establish this board, and this board's role essentially establishes the compensation benefits for the elected officials of Deschutes County. And the county has, designated that these duties go to the citizen members of the budget committee. So that is who makes up that board. So the role, as defined in ORS, is that the county compensation board will annually recommend a compensation schedule for the county elected officers. And the county compensation board shall annually review the compensation paid to persons comparably employed by other state of Oregon, local public bodies, private businesses, labor market, deemed appropriate by the board for each elective officer. County compensation board shall take into account such factors as the number of employees supervised, size of budget administered for each elected official, duties and responsibilities of each elected officer, compensation paid to subordinates and other appointed employees who serve in positions of comparable management responsibility, and prepare and approve by majority vote a recommended compensation schedule for the elective officers, and shall submit the recommended compensation schedule to the county governing body. So, and then just a note here that the only one mentioned in statute is that the sheriff's salary must be in a fixed amount, which is not less than that of any member of the sheriff's department. So we always have kind of those parameters to consider as we go through this process. So we have provided the committee here a summary of the comparables. And just to go over that, we have the positions that we'll be discussing: assessor, clerk, commissioner, district attorney, sheriff, justice of the peace, and treasurer. There's a couple of pieces there. District attorney is employed by the state of Oregon but assigned to Deschutes County, and so there is a salary provided by the state of Oregon. Deschutes County has in the past historically provided a stipend to the district attorney. So when we look at those numbers, that's what we'll see that split out there. And then additionally, the treasurer tends to be kind of a unique piece because it is an elected position that is also associated with our finance director or CFO position. And so there is a stipend associated with that. And so we look at that stipend in connection with the compensation for the CFO role. Salary data was collected from the following Oregon counties. This is who the county uses as comparables, and then who the compensation board has elected to use as a comparable population in the past. So we have Clackamas, Deschutes, Jackson, Lane, and Marion. So this is who we're looking at in terms of comparables. Benton County, just note, there was voted to be removed in 2017. Do not use them any longer. And then there's a lot of information in the packet here. Goes through some summary of COLA history, what we've provided in the past. There is a recommendation, which is page 4 of your summary, and those are recommendations from Human Resources. We have here primarily the goal with what the recommendations are here is to provide the standard COLA recommended unless additional adjustment is needed to meet the compensation philosophy of Deschutes County. Deschutes County's compensation philosophy is to be 5% above market average. Cost of living adjustment for FY23. I'll put a little bit of a note here. The standard COLA for unions and non-reps in FY23 would be 3.5%. However, the board did approve an additional 2% to make that COLA about a 5.5%. And so I think that'll be a point of discussion today. What's recommended here is that 3.5%. And if we want to consider either additional 2% or other numbers on this sheet for those elected members. The additional 2%, part of it was in recognition of inflation, where we are, where Deschutes County is in terms of cost of living, et cetera. So moving through that.
But just
Mm-hmm.
again, from a record standpoint, your recommendation is initial COLA, not the adjusted COLA.
Correct. So I think that's a starting point. That's in our recommendation, that's the minimum, and then we should have the discussion whether or not the additional 2% should be considered.
Okay.
Mm-hmm. There are a lot of numbers and a lot of Excel spreadsheets here. I'm not going to necessarily go through all of them. Yeah, I know, right. Yeah, that's why Terry's here. No, so this is Terry Lorenz, HR analyst in HR, and she is kind of the magician behind these numbers. Yes, so, and she's here with our large calculator in case we have some immediate calculation needs. So just to kind of walk through what is here, if we looked at the first one here, which is assessor, we look at things like annual salary, we look at total pay, which includes PERS contribution, any deferred compensations, and then other pays. So, different counties have different compensation packages, and so some include things like an auto premium or a longevity pay, et cetera. And so that's in here. I will say that there are some differences too in terms of our elected positions. Like I mentioned, the treasurer is a unique one. We do have the assessor here. Clackamas, Jackson, Lane, and Marion all do have assessment and tax. Jackson does not have tax. So Clackamas, Lane, and Marion have assessment and tax in that one department. At Jackson County as well, here in Deschutes County, we just have the assessment, and then taxes separate under the CFO. And then just to kind of read this, right? So if we go below that Deschutes County line, which you see there, we have a couple of different reference points. And we have the average of our comparables. And then we have the comparison of Deschutes County to that comparable, or that average. Below that, we have average plus 5%. And then we have the comparison of Deschutes County to that. We have a 50th percentile reference point and a 75th percentile reference point. A tiny bit of history as to why we have average plus 5% versus like a 75th percentile, which I think a lot of folks are more common to seeing either 50th or 75th percentile, is that when we did our class and comp study, when the county worked through that and came up with our compensation philosophy, in terms of receiving data back from our comparable, or from our survey, our salary survey, there was a bit of volatility in that 75th percentile mark and trying to anchor with that depending upon the kind of data we got back from the organizations. And when we looked at that, we found that an average plus 5% sort of helped to address that volatility, right? So if we only got back 4 responses, that 75th percentile, we're getting into some Excel and math here, but that 75th percentile can be adjusted, pretty dramatically. When we looked at sort of this average plus 5%, we saw that sort of become more consistent throughout all of our classifications and pay grade. So that's the mean. It actually, in the majority of cases, was very near to that 75th percentile.
I mean, generally in normal space, and you know this better than I do, when you're comparing 50th and 70th, you're looking at a very large statistical sample.
Correct.
So this skew is just way too
Correct.
high. What would be interesting, perhaps in the future, would be getting a Western governmental survey and generating 50th and 75th percentiles from that to see if there's any delta. But I'm with you that the average plus 5% is probably a better measure for the size we're looking at right now.
Correct.
Can I ask just a
Yes.
clarifying question? Just, this is the first time I read it last night. First time understanding it. So PERS contribution, there's the employer 6%. So does this represent the county's pickup of the employees 6%?
Correct, right. So the employer pays not 6%, but a
Or whatever it
different
is, yeah,
amount,
I'm sorry, yeah,
right.
okay.
And then the 6%, this is the employee, they call it the employee pickup.
So this includes, so we have the 6% employee pickup, and then we provide an additional 3%. That's what I'm just trying to understand. So it's ballpark, I mean, something less than 15%.
Oh, the additional 3% for the
401K.
Yeah.
I'm just trying to understand the full
Exactly.
compensation, okay.
Yeah, exactly. So yeah, so that's that deferred compensation, is that additional 3%.
Okay.
And then in our situation here with the assessor, we do have, since we're looking at that one, the longevity pay is included as well.
Yes, okay.
So that is what gets us to the total pay. Further down in there, we have we've added in the second in command, so we always want to look at that, as we read earlier, that the deputy director assessor, so we keep sort of that as a reference point as well, ensuring that we are, that we have space between those. And the note that's read here is that there was a recommendation from the comp board to maintain a 5% spread between the assessor and deputy director.
And is that only an annual, or is that in total or is that in T-comp?
I believe that the way it was applied before is that we look at the total pay columns.
Okay, so in this particular case, we're blowing it.
Correct, which is why, going back to my recommendation, or the recommendation, we're saying, 8% would get us back to that 5% above. Total comp.
So that's back to, oh, I see, no. There we go. Okay, so I understand the process, are we ready? I understand the process, I have no questions on the process. So I'll stop here.
So at this point, I would say if there are other questions regarding process, I'd be happy to answer them. Otherwise, I would look to conversation, recommendations, discussion from the committee on either recommendations or other considerations.
So we're just going to start with the assessor and go to the clerk and the commissioner?
That's how it's been done in the past.
Or whatever the boss says.
That's true.
Yeah, that's typical. I'm trying to find where the next person down would be. You mentioned that.
Oh, sure. So on the assessor, it says second in command right under.
So on page 6.
Yeah, on page 6. Sorry about that.
On the detail page.
Yeah, just go down.
Page numbers would have been helpful for me.
Yeah, so let's take a look at the assessor and have that discussion. So current total pay. Let's see, where's his current rate?
So he's in the dark blue. 158 is the total pay on that right-hand side.
Oh, so this is
158,
current.
Correct. Huh?
Today.
Today.
And now you're going to make me do the math.
So the key is, the recommendation is 8%. Take 158 and then it's 8% increase from that.
It is the total pay will be increased by a total of 8%. And
141.
that makes a magical number to the base pay. So it's not necessarily just
I see,
8%.
okay.
So
Yep,
so
yep, okay.
You have
So
that
that's my
number,
next
Terry.
question. So the recommendation that you're saying, let's focus on assessor, is an 8%. So is that an 8% across the board, or is that an 8% in base pay with corresponding across the board?
So I can answer that. So if we provide the 8% to base pay, then that will provide a 5% spread for total comp.
So it is to base.
And so it's to base.
Okay, so what would then be at an 8%, what's the total pay number for the assessor?
It would take him to, would take his base to 152, 338, 32. And it would take his total comp to 170, 628. And that would bring his total comp 5% above the deputies, which is currently, and this is reflected as of, with the 5.5% increase on July 1st, I've already calculated that in, so that we're not chasing it, right?
Because that's, oops, clear. It
And I'm
seems-
sorry, where do I see that?
Seems like it's still low.
The
I'm just gonna move it, sorry.
Oh, no, that's fine, I think she's got some double check.
Go back here.
We didn't
105.
include that calculation, yeah.
So, yeah, 5.1 above
Yeah.
is what you got.
Give or take, it's actually.
Rounding.
It's 5.2, yeah, no, I guess
5.11.
if we were to.
Yeah, so I'm having the same question. After we apply the recommendation, what's the number?
And that will be in addition to next year's spreadsheet, because I'm seeing how that would be helpful information.
Okay.
But for now, what we'll tell you is that that would take the total comp to
170, 628 for a 5.1% spread. It'll take their base to 152, 338, 32.
So the base is 152.
382.
And then after the other,
Everything's added in, PERS.
and that includes PERS, 401.
Longevity.
Longevity. Gets us to 170, 628.
Yes,
Correct.
that's correct.
So just a couple additional clarifying questions specifically on assessor. So the PERS contribution remains at 6%, and I'm not worried about the number there. The additional contribution is 3%, and is that 401K or 457 or a combination?
It's 457.
So it's 457 is a 3% deferred comp.
Mhm.
And what's the formula for the longevity pay? Does that change at all?
It's per every 5 years. And so I've already calculated if he was to go into a different bracket that he wants.
But he is not at this point.
Right, and it's calculated with the current rate, or with the new rate at $90 a month.
or $90.
It's $87.50 right now. and
It's $90 per every 5 years each month. So if you have 5 years, it's $90. If you have, right, yeah, got it, okay.
So there, yes, there's a formula. You
Yep,
mentioned
yeah.
Yes, there is.
And then, if I want to compare that to which number would I compare to the second in command of 162? Is it the 152 or the 170?
The 170.
And it's 5.11.
So this would go to
We did the
170
math
compared to
earlier.
160.
And what is the spread then?
5.11.
Okay.
From total comp.
And so this is fine. So this is.
Sorry, I'll speak more into the microphone.
Yeah. My only point is, so this is.
I wasn't paying attention.
Like that. Yeah.
Okay, so then let's compare that to other roles that are similar. I guess my next thought, who else can we compare that to in our county?
Within the organization.
Yes, correct. He's got, 40 people in the department, or?
Do you have that data, Terry?
How many people?
Oh.
36 in his department.
And as you're comparing that, just probably the one difference, going back to the question I was asking before, is department heads, for example, do not receive the additional 3% to the 401K. I think that's probably about the only difference if I'm from other department head compensation to
The
elected official compensation. Okay.
Are we still,
I'm just kind of
did we
processing
get
this.
rid of the match? It was like a 5% match.
The assessor is eligible for that, correct? For the 3%
That's what
match?
he's
Yeah.
getting, yeah.
Mhm.
But that would come out of the assessor post-tax pay.
Correct,
Pre-tax.
right. So,
Right.
so he would pay, and so that's what that 3% represents, is the match. So I would also have to say that this is included, assuming they're taking advantage of that match.
Mhm.
That's fair.
Yeah.
Yeah. Like in the past, the district attorney didn't participate in the match, so he didn't get that. employer portion.
I won't speak to other people's financial choices.
Okay, and then I have additional information, Multnomah and Washington, which are not two that we're using as comparables, 176 and 185. Not sure what all that includes, but that would be probably the full burdened number.
Just from an opinion standpoint, I think from the homework perspective, the 8% raise accomplishes all the things on the chart. We're deciding the compensation of an elected official. Typically when I've been doing compensation, there's some aspect of how well is the person doing the job. I don't see any data on that one way or another, so that's not something that we're planning to consider for any of them, correct?
Well, so our discussion about that in the past has been, there's some history even in our county where, forget what the title was, but the person was, in all accounts, was a failure at their job. But the compensation committee is really not the one who makes that decision. It's the voting public.
Fair point.
So that's why we never tried to address that here, because that becomes an evaluation on our part, and we don't have that kind of input. So we just basically judge it on the content of the information we have here and leave out the politics of it.
Okay, I like that as an idea. Thank you.
And then are we going to discuss the 2% for each one, or do you, as the process chair, or do you want to discuss the 2% at the end across the board?
Well, it would be easier to discuss it as the big picture.
Yeah. Do you want to
So we're talking right now of the 8%,
Right.
but that's the suggestion, but there's maybe a reason for an additional 2%.
So, and I think this one's a little different than, say,
Right.
some of the others, but, and not necessarily for a pro, against or for it, but just one comment would be that the 8% is a reflection of maintaining that 5% spread from the deputy, and the deputy director includes that 5.5%, right? So that COLA is included in their pay, and so the 8% would be to keep them at a minimum of 5% above that, right? The assessor above that, and so it's
Basically getting
included in the calculation in a way, but I think that, so just wanted to point that out for this one, and then I think in the district attorney is the other one that we have a recommendation that's more than just COLA, so kind of keeping those pieces in mind.
That's why I brought up the 2%.
Okay.
For this one.
Mhm.
The DA one, because it'd be different.
Great point.
Ask the question, as far as base pay, when I look at it, the deputy director is getting a 5.5% COLA. Right. And a 5% step. So to me, that's 10.5%, so I'm not sure how that math works when I'm looking at base pay.
Any thought on that?
Right, and so, but even with this, going to the new 152,
This shows step 7 for the deputy director at 148.
So the
That's
deputy
factored
moves
in.
at step 7.
This is factored in at the
And
at
it's
the top.
factored in. So the 5% that they will move on July 1st was factored in addition to the 5.5%. So the 10.5 was considered, and then the 8.8% is using that data.
So you're saying the 162 down here in second in command does include those step pay and?
Yes,
and
they're at
5.
step 6 right now. They will move to step 7 on July 1st.
Okay, so the recommendation was made in consideration of those two
That's
steps that, okay. Judy, what's your thought?
So my thought was the 10.
8 plus additional
Yeah,
2.
yeah.
Yeah, and what about the consideration that was mentioned of that being taken into account? So it really would be more than the 5 plus 2,
So it'd be 12 then.
yeah. And then an adjustment. Jim?
So hang on, so I just want to make sure I'm tracking here. So we've been talking about the 8. Your suggestion is the 10 plus the additional step move would push it up to 12. I mean, that's pushing, I mean, I understand the assessment above the second in command. It's pushing it significantly above the comps, but then, Bruce, you also threw the additional comps in of the larger counties that we want to grow up to be, and keeping and retaining the quality talent to do that.
We haven't done that in the past to use them as a comp.
We're not using it as a comp, but we're using it as a consideration.
Yeah,
We're looking at the comps and
exactly.
saying that, you know, the 170 would push well above the current, with an understanding that these current numbers are going to go up, because this is last year's numbers from the counties, correct?
Right.
Yes.
It's current, so they're going through the same process we are.
And where I could grab the data, I did. So for example, Lane County made their decisions in February, so,
So that one is
yeah, we
new.
could say that Lane County is current as of February.
Okay, but that's the only one?
Yeah, that is the only one. And they're usually chasing us.
And just,
So I think, yeah, we've got the concerns on the table in terms of what we want to accomplish. So maybe my recommendation would be a 10 to compensate for the concern and the steps.
I was settling at 10, so I'm along the lines of that.
Okay. What would the 176.28 go to if it was at 10 and at 12?
Yeah, I'll have to get back with you on that.
All right, you want to?
That's all right. The 10, I agree.
Okay, so are we making a motion? So I would move to,
I don't remember, Wayne, do we do these with motions or do we just agree?
I've never been in this meeting before.
Right.
Yeah,
Because I was the
he's-
treasurer, so I can't really.
other than Bruce, who's been in this meeting before?
motions are
The three
made.
of us.
Yes.
Motions are made.
I think that is true. Yeah, we do agree with the motion.
So I would move to recommend a raise of 10% for fiscal year '23 for the elected county assessor.
All right.
Second.
Got a motion and a second. All in favor?
Aye.
Opposed? Motion is approved.
And if I just might offer, just for clarification, it's, the 10% is on the annual salary, not on the total pay, correct?
Yes.
Just so it's clear on the record.
That's true.
Yes, okay.
All right, thank you.
We have to go a little faster, but I think we worked our way through the teething
Yeah.
times here.
Got some of the bigger questions on the table. All right, next is clerk.
Okay.
Any thoughts there, Kathleen?
Oh, our recommendation was the COLA because current base compensation already meets the compensation philosophy.
So at COLA, and that's the COLA of 3.5%.
Correct.
So at the COLA of 3.5%, what would those numbers be?
I'm looking at the assessors right now. We did not do.
Which we are.
Yeah, we
will.
will next year. We'll have a recommendation page that'll show that, at where it's at.
Oh, so there's no longevity in this, so it's actually a pretty simple number.
Yeah, currently no longevity.
So it really is the 132.7 times 3.5.
So the 10% on the assessor will take their base to 155, 159.
That's the assessor, okay.
And that will make their base at 4.3% above.
3% above what? Oh, their base.
That's just the assessors.
Okay.
Great.
So you said the clerk 137, but I see 132.
So it's 132.7 plus 4, or plus 4.5 is, should be in the 137 range at 3.5.
137 at 3.5, thank you.
But she's got a better spreadsheet than my brain.
Well, and you guys are on the 3.5%?
Yeah. But be ready, because I'm about to ask you for the 5.5.
I will, yeah. Let's move on now. Almost got a 35% increase.
Do that right.
So 3.5 will take them to 126,063. And what did you want, 5 point?
What's the total comp number on that?
Hold on, because I have to actually plug it in. It doesn't just automatic flow through. $137,409.
137,409, and then what's the total pay number on 5.5?
Yeah, hold on.
40064.
Thanks, Dave. I'm gonna sit here.
And that's for the total on 5.5.
Correct.
40064.
So at the 140,064, that's very well above the clerks and the others, but that's actually true of the assessor as well.
And I would say that the driving factor for that would be our internal. So, was it a couple of years ago, the board looked at the internal director compensations. And so that was one of the driving factors for increasing the clerk's wages.
Oh, the big COLA bump that you had in the historical?
Just the, looking at where our directors are in terms of compensation.
Yeah, I'm just saying, I saw a historical big bump in the clerk. And that was,
Yes.
because of the.
Correct.
Yep.
I mean, it's.
19.
To be fair, equitable, I'm sure I'm using the wrong adjective one way or another. I mean, I think if we're considering the 2% for one, we need to consider the 2% for all of them.
Mm-hmm.
So I think that I'm comfortable with the 5.5% number.
I agree with that.
Me as well.
Okay. So I would move to raise the base pay of the Deschutes County clerk to 5.5%, at a rate of 5.5%.
Second.
I have a motion and a second. All in favor?
Aye.
Opposed? Motion is approved.
Yeah, that one went much quicker.
That one went much quicker, but I bet you were about to slow down again.
Next one is commissioners.
They didn't get any COLA in 2020.
No, they did not.
Correct.
And what was the reasoning behind that?
The,
Economy.
significant increases the year before in the economy.
Okay.
Oh, so they'd gotten a 6% before.
And a 3 and a 5, kind of the years past.
Oh, so everybody got a rock last year. I didn't notice that. Okay.
In years past, there have been times where the commissioners declined our offer because of the economy. So we've always been sensitive to that, and we're not in that mode right now, and that hasn't been recent that they've declined, so.
Well, they look lower than everyone else except for Lane County, I think. Right?
Yeah, I noticed that as well.
Lane County is the only one above. Let's see.
Well, let's work the simple. What's the 5.5%?
Yeah, thank you.
At the commissioner.
Thank you, Jim. Let's make this. 20.
Say that again. 121,451. And again, I actually didn't ask on the other, but all these additionals are 457s. Is that true
Yes,
across the
they are.
board? Okay.
And so it take Bay from 115, 119 to 121, 451, correct?
Yeah, 5.5 would take it 121, 451, and then total comp for the commissioners at 5.5 would be 132, 382.
382.
So, yeah, what you just said, I think 5.5 would be on the annual salary 105, right?
On the annual salary, yes.
This is 5.5.
Yeah.
Yeah, that's what I'm thinking. You were using total.
Yeah, yours was the total comp. 121,451 is the T comp number on this.
Yeah.
Yeah.
Not
No,
this.
so 121 is the 5.5 on base,
On base.
and 132.
No, it's not.
No,
No, it's not.
because it's 105,614.
Let me see.
Okay.
Okay. I'm gonna use my calculator.
That's 111, 422.8.
Got it.
Yeah, so it's 111.
I was using David's number, so I'll just use that. 111, 422.7.
So it's 111, 422, 111.
And 121,451. That still puts them
451.
fairly low comparatively to the other things,
Uh-huh.
or to the comp counties.
It does.
But with that, my typical bent, and this isn't a political statement, it's a leadership statement, is that leaders are ones that should not stand out. So I'm personally fine with just a straight 5.5, even though that keeps that low. What we need to do is track and see long-term if we're punishing people for running for county commissioner here because the comparison counties are running ahead of us.
At this time, I'm fine with the 5.5, but I agree with you, Jim, that we need to track that long-term.
So am I correct in saying that 5.5 would put us in the 50th percentile or around that range?
Yes. It puts us just below the average plus 5%, but it puts us right about the 50% range.
So I'm okay with that.
All right. And again, because I'm on a roll, I would move that we adjust the Deschutes County Commissioner base pay by 5.5%.
Because I'm on a roll with my seconds, I second it.
I don't think there's too many more options. All right, all in favor?
Aye.
Aye.
Opposed? Motion is approved.
Okay, now, you said district attorney was the special flower, so
Well-
go that again.
Sure. So the district attorney is employed by the state of Oregon, assigned to Deschutes County, so they receive a state salary, which is currently set at $146,172. And counties can, many do, some don't, provide a stipend. The stipend, and I've actually messed up my math, so let me go to my sheet here. Our current stipend for district attorney is $42,630. we were to apply, so it gets a little fun, right, in terms of the total comp, because the PERS contribution and all of this, you know, we can look at both what the county ends up paying as well as then what the total compensation is inclusive of that state salary, but we have no impact on that state salary other than the stipend we provide.
And the DA got a significant bump 2 years ago, or sorry, 3 years ago.
26%?
Yeah, 26%, and again, that was a right sizing?
It was a right sizing, and we saw actually pretty significant stipends being provided at the other organizations, other counties.
Okay. Above the 46,
Right.
42,630.
So that larger bump was done in recognition of that.
Okay.
And do we know what the state of Oregon's COLA is for the state employee salary at 146? What?
I don't know.
I don't know if they changed, so the
I was just
district
curious.
attorney's a
Elected.
little different
Right.
in that it's based on like population and like their stipend's the same as you see all the way down as.
Yeah,
all
I
the
just
other
didn't know if that was
comparable
increasing,
counties.
just to inform the
Yeah.
committee's.
I don't, we're not
Board's
aware of
decision.
it.
Okay.
I looked and I didn't see any notifications.
Okay, I was just curious.
So your recommendation was 6%. If we're going by the way that we have been going, it would be at 8%.
8.6 on the 40.
On the 42,630.
That's the question.
Not the-
Correct.
Yeah.
Correct. Yeah.
So that would be 46,040 would be that number if I did my math right.
40, what did you get?
46,040 to the county stipend.
And that was at
Or
8%?
Yes.
Okay.
Oh,
Okay.
hang on, let me make sure I got that right. I
You
did?
Yeah. And then it'll take the
So it's 8.6 total.
46,040, take total comp to 197, 533.
There is a longevity.
No.
Is the longevity,
Yeah.
is this based on the current
Well,
DA or the
it's
new
added
DA?
in.
Because
Based
he's
on,
been
the
in
current,
office.
Because he won't be out going until January-ish.
Okay.
But there would be longevity included with the
Yeah,
incoming.
because he's been.
Because
for
he's a
while.
long-term
Yeah.
So,
employee.
so if we're voting a stipend, we're voting that stipend for the incoming DA?
Until next year.
Okay.
Mhm.
Yeah, the same just happened with the clerk.
So 197, 533 at the 8%? I mean, that-
197, 533 at the 8%, 46,040 for the base.
And comparatively,
So the 197 is the 5.5?
Yeah.
Is the 8%.
8.6.
and that again is a little low to the average 5, although it's it's well above the 50 percentile.
It takes them 2% above our 5, so it's basically 7% above the, yeah, they're within comparables.
So I don't see anything unreasonable about that.
No,
No,
I-
it takes them
Right.
7% above our comps.
I'm comfortable with that.
All right.
Explain to the
Move to approve an increase of 8% to the county stipend for Deschutes County District Attorney.
Second.
We have a motion and a second. All those in favor?
Aye.
Aye.
Opposed? Motion is approved. Justice of the Peace.
Okay, so this
Sheriff?
is a full-time equivalent, though we're paying the justice 60% of this because he's
We're
at
doing the sheriff.
0.6
Just
FTE.
shows where-
Okay.
So in the past, we've discussed the issue with our Justice of the Peace. I think we require them to be an attorney. In many counties, that's not a requirement. So we do have that. I don't know how that compares to these comps you have, but
Clackamas requires it, so we've made that note that it's an attorney as well, but
okay.
Jackson Lane, Marion, it's not a requirement. They may have it, but it's not in code like it is with Deschutes and.
So that's one of the considerations in where we're at currently with our comp, that we do require that extra qualification, which, you know, we've got an excellent justice, and he's been willing to adjust his practice and so on to provide that service.
Although there was a request that he had in his last space because he closed his law practice. He was requesting that the county cover his bar fees.
But I think he was putting that in his line item budget.
Yeah, he put that in, but that's effectively a budgetary raise for him, because that's an expense that he's not incurring.
Was it 4,500 or?
It was 6,000.
6,000.
Actually, let me clarify that. It was he should have said 613.
Okay, wow, because that number seems really high.
6,000, or that's what I wrote down, but we did get some clarification. It's just a little over $600.
Oh, okay, that's it.
And probably to be consistent with other county departments, it would be in the department budget. I mean, our legal counsel, that's where it is, rather than the compensation side.
You're right. Yeah, so yeah, it is in the department budget in current, so that'll be something that we approve otherwise. But I think I just want to be aware of the fact that, you know, there's an other pay of $600 that's coming from the county somewhere to the justice. Again, let's go down the standard path. What's the 5.5%?
5.5 will take them to 129,572.99 at the full-time equivalent.
And what does that do for total pay? Because there's longevity in there that we got to incorporate.
144,669.
So that's well even above the standard comp. So that does cover that, for the fact that, you know, he is not only a lawyer, but a good one.
Yes.
I think that's more than fair.
Yeah, that
Yeah.
would take them up to 20%.
Yeah.
I'm okay with that.
All right, I would move to adjust the annualized salary at full FTE of the Justice of the Peace by 5.5%.
Second.
We have a motion and a second. All those in favor?
Aye.
Opposed? Motion is approved. Sheriff?
So, we did a couple years ago have a 9% increase to the sheriff. And then last year, we had a 9.6% increase to the sheriff. Does anyone present, well, the two of you that were present last year, recall why the 9.6?
I think it was a step issue, as I recall.
Okay.
It was, an additional comp was considered in looking at the city of Bend.
That was Bend PD.
Mm-hmm.
And it's my understanding that we were actually looking at the wrong number for Bend last year.
The base instead of total
Yeah,
compensation.
base instead of total comp. Somebody helpfully supplied me the Bend chief salary comparable this year.
What is it, Jim?
193,420 annual.
93.
Oops, and then with performance pay and comp, that could increase to 212,767.
Yep.
So-
So is he max?
I'm sorry, and you're talking about the scale or the current?
Current.
So I have confirmation of current
So what's the?
wages.
And what would it be?
171.
171.
171,000.
Okay.
And eligible for a non-rep adjustment on July 1st, which I don't think that they have shared yet.
Well, okay, so he's at 196 right now, which is well above the 171, which is also well above the second in command pay of 172.
And and I believe that the 171 is base. So the 171, sheriff is at 175 if we're talking base to base.
Okay, okay. And then what was your recommendation on that? I didn't, I blew right past that.
COLA.
3.5.
So at the 5.5% range, what does that do for the sheriff?
Oh, of course, yeah, I love
Oh, it wasn't your fault. You.
So it's 185,608 base.
$207.
185.
Is that what you have? Yeah.
185,608 for base.
Yeah.
Correct.
So
And
what's
then
that take the total to?
207,415.
What's that 207 number?
Total pay.
Total pay would be 207,415, and that would include the longevity bonus. And again, that's a 457 for the sheriff, right?
Correct.
Okay.
And is that just your recommendation, or is that?
That's the 5.5.
5.5?
Yes.
And that'll actually take him, when I did some figures, just adding 4% would take him to the max salary range of the city of Ben's, chief of police, so
Yeah.
5.5 will take him over.
Still underneath some of the larger counties, but otherwise pretty good.
So 5.5 takes him over the city of Bend police? Oh, okay.
So I'm fine
So
with
not taillights.
5.5.
Okay.
Okay.
Yeah.
So move to adjust the base annual salary of the Deschutes County Sheriff by a rate of 5.5%.
Second.
Motion and a second. All those in favor?
Aye.
Opposed? Motion is approved.
We're rolling. Last lap.
Yep. CFO.
Treasurer?
Is in sight. Okay, so treasurer, what we have currently, actually, Terry, you want to walk me through his annual salary current? It's currently vacant, so,
166.99 or?
what's the
So we're
155?
on treasurer?
Yes.
The
Can I just-
155 was the incumbent at the
Oh, okay,
time.
okay. Yes.
I'll just say for the record, since I'm at the table,
Yes.
I'm currently the appointed treasurer.
Oh, I was wondering who did.
You get double?
I've delegated it to Wayne. Neither one of us are accepting the stipend. So, just so we're on the record, I won't say anything more about it, but so it's clear.
So,
But is the assumption that you're going to fill a treasurer position?
We have the recruitment out now?
Okay.
It is very assumed.
Yes.
so you want to make sure you're competitive with other folks that are trying to hire this position.
Well, but that would be a discussion with whatever
You're right.
candidate would actually come through. What we're discussing very specifically is the stipend, right?
Correct.
Got it.
For the treasurer component, which has been approximated to be about 0.1% of time.
And the stipend wouldn't be negotiable. It's established now
It is.
by this committee.
Correct.
So that part, just so it's clear, is not.
There was a discussion when Greg came in, and the compensation group had made some decision that was not favorable, and
There was some discussion, actually, quite a while ago, and actually, I think this was actually Wayne's time, when we implemented the class and comp and we evaluated the CFO portion of the position, and it was determined, there was a recommendation made at the time to actually remove the stipend or dramatically lower it. That was not a favorable decision to the incoming CFO and treasurer, and so we reconvened mid-year and made an adjustment.
Honestly, I was going to go the other way. If the goal here is to attract talent, and we feel that the treasurer position is something that we want to show as valuable to the county, I was thinking, I mean, this is a relatively small number, but I think it's also a number that demonstrates the faith of the county and the citizens for the treasurer position inside the county. And so my quick math just said, moving that stipend to $6,000 would be about a 15% increase to the stipend. It's not a significant increase to the pay, but we don't know what the pay is because that's going to be negotiated in the hiring process.
We actually do have an established salary range. So,
We have
I
a
mean,
range, but-
we have a range. We don't know what the exact one is. You're correct, right?
Well, so the other relevant part of this discussion is, and correct me if I'm wrong, I seem to remember that this is an elected position, so the candidate doesn't necessarily have to be somebody from Deschutes County, right?
Well, I think that's the weird part about this whole thing is, you know, the possibility of the treasurer being someone other than the CFO is frightening because you'd have to give them an office and perhaps some staff and then you'd be having someone in charge of a $200 million portfolio that, you know, you don't know what their qualifications are. So it's
$500 a month.
So the idea, I think, here is to make it, I mean, to recognize that it's additional work and the fact that your CFO has to get elected or at least run for election is an expectation that there should be some stipend there, but you don't want it lucrative enough to have someone out in the community, you know, think, hey, that'd be a great little side job.
Yeah.
You know,
Yes,
so
that's my
I think
point.
that's the two sides of it.
Well, in Resolution 2020-005 says that, providing that the treasurer is not the appointed CFO, the annual compensation shall be 10% of the top step pay level for the county finance director position, subject to adjustment by the elected official compensation committee.
And that's that off-cycle meeting that we had where we established, you know, should
That's right. Yep.
that CFO not be elected or not be eligible for
Right.
running. We made that decision.
Okay.
Should say the board made that decision.
So I'd be okay with the 5.5, but I'd also still toss out the, you know, let's show good faith and as the budget committee, let's show good faith in the fact that we want a quality treasurer and we want to reward them for the extra work that they're doing. And I'd be fine with either the 5.5 or the 6,000.
Well, so, what was your recommendation?
Staying as is because the 5.5 is being applied to, 5.5% COLA is being applied to the CFO portion, the salary portion of that position.
And that's what you're saying, Jim?
So I see what you're saying. So you were recommending no change, stick it at the 5,187, and the other option that I threw out was move it to 6.
Yeah,
I'll take either.
I'm fine with the 15% to 6.
I'd recommend staying with the proposed.
With the 5,187?
The amount that we've been recommended.
Okay.
Since it's an elected position, we already made a fair adjustment to this over the last couple of years.
That I had not looked at. I'm going to defer to your wisdom on that. 'Cause you're-
Yes, Bruce, we will. We'll
Oh.
defer to you.
Okay.
So you, yeah.
Move.
In the notes.
Is that in
Yeah,
the
put
minutes?
that in the minutes.
Move to no adjustment of the Deschutes treasurer annual stipend, remain at 5,187 annually.
Second.
Moved and seconded. All those in favor?
Aye.
Aye.
Opposed? Motion is approved.
Excellent.
Nice job.
It was an hour and 5 minutes as opposed
That's
to an
really
hour.
good,
That's pretty
yeah.
good with two noobs.
Yeah.
And next year will come with,
Is it-
Yes, the
well, a
calculation.
scenario. I'll just have a
Yeah.
spreadsheet built with
Thank
20
you.
scenarios.
See, we would have been done in 40 minutes if we would have.
I had them on
Is
the
it-
cheat sheet on behind my notes, but.
Nick, did you have a comment?
I just had, my only question is, now that we have our 3 county commissioners, I think, are they still in the room or did they leave?
They're here.
Oh, I mean, is it helpful just to summarize to them what
Yes.
the committee's decisions
Great idea.
are? I'm going to have it right there if it's
Yeah.
helpful, or I can.
So, okay, so the summary, to summarize what we heard, and the motions will reflect, is the assessor will receive a 10% increase on base salary. The clerk will receive a 5.5% cost of living adjustment on base salary. Commissioners will receive a 5.5% COLA on base salary. District attorney will receive an 8% increase on the stipend. Sheriff will receive a 5.5% on cost of living on base salary. Justice of the Peace will receive a 5.5% cost of living on base salary, and the treasurer stipend will remain at $5,187
87, you're right.
5,000.
annual,
187, yeah.
annually.
I'd like to thank the HR department for
Yes.
walking us through this.
Very welcome, and we will continue to modify and improve the process. Every year, we learn something new.
Thank you.
Okay, thank you.
Thank you.
Thank you. The no change wasn't attractive enough to bring you
I
back?
decided if it wasn't 5%.
Did you almost have 80/15?
Yeah, yeah.
So the first one on the handout that I sent out is is there support for an ongoing transient room tax transfer into the sheriff's office in the amount of $3,651,787 as currently in the FY23 proposed budget.
Any discussion on this point?
So this includes the extra, I believe it was 500K?
Correct.
Okay.
In this question, the word ongoing, does that imply support beyond this year, or is that ongoing this year?
Well, I think that's up to debate, but when I asked Joe in his presentation for the sheriff's office, when they were talking about their long-term forecasting, if they had included a transfer of this amount in there, he said yes. So I think it was, implied that this would be an ongoing transfer for them, but that's certainly within the budget committee's purview to say, no, I'm only more comfortable with a one-time, and we can discuss again next year. Or Nick, do you have comments on it?
Yeah, I'm just not sure that one commission or budget committee can bind another. And so we can say that it's ongoing, and that may be what they start their budget with next year, but it'll ultimately be a budget committee decision next year.
That's right. Right.
And by next May, we'll know what kind of year we had, if we're in a position to consider it or not.
Well, and this year, we're thinking of it as, X amount plus 500,000. Next year, it might just be, do we want to keep doing this X amount? We will, not think of it as 500,000 bit more than the year before. So,
Yeah,
I think as time goes on.
That was kind of the proposal, is that every year when it comes to the beginning of budgeting, we look back at budget committee decisions and we say, okay, well, it sounds like this is an ongoing transfer of general fund, or an ongoing in this amount. And so, right, if this was approved, then this would be the amount that goes in for fiscal year '24, assuming there were funds for that. And it would be referenced as just the same as last year, as opposed to $500,000 increase.
Just as you can't encumber a future county commission, you also, if I'm correct, can't promise funding that might not be there. If the room tax, for whatever reason, whether there's a wildfire or some other issue that causes tourism to, crash, for lack of a better term, you wouldn't be able to give someone money out of a fund that isn't producing revenue at that time. Am I correct?
That's what I said, you just said it much more.
I didn't, really?
Well, I said, yeah, because we don't know.
Oh, yes.
Next May, we'll know where we're at.
Thank you.
And we're really
You just said it with more flowers.
Okay.
It sounds better when you said it. I just said like, hey, we gotta,
One
wait
of the
and
other,
see.
when I asked Joe for more information in advance of the budget hearings this year, he sort of talked about the 3.1 million as a baseline. And there was a point where that 3.1 number was set, and there was a whole bunch of analysis and backing to it, but he wasn't able to provide that to me. So, I mean, just kind of, to me, 3.1 is this arbitrary starting point to which we're saying, okay, well, you start at 3.1 6 years ago or whatever, and you account for inflation or cost of living allowances, and you can get to 500,000 more. That's, that completely makes sense. But I guess I would like to, over this next year, I would, and it sounds like the sheriff's office is interested in this as well. I'd like to unpack, what the right base number is, and kind of what that's based on, the population, criminal activity, tourism, there's a whole bunch of variables, I think, that go into determining what that number is. And maybe, it sounded like they were interested in a formula, that would move over time. And if they're interested in a formula, let's open up the hood and build a build an algorithm or something to come up with an annual number. So I guess with that, I would say, I would rather it be phrased as, there's support for fiscal year 2023 TRT transfer to the sheriff's office in the amount of $3,651,787. And there's a commitment to doing some analysis over this year. So,
Sounds like a motion.
something like that.
Any other discussion?
Could we get a second? I'll second.
All right. All those in favor?
Aye.
Aye.
Opposed?
That's actually 6%, 6.13% of their $59,000 budget. So it's, when you think how, we heard about how much the tourists cost us through the court, it seems to make sense from that point of view.
So, kind of countering Commissioner Chang's statement there, I wouldn't want to spend a lot of time trying to analyze that number. I mean, it's revenue coming in from a separate source. There's 25% impact. This is the historical number. We added $500,000 to it, and there'll be an ask for more in the future, and there'll be a decision here. So I'm not supportive of a lot of analysis, is all I'm saying.
I was going to offer this in a couple numbers. But one of the things to look at is we do have 7% TRT coming in that, and I know there's some allocations within there. I know that the 1% is fully allocated. But within the unallocated portions of the TRT, as we're looking at it, it might be viable to think of different organizations we want to contribute to at a percentage rate with a cap. So, and maybe that's maybe that's the base level of analysis. So you could back into what's the base percentage that you want to do. But one of the things that I think we need to be cognizant of is if TRT is going through the roof, those percentages can get really unviable in terms of the who you're flushing with cash. So maybe you need to be thinking about the rules of, well, we'll allocate up to this much percent or up to this cap, and then that starts to give you some of the unallocated TRT that you can consider in the good years to go do other projects like you've been alluding to, and I know you want to have more discussions on that. That's not a motion, that's not anything else. That's just if you're going to do an analysis, I think you could not spend a month on an analysis and just come up with, well, if we back out the numbers, it would look like this, and that would be a really good eye test for the county, or for the Board of Commissioners to look at.
That chart.
All right. So with that approved, with the change of ongoing to,
Was there a vote, or are you?
We did.
There was.
Yeah, okay, so we did,
did
okay.
vote on that.
We voted and then we commented.
with the change to, from ongoing to fiscal year '23. We will move on to the second decision point, which is opening the conversation regarding support of unallocated transient room tax reserve transfer of $3.5 million approximately to Fund 060, the general fund reserve. And again, that would be just kind of moving those funds over for potentially future capital use and to increase our general capital reserve to, in the near term, to certainly be able to cover some debt payments next year for the courthouse and other projects. So,
Is there any legal risk of doing that? I think this fund is
So remember,
pretty old, so.
the state law says there's a fund created by transient room tax, and 30% and 70%. And 70% is, the different numbers, different ways you can look at this. But part of that is general fund. We've just put it in a fund called unallocated TRT.
Okay.
So now we're just choosing to put it back in the general fund kind of officially. So we've added this step for ourselves, which is wonderful to think of it as a pool of unallocated dollars created by transient, for room activity. But it is general fund.
Okay.
So just a reminder we had this conversation yesterday. I think Dan mentioned he had a term for it. It was unused funds that we had over the last 2-3 years. I remember we had some unallocated general fund money that we said, well, let's put it into capital reserve. It seemed like the right thing to do because, as Commissioner Chang had mentioned, there's going to be some big project coming down the road, and we wanted to get ahead of that, although there was no plan to address that with that capital reserve. So just keep that in mind. We still don't really have a plan, and we're thinking those funds that we put in there are not going to be adequate. It's just it was a reason to address it that way.
On this unallocated transient room taxes, where the money's coming from for the Sun River Public Safety Development. So that was $8 million. So, and that was just writing a check to a public safety partner in the community.
Well, effectively, as a capital reserve.
Can I ask if we make this 3.5 million transfer, given the other commitments that we've made for TRT funds, multiple years out, like in the case of the Sun River Public Safety Campus, how much is left next year in the?
Yeah, there'd be $4 million left. Essentially, we'd be transferring, which is approximately 3.5 million, to the general capital reserve, which would leave $4 million left, which is enough to pay for our forward-looking commitment to Sun River, which is the only forward-looking commitment that I can think of out of the unallocated. It's $2 million each year. So $2 million in fiscal year 24, and then $2 million in fiscal year 25. And we'd be setting aside that $4 million within the TRT reserve for that purpose.
So we'll have $4 million in a year where we're committed to pay out $2 million.
Yes, it's just a kind of a conservative policy to ensure that we don't allocate some of the funds back in capital in 23 or 24 and not have enough in TRT if there's some kind of volatility or something.
So really, we would, likely we would come to the end of next year with $2 million, kind of to carry over the next year.
Yeah, and possibly, likely, it depends where TRT reserves, at the very minimum, we would come over with $2 million. But if TRT continued to increase over budget, then we'd have, more of that unallocated, and you can make a decision at next year's budget committee about where to move it then, that additional, or if.
Well, I mean, this, I know that this is item number 4, but it's, to me, this speaks to, this also speaks to the question of what our assessed rate is for the general fund going into the next year, because basically either one of those strategies, doing, transferring basically, a very large portion of what we've got left to, that's flexible funding in TRT, or dialing up our assessed property tax rate this year instead of starting next year, which I'm pretty certain we will have to do. Both of those are strategies to make our general fund reserve healthier, so that we can reach those very large capital projects with some funds to work with. Coming out of next year with $2 million is not terrible, but it's also it doesn't give us the flexibility to do things that come up, for the community that may be very high strategic priorities. I'm not the only person who has been suggested the idea of using some transient room tax funding to address some of the workforce and affordable housing issues in our region. Sherry Helt is out there beating the drum on that concept as well. And that is it's certainly something that that we can have policy debates about all day, how you increase the supply and availability of affordable and workforce housing. But I'm of the belief that somebody's got to make some investments from somewhere, and we have we proved out that concept earlier in the fiscal year by allocating a substantial chunk of ARPA funds to affordable housing projects. Some really straightforward strategies. Primarily just paying for land, donating land. But there are a lot of other things that we can be doing to make investments in affordable housing. A couple of the ones that I think, yesterday there was the discussion about, well, we're going to spend $50,000 on this, Ben Chamber initiative and meetings and talk. I'd rather do something. To which I said, $50,000 probably isn't enough to do much. But there are things that I think we can do in maybe $75,000, $100,000 chunks, which actually could make a difference. Some of these concepts like loaning people money to build ADUs at low interest rates. We see mortgage rates going up. We want more ADUs out in the community, and fees and construction costs are going to be a barrier to people creating those housing units. Lending people, $75,000 chunks, $100,000 chunks, that could get us some ADUs. We could look at things, if we're, to zoom in from the broader housing needs in our community to just what we need at the county. If we were to institute policies like you see at many universities, where employee that's got over 5 years or over 10 years of service to the county that we want to keep around, we could provide some down payment assistance to that employee if they're trying to buy a house, and then we would in terms of financial tracking, it would be very complicated, but we would have an equity stake in somebody's house, and the appreciation on that $100,000 would be ours. So it wouldn't be money that we sent out the door and disappeared, just like loaning people money on ADUs wouldn't be money that disappeared. It would come back on some level.
So all those are reasonable possibilities, but that said, there's possibility and there's commitment. So I think from a fiscally responsible thing to do is to ensure that we are fixated on our commitments first, and then utilize the good judicious work of the budget committee to not let the county overspend, to then do that possibility thinking to move forward. So, I mean, from a if you're 100% confident that you can meet commitments and address possibilities, then I'm sympathetic to what, again, I'm not setting policy, all I'm setting is budget. I would like to see the county address some of the possibilities that are going in, but, my responsibility as a citizen member here is to ensure that we're addressing commitment first.
And I'm just trying to create the space to be able to meet our commitments, but also have the capacity to respond to those kinds of opportunities sooner than May 2023.
Well, there's $3.5 million that's coming that way in the first place, and then you can determine whether there's use. You, as the Board of Commissioners and the county, can determine whether that's whether that general fund is of use to address low-hanging possibilities in the fiscal year.
I mean, in my mind, once we move that $3.5 million over to the general fund reserves, it's obligated to the courthouse or one of those other three large capital projects we've discussed. So I guess my perception is that as long as it's still sitting in that TRT account, it's more opportunity money, and then once we've moved it to the capital reserve, it's sort of, I know that that's,
Well,
there's nothing that legally commits us that way, but the way that I see it is we're building that capital reserve to address these big projects that we have.
Well, analogous to to the way that I would go, would you view the courthouse as a commitment from the county?
Yes.
Okay, we're addressing commitments before we're addressing possibilities.
Yes. And but at the point where we say, oh, we've got a decent amount in our capital reserve, then the idea of dialing up the assessed rate a year sooner would likely go off the table. I mean, the political reality is that if there's not a perception of need, then people aren't willing to make hard, fiscally responsible choices a year sooner than they have to. Sorry, Judy.
So on that note, with a little bit of a different track, I think it's very important for the county in the future to track the outcome of those investments. I heard from the facilities, believe it was the facilities manager, that the county has made significant investments, and I believe she said it was 64 acres over 20 years and for donations for affordable housing. And so if you look at that per acre, I don't know what that is, 40,000 to 5,000 square foot lots, how many homes or how many apartment dwellings can you get on 64 acres? And I don't think I received a good answer, not that I need one, because that's up to you, but I think in the future, tracking how many dwelling units those investments are creating and how many families it's impacting is very important, because for me as a taxpayer, 64 acres that the county has donated for affordable housing is significant. That is a whole lot of land when you're talking about apartment, single-family units, habitat housing, cottage developments, whatever, veterans housings, whatever those may be. I just think it's very important, and it's good for the county commissioners to be able to go to the community and say, we have invested in affordable housing, 64 acres resulted in XYZ. So that was...
Yeah, we did 2 acres in each of the quadrants down in Lapine, and I'm like, truly, I think Habitat is a great program, and it really has made a difference in Deschutes County. So, but you're true, it's 64 acres.
Yeah.
So we've been ignoring it.
It would be good to do that in a, I think in a chunky way, that analysis, basically, we committed 40 acres to the city of Redmond, and that won't pan out with the 240 units of housing in Skyline Village for probably still a couple of years.
And that's my point.
But
yeah, is it sitting there while you're making new investments when you have 40 acres that hasn't been developed?
But I think that's the, you have to recognize how long the time frame for the production of housing is. I mean, because if we look at it in that chunky way, I could go back, I could take you to Lapine and I could show you this is the 1.6, or I can't remember, 1.8 acres that we gave to Habitat for the Putney Place townhomes, and those are basically all done. Or on track to be, fully built out soon. And I could point to the acreage that was committed to Pacific Crest affordable housing, and then we could go look at, a multifamily housing unit full of seniors who are, paying affordable rents. So each, if you look at each chunk and you give it a sufficient time frame to be completed, like the results are going to be pretty impressive, and so that
fine.
Okay.
I'm supportive of this transfer, so I'll make a motion if we move it along. So I'll move transfer of $3.5 million to Fund 060, General Fund Reserve from Transient Room Tax Reserve.
I will second.
And I'll third.
We have a motion and a second. All in favor?
Aye.
Opposed?
Opposed?
One opposed, okay. Motion is approved.
So just one note, I mean, so it still sounds like you could think of it as a $2 million fund now. You know, I mean, your ideas that you were laying out there, it's still a $2 million fund.
Mm-hmm.
Unallocated, uncommitted to.
But to ensure that we have the $2 million to deliver to Sun River Service District, the next.
Well, yeah, we'll need to watch the
we-
revenue income from that.
We need to hold on to that.
But to the point of that, you'll know that by the end of summer.
Yeah.
This summer.
Yes, you'll know that by the end of this summer.
Yeah, I'm not advocating that we'd ever spend money that we don't have, but I'm pointing out that it looks like the horizon shows that there's already going to be a window of $2 million in there pretty quick.
All right, Dan?
Okay. Thank you, Bruce. Third discussion point here is thoughts on the future vision of the COVA contract, the Central Oregon Visitors Association. Is there general support or direction regarding this contract, either for a capped or expense-based budget with a sustainable allocated TRT fund, or to continue with a percentage-based COVA contract? And again, this really comes down to the contract is a legal agreement, but I think there's just some conversation looking for direction from this committee and what the future vision is there, so.
So just as a note from the action item from yesterday, Dan and I collaborated on the start of basically a memo back to COVA requesting some additional data or some clarification of the data that they have. I think he's been a little busy, so he hasn't thrown in some of the numbers on top of that. But
Yeah.
that'll be a request that comes back. Even as I wrote my portion of it, my initial acknowledgement and obviously the acknowledgement is there is a contract with COVA and we are obliged to our commitments with COVA. I guess it's really the discussion to my mind here is there an opportunity for the county to consider any changes to what they want to do with COVA over time? And so I'll leave it there.
So I have two school of thoughts. I don't think I lean one way or the other. A cap would probably bring stability to the organization. But my other thought on that is it would obligate the county if you capped it, if the funds weren't there.
It's,
See what I'm saying?
So the way that I would think of it, and again, the way that I've structured things in the past is, I will offer a percentage, I will cap the top end of that percentage, I will not cap the bottom end of that percentage. So if TRT were for some reason to go down, it would drop below the cap and it would just return to a percentage thing. And you could even, if you wanted, put in an escalator for every year that you're bumping the cap. You can escalate the top end of the cap. So that way, in good years, the number continues to grow up, but it goes up at a very reasonable rate, 3%, 5%, 10%, whatever you want to do. In the down years, it actually returns back to a logical percentage, and does so until you bump back up into that cap.
As we spoke with Public Health today, they were it reminds me of our discussion with Public Health about money back into the general fund. And they said they were supportive of that. Has COVA indicated that they are supportive of a cap, or is it just something that we're going to decide without input from our partner?
I think we've been meeting with them, haven't we, Nick?
We have been, but we've really postponed the big discussion until
Right.
post-budget. And I think that's really where the question is. Do we want to just continue status quo, or are we open? As Julia suggested yesterday, that reflects the conversations we've been having of let's have COVA staff, so a couple board members and county staff really begin to think through how this contract may evolve, be it percentage-based, percentage with a cap? Is there sideboards on the lower and the upper limits, whatever it may be, and then setting aside some additional funds for the tourism infrastructure fund, for lack of better terms. She doesn't want us to use the term sustainability fund. That's what the city of Bend uses. So whatever we call that fund for improvements, which we would also then collectively decide how are the criteria set for that. Does the board set the criteria for that? Do they set it? How do we implement it? Who reviews it? There's a lot of mechanics to.
Well, I think
Next steps.
the safe point is, from the perspective of the budget committee, we don't have input into that, because that's a policy thing, not a finance thing. As is the contract is the contract, and we're agreeing with that. It's just and by the way, I think COVA does a tremendous amount of very good work, and I see a lot of good results as a part of the county where COVA operates significantly in terms of the results that they have. I was just a little disappointed in the data that was presented to us and how it was presented to us, and hopefully some of those clarifications resolve that to the county's satisfaction.
You were ready for a lot more, weren't you? You just wanted to get down each one of those slides.
I'm a data geek.
Yep, I could see it. So, a couple thoughts real quick. So this is Central Oregon Visitors Association, Regional Destination Marketing Organization. Back in the day, it used to be Mount Bachelor, Sun River, Canita Resort, and it's really evolved from there. The contract, I do support contract of some sort to give clarity. It makes up 4 parts: people, advertising, projects, and investment. Is kind of what our relationship would be with COVA. So keeping the people, funded, functional, and advocating for Central Oregon. How much money are we going to spend on advertising? Doing projects is the interesting one here. Just like the Pacific Crest Sports Weekend, or whatever it was called, is there another big thing we could be doing? This may not be the future, but I always envision seeing, our golf courses on the Golf Channel and a national championship coming here or something. As I say, that may not be the future.
Haven't seen it lately.
Well, but, we can think big like that. Or, the day that we host the Winter Olympics around the world here, I mean, Mount Bachelor in its prime condition could do something like that. So my point is thinking big.
Oh,
So
no,
that's,
we'd have to come up with millions for that.
well, that's a huge one. I'm just joking around. But then investment. We heard about investing in the trails, making sure our Deschutes National Forest and the parking lots and the trails and the skis paths are all, up to snuff, a little bit of investment there. So a lot of excitement areas to go there. But I do support the concept of a contract doing the business portion, and then some variables in there. As I say, if it's project work or investment in our public lands, let's open some space for that discussion too.
And there's letting COVA, I should be speaking to the mic, there's letting COVA do that with the funds that we provide, and there's also taking input from COVA on opportunities to spend county funds above and beyond that as well. And I think they would serve a very valuable role in both of those.
Yep, and I'm not putting more definition to that today, because that's a great conversation.
Exactly.
I really think we have to have the conversation after this meeting.
Mm-hmm.
When you saw that they were just getting more and more money in, and somehow, a somewhat of a cap with percentages, so that we're not spending $8 million to bring more people here, because there's a lot of other things that need to be spent with some of that money. But Julia does an outstanding job on a lot of, her programs. I see a lot of really good things. So when people Google Central, I guess they only look at Bend, so she's definitely, she's widening what people are looking for, so. And I don't know, Tony, how to get that golf tournament here, but it sure would be nice.
Well, just something big like that is all I'm saying.
Well, this program does help the rural parts of.
Right. That's really the goal, because it definitely, the rural parts could use that help at times.
I've been in that spot many times. We're traveling, like even for as commissioners going to around the country a little bit. I'm from Central Oregon. Well, where's that? Well, it's, Deschutes County in the middle of the state, Sun River, and then you say Bend, and they're like, oh, Bend, you just have to say that darn word Bend usually when you're trying to explain where Central Oregon is.
But I think Sun River actually has an international reputation, truly.
Oh, yeah. But it's just funny, usually, no matter who you talk to, if you say Bend, they know.
I like that outline, Commissioner. I think that's the right direction. the opportunity I saw was, as they got more funding, they've prepared and rolled out new programs, and they all seem to be effective. It's just that they're leading the charge on it, and we're giving them money just to see what they're going to do. It would be good if we had a structure on the back end. As the money comes, we fund and move forward on a prepared program that works with the county as well as the people that are involved in their association. So I like that upfront planning.
Well, and the people that are on the Central Oregon Visitors Association Board are the professionals too. I mean,
Yeah.
these are the operators, so we need to really thank them and respect them for their efforts.
Yep.
And that's Judy. Well, yeah, we were on the board.
But I
Full
agree
disclosure, I am on the board.
Sorry.
I agree the plan is what it is this year, and we have to roll with it, but that conversation, I think, is a great way to start.
Can I just ask one question about the mechanics of providing predictability for COVA? So on you know, that when that year comes, when the TRT is down, are reserves part of the equation here, like that they've stored a certain amount up in reserves and they're allowed to access those reserves in order to be able to reach their kind of standard level of marketing and staffing expenditures?
Well, they presented that yesterday.
Yeah, I couldn't remember exactly how it worked.
I asked them to do a reserve, for the last 2 years. I kept saying, you guys, you need to do a reserve. They really cut back when COVID happened. They were extremely responsive. A lot of people, they got rid of people, they cut back. But truly, yeah, just to protect them to go through, when there is a downturn.
Which is fair. I mean, there's reasons why TRT would go down. If there's a disaster, TRT goes down. And I would note, I mean, obviously I wasn't a part of the budget committee at that point, but I'd note that the percentage of TRT allocated to COVA during the pandemic, when we were asking COVA not to bring people to Central Oregon,
Slow down.
yeah, didn't decline. So we weren't holding them accountable for a disaster or a pandemic, and we weren't holding that funding accountable. There'd have to be a special consideration if it was a true loss, like a fire in South County that really got rid of a lot of that TRT, and that would be a discussion that we could have in terms of over and above the support. But otherwise, if the TRT is just naturally declining with no disaster factors that are going on, you have to put some of that on COVA, because their responsibility is to draw tourism to the unincorporated areas.
Well, and the second home rentals, they may become primary homes. So even if you advertise, maybe we're not going to have the same inventory in the future. I'm just saying,
Yeah.
there may be other market shifts out there.
Well, but the ADUs hopefully are gonna cover for that. I mean, so there's a lot of different moving parts in here, but I think you can make some generalities and then address the specifics as they come.
I think we just need to keep in mind, that COVA's budget, or their revenues over the last 2 years have gone up dramatically, just like we see our TRT going up. I mean, there's a formula where they participate in that growth. And we saw their budget yesterday, and, their fixed costs seem pretty low to me. They're like $600,000-$700,000 of staff, something like that, staff and benefits. And so, staffing is not their big expenditure. It's contracted advertising of all different sorts. And so it seemed to me they have a lot of discretionary funds in their 3.6 million or whatever that number is, that is their budget allotment for next year. So to me, they have lots of latitude to target things, to look at things differently than they first thought they would spend it on, and so there's a lot of room for responding to downturns or to different circumstances than they anticipated. And I think they also said that they have a reserve. Their target is 9 months of operating, or maybe a year. So, I mean, I got the impression from yesterday that even if you turn TRT off at the end of '23, they could operate probably for another year, pretty much intact. I don't know what they'd be doing. I mean, there'd have to be a lot of thinking about that. So anyway, I just think that might answer your question about
They did, Julia did say nine.
Something like that, yeah.
Okay.
Did you get what you needed, Dan?
Well, I'll let Nick speak to that, just direction for
Yeah.
your upcoming meetings.
I hear collective agreement that we're going to really continue the conversations that we started pre-budget, post-budget, and we'll discuss all of the issues we just have been identifying, including reserves, and how that plays into the contract and what that means going forward. So that's the direction that I needed, and it's helpful to me, and I think will be to Julia as well.
Just one other thing, sorry. Seemed like she was showing this grant program. I think that was not last year or any other year. That's totally in response to the conversations that you've already started with them about the board's desire to kind of look at things that way. And so I think she was trying to be responsive and admit that, yeah, that's something we could do, and she showed some numbers for that. I think 800,000 or $1 million or something.
It was a little under $1 million. It was like
Yeah.
nine and change.
So, I mean, you got to grant them, I mean, at least they were showing how it might look on their side,
Showing
which I
how
thought was
it looked,
encouraging.
although certainly I hope the county is enthusiastically curious about how those programs actually operate.
Yes.
And I think,
Yep.
and I would just say, Jim has started a really nice letter, and then I'll add to it, and when COBA gets back with that data, that can be used in the contract negotiations that people are in as well.
RCTP, half of that grant, Envision grant program, that's stuff they're already doing.
Well, and it's something that we don't really have any or have any control over, so that.
And it's sort of, they're not just a pass-through, but it is it's directed from Travel Oregon. Travel Oregon says, you are going to do RCTP grants like this, and they do it. And
Yeah.
then, it's the local TRT above their operating expenses. That's the grant program that's new, but that we're also going to have a lot of input into.
Agreed.
Like her operating and her salaries and benefits, it's like about $1 million what she projected for this next year. So,
Can we take a quick break? Looks like this next one would go for a while, so.
Sure.
Let's do it.
we talked about number
Discussion on item number 4. That's the next item of discussion, so somebody want to lead that off?
So what's the difference then?
I'd be happy to make some initial comments.
Okay.
Oh, we'll talk about it later. Yeah. It's $1 million different.
So we all got to see the long-term forecasts on Monday, and you could all see how our reserves, our general capital reserve, whatever we're calling it, is on a steady decline towards zero over time. We also have huge capital projects coming up. I'm the kind of person, I'll be shopping for a new car this year when supply chains actually allow me to find a car. I started about 6 months ago and I just gave up. But I'm the kind of person, when I want to go buy a new car, I try to walk in with as much money as possible to put on the table, so that I'll only have to incur part of the car's cost in debt, because I know that every dollar that you borrow is more than $1 in over the long term. I think one of the estimates for our courthouse was that if we have a $40 million project and we have to debt service a very large amount of it, it might very well cost us $60 million over time. Was that one of the numbers that we've seen? So, if we walk into those capital projects with very little reserves to put on the table, that is what we are obligating future Deschutes County taxpayers to. As the father of a 14-year-old kid who I hope will grow up and live in Deschutes County, I would rather not do that. So, to get to the brass tacks of the assessed rate reductions that we implemented in 18 and 19, at this point, each 3-cent rate reduction is costing the county close to $1 million a year. And the impact of that, of 3 cents of rate reduction for me, are pretty small. I would figure I would be close to the average Deschutes County homeowner, and a 3-cent assessed rate reduction probably is saving me about $7 or $8 a year. So impact to me, $7 or $8. That's great. I can go buy a couple cups of coffee. Impact to the county, $900,000 a year. So in my mind, the fiscally responsible thing to do, looking at having to dial up the assessed rate anyway in the next couple of years, would be to start now, to put more money into our capital reserve, so that when the big price, the big invoices for our large capital projects start rolling in, we'll be in a stronger position and we'll have to borrow less money. That's my pitch.
So if I can talk, because I'm a newbie here, going through the budget, I would like to say I'm very proud of the county. You guys are fiscally sound. And so it looks like everything's great, but when I started hearing from all of the departments and looking at the future capital projects and the space requirements and the new FTEs and all of these things that are coming up for the county, I did have concerns about the financial future of the county, making sure you retain that fiscal soundness. And I know you've done a great job all these years. But I was thinking through it after our meetings, and I thought, you've got a safety campus down there, you've got a safety campus up here that they want to do a strategic plan for. You've got the courthouse, you've got lack of space here, you've got the county clerk saying he needs new space. I mean, there was a lot of discussion that was very similar from department to department about the spacing requirements and capital projects going forward and new cars. I mean, on and on it went. And that's concerning for me as a taxpayer, that you might hit a wall if you don't start making some decisions now. And it sounded like you said, or someone said, I'm not sure if it was Dan, that it was fine probably till 2024. But looking through all of this for the very first time, I was concerned about, you know, all of the projects that you guys have coming up in the future, and that you really probably do need to take a look at whether you want to fix that now or later. That's just my thought.
I mean, and, you know, I would also add to that, you know, we are on, in terms, you know, there's the population growth curve for the county, and then there's this, you know, there's this kind of fiscal curve that tracks it. And right now, I feel like we're at a moment where the county is growing incredibly fast in terms of population. We're seeing more properties coming on the rolls. We're seeing the assessed value go up, but we're also seeing a massive increase in population. And I expect that population increase, you know, it may not be for a couple decades, but the curve will flatten out. But if we haven't, during this window of time where our you know, basically our assessed value base is growing, if we haven't built the facilities to serve that future population, then when the population starts to flatten out and the property value increases level off, we will be facing a whole lot of catch-up. We need to have the facilities in place to serve a population like this when the population gets there, as opposed to lagging behind it by 10 or 20 years. And you know, that finance people could probably analyze that in a much more sophisticated way than me, but I have a lot of concerns about keeping up with growth, with our facilities, with our human resources.
So I thought we would have raised the rate by now. I think last year was the year I was going into it thinking, okay, here we go, it's going to have to happen. And then it didn't have to happen. It was tax assessed value and new growth on the books. We really didn't have to. Right now we have you know, inflation coming on for the first time in 10 years. That was kind of artificially low for probably too long. Energy rates. So I mean, everything's a moving piece right now. Jump into the concept of these buildings, you know, the capacity of Deschutes County. I think we're in kind of that 20-year cycle. Like this building and the juvenile building and some of the stuff that was built about 20 years ago, we paid off a lot of that debt. We have you know, some general obligation type debt right now, but I mean, we have such a low debt ratio right now. It's amazing. As I say, I was really enthusiastic looking back, you know, dropping that first 3 cents, and that was the point in time. We didn't know if we were coming back from a recession. We were seeing tax assessed value come on the books, so we were able to lower it, and then we did it again. Yeah, I mean, I'm excited we were able to send that $3.5 million to the you know, general fund reserve at this point in time. So we're still not in a spot where we're required to do it. You know, and then it's how much do we want to you know, raise the taxes and for what reason. So I'm not real strong about doing it this year, but I do know that we're going to in the near future. I mean, it's just going to have to happen. It's a real shame that, you know, your government's going to have to raise the cost of government as the economy might be slowing down and inflation is happening. That's the action that I don't want to take right now, but we may have to in the next year, a couple of years.
Well, the interesting thing is that actually this building is not paid off. And we owe till 32, I believe, something like that. Is it another 10 years on this building? Does anybody know? But we have all this space in this building, and everyone seems to forget that it's actually Deschutes County building, though the state, is paying like $1 million or something for us to rent it every year. So, yeah, I know, my numbers are a little rounded, but I did ask Chrissy about it the other day. We do have all this space here, and, everyone keeps panicking, and I'm like going, okay, we just bought something for $4.65 million, and what in the heck are we, that project in Redmond is costing so much. We're spending, what, 6-7 million, whatever, to remodel it, 22,000 square feet. And we bought it over a year ago, and I would have hoped that it would have been further along by now, and it's truly not. So now we're really going to pay double because we've got major inflation. But of course, the GDP was just revised downward, 1.5% for the first quarter. So surely we are probably, things are going to start slowing down at some level, and I feel like we're caught. And we're caught. We need more, and yet we have this part of the building. If we need to really add, okay, so we couldn't buy anything for $1 million, could we? For all that space? I mean, we're getting $1 million now, but really, if we had to take it back from the state, it would be pretty darn cost effective. When you consider we're going to have, what, like 13 million into Redmond with those two buildings. So I'm just thankful that that would cost us like $1 million if we have to say, state, you need to find your spot, because, okay, we do need more space. So, yeah, I always like to be frugal. It's not my money, it's the county's money, and, I did like what Wayne said. You match it with the people, but when you see how much we're spending on Redmond, and then that additional 13 million for the courthouse, oh my gosh. And if we actually are going into inflation, I don't know if you guys can remember, but things will start costing less money if you can get them. Because I've already heard from like workmen out there that they aren't quite as busy as you could have imagined that they were maybe 6 months ago or something. So not that I want to slow down, and yet I know homes, let's say in Eagle Crest, that were at the top end of the market in 2006, and they sold, and they never got back to there. I mean, we're talking the top end. So, it's a really complicated issue. But I do believe that we spent a lot of money for the 22,000 square feet in Redmond, and I would hope that we would truly look at the other end of this building if we really do need more space, because that's $1 million a year, and we'll be closer to having this building paid off.
If I could interject. So it seems to me that you have the general fund, and it has an excess amount of revenue right now of $4 or $5 million a year.
About 4.5, yeah.
And then over the years, we've been using that excess. First, we used it for some PERS reserve building, and then we started using it for general capital reserve building. And at the same time, on the facility side, we started spending it on general capital improvements. I mean, that was the intent. I remember a couple of years ago, Eric, there was the book, the notebook that had the 5-year plan of projects that we could think about to use these excess funds for. And I think what's happened here, just from my perspective, being gone for a couple of years, it looks to me like we started off building projects that cost $1 or $2 or $3 or $4 million, and we could easily handle those. It was a pre-inflationary time. There weren't any gigantic projects other than maybe the public safety campus, which I think is another 10 million or so, the work that's already underway there, 10 or 12 million, something like that. I mean, that's a pretty big project, and to think that we could keep paying for such projects out of this fund, I just think, we all know that just can't happen for very long. It can handle $4 million projects, but $10 or $12 million projects, I think we're in a new era here, and we have to think differently about facility needs. And I would think, and what that means to me as past finance officer, is we got to start thinking about that excess not being used for capital, but being used for debt service, because that's the only resource we have for future debt service on larger projects. Unless we go to the voters and ask them to increase their tax for, specifically for a bond for, like a GO bond, tax-supported type of bond, and we haven't done that in anyone's history here. I mean, it goes way back. I think the last time we did that was for the fairgrounds or something, and that was it might have been I think that was a tax-supported bond.
It was.
Yep.
We've spun off all the districts. Easily make that argument to the voters already.
Yeah, so all I'm saying is we got to start thinking in terms of financing projects, and when you get to the point of financing projects, you're in a whole new cost element because you got interest now, and that's market-driven too, and so the timing of a borrowing or a refinancing, you try to take advantage of low rates when you can, but you can't always do that. I mean, so it becomes more expensive. Like a $40 million courthouse costs $60 million over its life now. And so I think, when you start thinking about those kinds of costs, I think it's time to look really more closely at the cost and the scope of projects. And again, I have no idea where the scope creation for the courthouse is, whether it's already been determined and already been engineered and vetted. I don't know where that is. I suspect we're early in the process of designing.
Earlier than we should be, in my opinion.
So I just think it's a whole new world here. And, the tax levy is going to be one part of that. But in my mind, you might get a year or two's worth of cash out of that you could use. But, that excess, or not excess, but the revenue you get from increasing that tax back up by the 6 cents eventually is really going to be dedicated pretty much to debt service in the future, not really making projects significantly cheaper for the taxpayer, if you know what I mean. So I would to me, there's a shift in the paradigm here, and it maybe should have happened 4 or 5 years ago, where we start thinking, we got to think differently about how we fund projects, because the projects that we now have on the schedule are huge, and our revenue source is just never going to handle those by itself. So we need to start thinking in terms of financing, and when you finance, you got to think in terms of, well, how can we engineer this so that the cost is reasonable and we can handle it in the future?
So Dan, does that bring in 1.8 million?
If you were to raise it to the max, it would be slightly under that, right?
Slightly under 1.8?
6 cents is the max, or it's just reversing the 6 cents that were done over 2018, 2019?
We were levying our full rate.
You're at our full rate.
6 cents is the max.
Yeah.
So that's one thing to consider, is that's your ceiling without. And yes, it would be. I think it's the assessor came back and said it was like $285,000 a cent or something like that.
Okay, 285 a cent?
It was something like that. Yeah,
Okay.
so a little bit short of 1.8 million. I would just echo what Wayne said. I think, as we said in our presentation, we're going to have to look at all options, the revenue side, but also the expense side on the capital needs, to do capital analysis for space needs, but also potentially for operations too, because as you choose to make those larger capital projects, you do need to hold that debt reserve, and that means that we need to kind of really do a little bit more fiscal management in terms of evaluating every operational request that has a general fund component to it, to ensure that our debt payment can still be made. So
when I capitalize on that, the last two conversations here, I could take a couple different ways. I mean, one, to start, having lived through at least a building discussion recently from the Sun River standpoint, there's a lot of perception that, okay, Sun River made the decision, put it in for, found some resources to help, again, thankfully to the county, and delivered that. And, that was the product of a few months. It was actually the product of about 10 years, where we've been starting to have the discussions on there's a necessity to fix starting to understand what the resources and requirements were, going through an entire strategic plan process. I mean, we completely updated the strategic plan to determine whether actually a building was part of the strategic plan, and it turned out it was. And then even past that agreement, it still took us about 2.5 years to finally get to a vote. So, you know, I make my jokes about moving at the speed of government, but sometimes that deliberation is useful so that you're intentional about what you're asking and what you're trying to do. I think there's a significant amount of possibilities that are going on, and obviously in the 3.5, 4 days that I've been listening to the departments, there's an awful lot of unease about what could go on. What I want to see, again, coming from a as we all represent the taxpayers in various ways, is that we're being intentional about the things that we want to do. If we're, just take the courthouse, if we are that early in some of the planning, sure, it's useful to prime the pump, but how much ambition do you start to take on by priming the pump ahead of actually being aware of what your real resources and requirements are? I've heard Eric talk about facilities master plans, some of the space use needs, some of the other things that are going on. I think there's a lot of thought that needs to go in around what are the priorities of all the different departments. How do those priorities stack in? You could play zero-based budget, you could play all sorts of different ways to build that, but basically I'm going to use a business term, return on investment. And I'm not saying that, we need to turn $1 into $1.50. I'm saying we need to know that the dollar we're spending is getting maximized over the long term for the county. The other thing, and I'm going to go with Wayne, it's my personal finance things aside, I pay cash for everything. The one thing that we have to remember is when you pay ahead, you're potentially saving a lot of interest money, but you're also losing a tremendous amount of opportunity. And I'm not saying that you're suggesting this, Commissioner Chang, but if we said, let's grab the $40 million, let's dump it into the courthouse, what are all the programs that we didn't do because we were afraid to do a debt service to a space of that? That could be a building project, that could be a significant schools project, that could be a mental health project, that could be a change in the philosophy of how we take care of the roads. But all those things are preempted if you take that money off the table right away. So I would encourage, again, from the standpoint of the Finance Committee or the Budget Committee, I want to see the plan of here's the logical spend that we need to do, and I want to be comfortable to approve that. And I'm pretty comfortable with most of the stuff that I'm hearing this week. But for the long-term things, I think I want to see some intentionality on the county that says, this is how the spend's going to go, and here's where we're going to distribute it, before I start allocating that to move forward.
Yeah, and I just want to clarify, I am not under the impression that if we dial up the assessed rate, 6 cents, it's going to prevent us from having to incur debt. I'm asking the question, do we want to borrow $1.8 or $2 million less next year, which we will have to pay, which will be an increment of our debt service that we are trying to meet every year for however long the term of that financing is. And given the individual impact on me as a taxpayer, I think it's appropriate to consider whether we want to borrow $2 million less next year.
It's actually 1.71.
I think it's
So, yeah.
I think it's 1.8, but if we borrow the money, it costs us, however much more over the term of the loan.
I haven't seen any proof that you're ready to borrow the money. I know you need to borrow the money, but I haven't seen any proof that you're ready to borrow the money.
No,
And
there's
what are
no
interest-
intention to borrow the money for the courthouse.
I know, I'm just saying.
For another year or more, actually.
Where are interest rates going to be?
And again, I'm
That's a
very
scary
sympathetic
thing.
to what you're saying.
Well, and I mean, the other thing is that we have known we needed this courthouse expansion for years. And we literally just started the design process, which in my mind is ridiculous. Because if we had had the design process, completed at the, on the day that the state legislature, gave us the thumbs up on the 2 additional judges, we could have borrowed the money at a way better interest rate than we're going to end up borrowing it at now. And, we could have captured, we could have hit the construction curve before escalation of costs got to the point that it has now.
But as Dave Doyle said, no county has ever gotten 2 judges before in the history of the state. So how would we have known if we were ready to go that actually we were going to get those 2 judges that day? The good news is we did get them, and they are making a difference for our legal. So I just think it's definitely, you have to look forward. I'm just worried about our interest. I mean, Wayne, what kind of interest will we, even let's say that they keep doing, they're going to do another 50 points and another 50, and then they're going to do a quarter point. What kind of interest rate will we be eligible for in a year? That's my worry.
Yeah, it's really hard to say. I mean,
As a,
how long is our next recession going to last, or when is it going to really be here? Those are the questions, and it's not just the Fed's actions necessarily. I mean, there are other things afoot. There's a war in Europe, and there's some other implications, and I'm not sure that Fed rate increases are going to deal with those impacts very well. So it's really hard to say. We could look at the history of the 2008 recession and see how fast rates declined. And in fact, they started to go up and then declined again right at the tail end of that in about 2018 or so. So we could do some research. But yeah, I don't think a year from now we're going to be back down to issuing debt at 2 or 3%. I just don't think that's going to happen.
I know, it doesn't seem
But
possible.
3 or
We
4
don't
years
know.
from now. The other thing, and this isn't much consolation because it's still difficult and expensive, but it is possible at some point to refinance things. And so when rates do fall, if we have to issue debt at 6%, theoretically in a number of years, you could refinance a good portion of that. Problem with that is most debt's not really refinanceable for 10 years. And so we'll have to really think about the structure of this next debt given our current environment. We may want to make call features more prominent and shorter just for that very reason. So, but that'll drive the rate up on that issue because of that too.
You get that up.
Yeah, it's awfully hard to predict the rates.
I know, I thought you had a crystal ball.
Sorry.
Well, you have a lot of wisdom, that's for sure.
My crystal ball fell out of my box when I was walking out to my car 2.5 years ago. Broke, and so now it doesn't work.
But the wisdom is still pretty brilliant.
Yeah, well, I know.
I'm kind of in the camp that Wayne laid out, and I am interested in seeing some way to cover debt as it's incurred. I'm just looking at this schedule that we were given for the next 5 years, $89 million courthouse kind of scheduled for year 3 of 24-5. That might be the time to address that issue. So that'd be my approach. I think we've already agreed to increase the sheriff's rural levy. I think another 6 cents on top will be a problem or a concern.
Is it 9 cents? Or is it 6?
Sheriff was 9, he's saying 6 cents more would be.
Okay.
Okay, for me, because I'm rural.
Me too.
Yeah, I know. I went like, okay, and we actually did have it 4 years, so. Yeah, I know, so that's, I know, and I've got the levy from Cloverdale, 69 cents, 1,000, so I'm like, it all, starts adding up.
We've got the Redmond's sheriff.
And you've got the new, do you have the Redmond City Sheriff, yeah, the public safety?
Yeah.
How much is that one?
74.
74 cents?
And the library bond,
Oh, yeah, don't forget that.
countywide.
Yes, I pay 7.2% on my, or I did, on my bill for the library.
So do you want to present a motion?
Is there any point in presenting a motion?
I don't think so. All right. Item number 5.
No, really? Judy, wouldn't you vote for it?
Responsible for that.
To go back to zero, to get rid of the 6 cents? Isn't that what your speech said?
We don't have the votes.
Well, it might be tied. I don't know.
Should we just do a vote to make sure?
Make a motion. I move to reverse the 2018-2019 assessed property tax rate reductions, restoring 6 cents to the current rate, bringing us to our maximum.
Second.
We have a motion and a second. All in favor?
Aye.
Aye.
2 opposed?
I'll vote for it.
Oh, 3 opposed? Aye.
So it's a tie.
It is a tie.
I kind of thought it might be. So what do? We just, if it's a tie, it's a tie.
Does it fail because if it's a tie?
Tie isn't enough.
Yeah, I believe so.
I mean, technically, this is a recommendation to the Board of Commissioners, so the board.
Excellent point. Thanks for bringing that up. And I believe, and I think I said this in my original comments at the beginning of our meeting back on Monday. Budget Committee, one of their roles is to set tax rates or to approve tax rates. And so we have some motions yet today that would approve the county's tax rate, and then we have a motion that would approve the rural district's tax rate, and actually the countywide district as well. We have stuff to deal with those. I believe the board cannot raise a tax rate, but it can reduce it at the budget hearing in front of the board.
So when you're saying that it would need the budget committee to, as opposed to the board?
Well, what I'm saying, Eric, I think was suggesting the board could take this up at the hearing, perhaps?
Yeah, but.
And I think that's not, I think in order to raise a tax rate beyond what the budget committee approves, would have to go back through the budget committee process. And we really don't have time in our calendar. I mean, it becomes problematic to try to do that. So it's not very practical, but I think that's how it works. And we can, that's a budget law requirement. Do either of you guys believe me?
I do.
You believe me?
Yeah.
All right, good. I was making that up, but no, that's the one limit on the board at budget adoption, is they can't raise the tax rate. So for our purposes here, seems like that initiative failed to pass here, which means our rate would stay at the 121. And that's what would be in the motion that would also have to pass here a little bit later today. So just keep that in mind.
And we'll talk about this again next year.
Are you talking about fiscal or calendar?
Oh,
Sorry.
May whatever date next year. I am sure the assessed rate will be back on our docket.
Well, I was calculating someone's increase, and it was just with how your appreciation of your home value is, your taxes go up significantly. I was backing into somebody's numbers the other day, and I was like, oh my gosh, they were getting a lot more. Well, it was like $500,000 worth of funding because of the appreciation of the value, even though the rate was, maybe it was for 911. and it went up $500,000. So, yeah.
Yeah, so there's a 3%, which
Right.
I think Scott explained is really
Right.
about 2.9, and then it's new construction on top of that.
Exactly. But yeah,
Lots.
Sarah was getting over $500,000 more in revenue because she
From
was saying she was
development.
able to stay without raising her rate.
Right.
So it was pretty significant.
Yeah, but where did I just put it? The charts the charts that Dan did for us for Monday, those took into account that anticipated 3% assessed rate increase and some assumption about more lots on the tax rolls as well, and but still showed our reserve headed towards zero. So.
Okay. Okay. Number 5, opening the conversation to see if there's support for returning additional general fund transfer to health services at the end of the fiscal year, should their reserve be at or above the proposal they submitted to finance. And that would be the health services reserve ending reserve level greater than $12,271,454.00, and the behavioral health, which is org 2743152, beginning working capital is greater than $6,000,000.00. And so we talked about that a little bit earlier today. That would just mean we're sending them, I don't have the number in front of my face here, but I know we're sending behavioral health, I think, around $2 million this year. So if it ended up above those numbers, then some portion of that would flow back into the general fund to fund other operations.
I think that would be wonderful because 90% of that project in Redmond is going to be used by the health department. So, and because, I looked at the remodeling costs and I'm going, wow, those really went up a lot. So that would be appreciated to have something coming back.
Well, and to that point, it's reasonable to, I want to be careful because it's hard to reward the good behavior, or I'm sorry, it's hard to punish the good behavior of an organization that's trying to be prudent. And, I don't think that we're trying to do that in this case. What we're recognizing is that there's general fund spend that is going to very specifically benefit a department one way or another, and we want them to share in that, not to the level of pain. So, what I saw today was reluctance at the change, but I didn't see outright opposition to the change. The thing to think about, and this one I haven't thought through enough because it just kind of showed up today, but it's kind of similar of what we were talking before of make sure that there's an adjustable cap that over time is working on that. And that's the reason why we're going to not just make this a policy and not discuss it next year. I think we will be discussing it next year. And I think the numbers probably will change, and I think we'll recognize again good and prudent performance. So I appreciate that we're allowed the scrutiny of ensuring that we're making the county right, not just a section of the county right.
And I would echo what Jim said. This is going to be something that we would need to look into every year and look at those numbers submitted by the health department and work with finance. And this kind of goes back to the same things we've discussed before in terms of moving TRT to Fund 060 and the COBA contract. They're all kind of related. So
Dan, did you go to them with the ask originally when you were looking at the numbers, or did they come to you?
Finance came to them, certainly.
All right.
Yeah.
I just want to dwell for a moment on Janice's request that, this is a way for behavioral health when times are good to contribute back to the general fund and support the overall county. And There may come a year, who knows, it may come very soon, when times are not good for behavioral health. And, she asked for there to be memory that, memory in the other direction, that the county general fund would be there to support behavioral health in the future, because, the total behavioral health budget for this year is almost $44 million. The county general fund ask is $2.1 million. I mean, for a department, with this kind of financial structure, to be asking for so little of their division budget to come from the general fund, I hope that this is structured in a way that it doesn't become punitive and discouraging of really rigorous fundraising efforts every year, and efforts to ensure that the revenue is going to be there to build the kind of reserves that they have. I mean, that should be rewarded, and we don't want I want to make sure that this is implemented in a way that it's not punitive.
So remember, there's a bigger picture here about managing behavioral health, mental health issues in our community at the lower local level. State hospital and federal choices have been to put programs like this in place. We're implementing it. We're leading in the lead cohort around the country, I'm sure. So my point is it going to be the philosophy of local government to take on behavioral health, the most complicated behavioral health issues with local resources, or is there going to be a reimbursement policy long-term from the state and the Fed? So we're just kind of in a very big time of change. As I say, the state's not doing state hospital capacity. We know we need a residential treatment facility. I mean, there's huge costs associated with some of the things we want to do in that area. So I support, closing the loop on this, and, if the reserves are at the right level, returning them to the general fund, knowing that we're going to invest in facilities with any money we have left anyways.
And always before, with Dr. Barry leaving, and he's such a critical part of their team, I just so appreciate him. But actually, I was asking for another psychiatrist to be hired by the county, and you see, this is my 4th year, and that hasn't happened. But truly, if we can find some more medical people out there that would be willing to come to Deschutes County, we could really use another psychiatrist. I mean, we need one. We're going to need one for sure, but I just feel like, oh my gosh, if we could be so lucky. So it's, I know it's not, I think, isn't it always like out there that they wanted to add another one, or is it not? That I thought it was like always an ask out there, but we were never able to fill that position.
I don't recall if it was always an ask, but I do recall that it is an extremely difficult position to fill, the psychiatrist and any kind of medical doctor position, and even the nurse practitioners and the psychiatric nurse practitioners as well, health services.
Anyway, but you look at our homeless population and that's something definitely we could use.
And that's why we invested in the homeless outreach team, and I don't want us to downplay the importance of a peer support specialist in helping someone who's homeless get back on track, get the services that they need, and get on their feet. So health services has definitely asked for a lot of positions in the last year, and I wouldn't second guess that and say they should have asked for a psychologist instead, or a psychiatrist instead.
Can you make a motion?
So how about I'll move returning additional general fund transfer to the health, returning general fund transfers from health services at the end of fiscal year, should their reserve be at or above the proposed amount they started with.
Yes.
I will second that.
We have a motion, a second. Does it sound?
I already made my choice and I had my sweets.
Yeah, specifically, it would be the reserve level greater than $12,271,454.00, and the behavioral health org 2743152 beginning working capital is greater than $6 million and 0 cents.
Does that work for you?
So moved.
All right. All in favor?
Aye.
Aye.
Opposed? Motion is approved.
Dan, how soon will we have those numbers?
In terms of their
Well-
reserve levels for next year?
Yeah.
Yeah, it would probably be around, we could make some estimates around maybe April of next year, but we really won't know until year-end closing, which is end
Right.
of July for accounting.
The only, the only caution we get.
I got one right here.
The only caution I'd give is let's not make this so punitive that it's an incentive for departments to spend money without reason.
Yeah, and I really hope
Or
this.
not try to, to tin cup less aggressively.
Let's not have the U.S. Army ammo shoot at the end of the quarter.
Unless
you invite me.
If I could say, I really hope this isn't considered to be punitive. This is something we've done with other funds as well here at the county, and we'll likely need to do for more funds, especially as we continue to look at our general fund. And I can just say that I really appreciate the collaboration and just having the conversation with Health Services this year and their willingness to, really put themselves out there to help the county at this time right now. So I'm sure they're watching, so thank you.
I don't see this punitive at all. There's a reimbursement rate, billable hours, great services going out by the staff, and they're able to bill for it. So there's a revenue that's rolling here all of a sudden, which has never been like this before. So it's not punitive at all. It's just the opportunity not to have to put that general fund in those services and maybe put them in facilities.
And I've shared that with Janice as well in particular, is that administration, I can't speak on behalf of the board, but administration, we fully support their department, absolutely. But as the general fund declines and we only have so many dollars, we just don't want for that to sit in one department's reserve if we can allocate that as necessary, just so it gives us the maximum flexibility. But the commitment is fully there for our health services department and behavioral health in particular. I shouldn't say in particular, but that's the part of the fund we're discussing. So, yeah,
I'd just like to say that, I understand the structure and intent of this policy, and I can see, in a totally neutral context, how it's appropriate. But I really do think that the historical attitude of county decision makers about the funding for the health services department, with that backdrop, I feel like there's a risk of this being a punitive approach. I will, to drag us through the mud. I'll just say that the stabilization center, the amount of county general fund contribution to make the stabilization center happen was quite modest. And it's hidden behind all this smoke and mirrors of oh, well, we were paying for all these crisis services people before we ever had the stabilization center. So now that we have the stabilization center, we're just going to count that as what we're contributing to the stabilization center, when what we really added to make the stabilization center possible is actually a pretty small increment on top of that. And that story, I think, is illustrative of the way that the county deals with health services. And basically there's this attitude of, hey, you can go do that innovative, cool thing that you want to do. Get somebody else to pay for it. That is the backdrop for my concerns about this being a potentially punitive policy.
I don't know, I think I saw some costs into the stabilization center, and I thought it was like about 23 million or something, you know, when you take the value of the building. I don't know, did you guys see that schedule? Does anybody remember it?
The remodel cost for that building was
Oh, I know, we actually.
quite small.
Oh, I know, we saved some money, but there was actually the value of the building and everything. So it wasn't a surprising number that I saw that the county had contributed over a period of time. But, and for, regarding the stabilization center, I did ask Mayor Endicott, and he said 25,000, and I said, oh, maybe 50,000 would be nice. So I haven't heard back from him yet on that. But of course, I doubled it, so we'll see if we can get that or not. But I know we have the funding for this next year.
And not to, drag us through the mud even further, but the stabilization center was, basically the configuration of stabilization center that we have was approved 2017, 2018, a long time ago, and then a substantial amount of the board's attention to capital projects over the years that followed that was spent on micromanaging the stabilization center when we could have been working on things like North County campus, adult parole and probation, the courthouse expansion. So
Commissioner Chang, I don't know why it wasn't approved before I got in office, but when I got in office, I actually visited 5 centers, came up with some really good ideas like the waterfalls and things, and there were 2 doors and treatment rooms and things. So I actually came up with some ideas, and then we approved it. Honestly, I don't know why it hadn't been approved before I got in office, but made my trips around the state as quickly as I could, and I feel like there were some really good things that we did come up with. So anyway, but it's definitely seen a lot of people, and law enforcement is using it, so that's the good news. And I'm happy that Bend City's picked up their contribution, so I think we should just go forward.
And I would just, as we go forward here, just echo that it is very important for us to be working with health services, and if we did see any kind of dip in their reserve level or anything, obviously they would get the full general fund transfer, and this conversation probably wouldn't be nearly as extensive next year, so.
We can hope.
Yeah.
All right, item number 6.
Item number 6. I'm going to let Eric take this one.
Yes, thank you, Dan. Just for some background, the county was receiving marijuana revenue starting in like 2017, 2018. The revenue was used to partially fund Sheriff's Office detective, community development, both code enforcement and current planning, as well as some services out of health services like substance abuse and a prevention specialist. Once the county opted out of additional marijuana production and sales, the marijuana revenue went away. Those ongoing costs continued, and most of those costs were then borne by the county's general fund. With the state law changing, whatever it was, recently, the county will, May 2020
of November, when, you mean any more marijuana?
No, when the state law changed so that the county would start getting marijuana revenue again.
Oh, right, because of the homeless, yes, last year.
Could get marijuana tax revenue again if we initiate a cannabis advisory panel.
Yes, so the state law changed saying, okay, Deschutes County, you can get marijuana revenue again, but you need to create a cannabis advisory panel. The cannabis advisory panel will give you recommendations on a couple of areas. One of them is what to do with future marijuana revenue. In April, the cannabis advisory panel met and talked about that very item, and what the cannabis advisory committee, our panel, is recommending is that marijuana revenue go to 4 areas: education, health services, code enforcement, and the sheriff's office. The panel did not say how to break that up or what percentage, and they didn't really get into the details about which specific programs. They just left it open-ended. So the decision today is how to use next year's marijuana revenue. The cover memo that I provided is a starting point, or at least a starting point for the discussion. What I'm recommending is, first off, the projection for marijuana revenue next fiscal year is about $160,000. So what the memo outlines is, as a starting point, is to send $20,000 to code enforcement. That's consistent with the panel's recommendation. $70,000 to the sheriff's office marijuana detective, and that in essence would offset or replace the general fund contribution for those positions. Obviously, it doesn't come close to covering the actual cost because it's 2 detectives, so the actual total cost is probably $250,000, $300,000. But this would offset the general fund portion of that commitment. And then the last area I put down here is health services, healthy schools, the program that you've heard about. Since the Cannabis Advisory Panel, their recommendation was education and health services. This was a way to kind of get at both of those. I was concerned. I didn't want to really. I'm not recommending to put the money towards new programs because each year they're going to make a recommendation. And if we added a new position, then the following year, if the panel said we want to do something else with it, then it would be cutting a position, adding a position. So really the way this is structured is when marijuana became legal, there's been cost to the county. Much of that has been borne by the general fund. First it was partially paid for by marijuana revenue. When that went away, the general fund kicked in. So this proposal moves it back to marijuana revenue, not county general fund, for many of these efforts.
I just want to say, I'm not sure, I am not aware that the county was putting general fund into marijuana or other drug prevention efforts to replace marijuana tax revenue that went away. I mean, I know that was the case for some of the detectives, so I think the rationale to adjust county general fund contribution for detectives, based on how much marijuana tax revenue we're putting into that, I think that's appropriate. But the Cannabis Advisory Panel, I don't think specifically said that they wanted to put money into the Healthy Schools initiative. They expressed a real interest in expanding education and prevention efforts, not kind of replacing dollars for something that's already happening. The Healthy Schools Partnership only covers the Ben Lapine School District. It doesn't address Redmond and sister school districts. So that would be another concern I would have about routing the funds that way. I think to meet the intent of the Cannabis Advisory Panel, if we want to follow their recommendations, we would want these $70,000 to be additive and used in some way. Eric and I were talking about how you don't want to necessarily create a new position because this is, who knows what the Cannabis Advisory Panel is going to recommend next year, who knows what the revenue is going to be next year. But, for example, if you're concerned about, drug prevention work, drug use prevention work, you could spend $70,000 very easily on various kinds of marketing efforts without hiring new people, contracting various kinds of services. And that's what I believe would meet the intent of the Cannabis Advisory Panel's recommendations.
Two comments. Another option is there is a prevention specialist position in public health that the $70,000 could be used to support that position. The other thing I wanted to mention, I forgot to, is the marijuana revenue. The amount has gone down because the state Oregon Health Authority moved some of the marijuana revenue directly to the county's agreement to fund substance abuse. So early on, we got into the marijuana revenue is going down because of that diversion. So we are getting marijuana revenue to the agreement for substance abuse.
So Eric, how much have we
For
gotten so
OHA?
far?
Yeah.
What's the amount we've received
For,
in the quarterly payments? Have we gotten any?
no, it's roughly, we're estimating 40,000 a quarter.
And if for some reason that.
But we haven't seen any yet?
We will get it in quarter 4 of this year, and then it'll be starting next year as well.
So is that connected to Measure 110, or is that separate from Measure 110?
Separate.
And if for some reason the revenue isn't realized, that would be an obligation of the general fund?
Not necessarily.
You could just pull it back without, pull the revenue back without.
I mean, we'd have to look at each area. Probably the sheriff's office detectives, if there was less marijuana revenue, then general fund would cover it. Code enforcement, probably not so, because there's other funds to cover that.
And the other piece of this, which I can't remember the details of, but literally sometime in the last 2 months, the sheriff's office brought us additional FTE requests for marijuana detectives and people within the illegal marijuana shop, and we approved those, and I looked in the special requests, so they weren't in the special requests, so we approved those within the current fiscal year, and so they're not special requests for this coming fiscal year. So the sheriff's office did expand capacity, and they also, when I asked them about it at the time, they said that they intended to pay for those positions in part with grants that we approved their application for, and in part by through the increase in the rural assessed rate that we've been discussing today.
And wasn't part of that changing the marijuana detectives from limited duration to regular, or was that a separate?
That was part of it, but there was more. I mean, we added positions as well, which I think is critically important, because literally up to this point they've just been triaging, dealing with the largest, most egregious, potentially cartel, involved, most enforceable, or the cases that they had the best evidence to prosecute, and there are tons of reports from neighbors, reports from code compliance, and others that are basically just not being dealt with right now. So this addition of capacity is going to help with that, and that's a great thing. But just
what would be your recommendation?
So I think that this is an okay allocation. I would just say that I don't think that the health services allocation should be tied to a reduction in general fund support for health services.
But were you suggesting the 140 go to the sheriff in various capacities, or?
No, because when they brought those new positions and those conversions of limited duration positions, the explanation was, we will pay for this with this grant that we're applying for, plus the, part of the rural patrol, increase, assessed rate increase, or the rural district assessed rate increase would make up the remainder. So they had a plan to pay for those positions already without this revenue. So I'm not saying, I mean, we could not do a proportionate reduction in general fund for them either. We just give them those
I like the
70,000.
other idea, though, of the marketing.
The health prevention.
Yeah. That would be my recommendation.
To give that, to go with this 70,000 for those education efforts, but not tied to a position.
Right.
Yeah.
Yeah.
So just to be clear, so you would say 20,000 to code enforcement, 70,000 to the sheriff's office, 70,000 to the health prevention area, and then how much general fund replacement? Just the 70,000 to the sheriff's office?
We could do that, or we could not do that. Either way. I mean, this is, I guess, well, the question would be, how much general fund are we sending over to the sheriff's office at this point for those positions?
For the marijuana detectives?
Mm-hmm.
I'm not sure.
I thought they had been absorbing that costs.
I think they did at least last year, and then the year before, I don't recall if it was 2 years ago or just last year that they've absorbed the full cost. But before that, they had been getting some from marijuana.
They absorbed it last year.
So there's not a need.
For another 100,000.
They did absorb
If we're not currently allocating general fund to the marijuana detectives, then there's no need to offset this then either.
So it's just to send the payment and not make any comment on general fund?
70K to the sheriff's office, 70K to health services, 20K to CDD for code compliance.
And I have some, Cheryl's luckily watching. She wrote to me that any funds that go to health services, non-FTE, could be used to enhance campaigns in the prevention program, likely through contracted services.
Yeah. That's what I would like that.
It's great to have people in the healthy schools program in the schools, but they need to be able to put stuff on TikTok to get the kids right.
So thank you, Cheryl, for watching and helping me out.
You want to make a motion on that, Commissioner?
Can I just offer one quick thought? I just am trying to coordinate a little bit with CDD on this, on the 20,000. One of the things they presented is the huge increase that they have in code compliance fees as a result of the added building valuation. So, I mean, they almost have a surplus in the code compliance. And I'm not suggesting we go to zero, because that's what the Cannabis Advisory Panel recommended. It's just, they could either put it into another fund, we could allocate 20, or you could reduce it by 10,000 and allocate ballpark 10,000 to one of the other in your final motion, just before you make it. Just a thought, because there's not a lot of revenue, and CDD has significant, and I want to honor the Cannabis Advisory Panel's recommendation. So, Eric, I don't know if you have any thoughts on that, but.
I spoke to Sherry a little bit yesterday. She wanted to give us some more thought, but she talked about the code abatement fund, or there might be a use for that, because that's often, that was just what she mentioned.
Okay, I just wanted to.
That would be to clean up nasty.
Yeah.
Okay.
Marijuana production sites.
I don't know if she was specific to that, or that this revenue could help offset. I'm not sure. I mean, we could just leave it up to them.
Yeah.
Because there's a lot of cleanup.
Yeah.
After busting these operations.
And now they know not to rip up the plastic because it blows everywhere, since I had to call them like 3 times on one of the marijuana grows that were illegal.
Okay.
Yeah, and that's got to be really time-consuming, whomever's doing it.
Okay, creative commission.
Okay.
I'd like to honor the Cannabis Advisory Panel's recommendation. So I would move the allocation of $160,000 of marijuana tax revenue to 3 purposes in fiscal year '23, $20,000 to code enforcement, $70,000 to the sheriff's office for marijuana detective work, and $70,000 to health services for prevention and education activities.
All right, we have a motion. Is there a second?
Second.
Motion and a second. All in favor? Aye.
Aye.
Opposed? Motion is approved.
So was there a expectation that general fund is not being replaced by those, or not?
Well, it sounds like the marijuana detectives, it started out with general fund, and then
Yeah,
it
so then it was
changed.
just for the health services.
And then for the,
We haven't been sending, we didn't send marijuana tax revenue to health services last year. Sorry, we didn't send.
So just the last note says, items 2 and 3 to replace general fund dollars with the marijuana revenue.
so that's changed based on the based on the
Striking
motion. Yeah. Part of that was not correct.
Sorry, I also kind of missed, was there did we do it as written in number 6, or did we do it with, as a reduction of 70K in general fund to health, or we're just adding this on?
I didn't include that reduction language in my.
I think it's A.
Okay, got it.
Right.
I mean, a budget note, we talked about it not being for personnel,
Mm-hmm.
but,
Sure, so I just needed.
they can figure out what kind of consulting or marketing or whatever expenditures.
Right, because essentially this marijuana revenue will probably flow through the general fund and then be a transfer out to health services, so this is an additional 70K then. So I just want to know from budgeting purposes, we're not, taking 70K out and then putting 70K in for marijuana. We're giving them what they've asked for in the proposed plus this 70K.
That's correct.
Great,
Yes.
okay, thank you.
Okay, we're ready for number 7.
Special requests? All right. So I guess first I would ask, are there anyone who has if we turn to page 201 in our budget binder, and we're looking at the proposed special request, is there any budget committee member that does not approve of anything that's in the proposed budget right now? That way we can know if we can make one big mass kind of motion, or if we need to stop and evaluate something that's in the proposed.
Healthy schools, there seemed to be some kind of talk about that one.
That's not in the proposed, so we can have the
It's not,
discussion on
you
that.
mean down below 201?
Mm-hmm.
Okay, so you're just talking about the top.
I am just talking about the
Okay.
first half.
All right.
So just one question about our administration position, special project manager, strategic initiative. What does the org chart look like? I guess I'm not, as I'm looking at it, like who's going to work for who real quick?
I think as we have in the org chart, the strategic initiatives manager reports to me, as we have it allocated now. Sometimes we make minor adjustments that the person may report to a deputy county administrator, but if I recall correctly, that's how we have it. Without flipping to the page in here, that's who the
And then the special projects manager?
Those are both positions that are related to the joint office. So Eric, I don't know if you.
Oh, okay.
Those second 2 lines, and they got bundled in a little bit in our org chart as well, but I think depending on how that
Yeah,
evolves.
that's a reminder. Yeah, so I was, okay.
And in a lot of ways, those will be reporting to the governing board for the coordinated office technically they'll be reporting to Nick, but they'll be reporting to the governing board.
Mhm.
Is that?
Yep.
is that right?
No, that was, I forgot about what that was. I'm supportive of all those budgeted items.
So here's the little bit tricky part. For the record, we'll need to have a motion that kind of goes through each one of these for human resources and for the record. And I would just say that if whoever's brave enough to try that, it would just be, motion to add 1.0 tax specialist in the tax department, add 1.0 administrative analyst in the property. And then farther down, when you get to health services, it's not an addition of FTE because you're not seeing the FTE there.
It's conversion, right?
It's a conversion, right. Limited duration to regular. But all the ones that in front there would be, actually, let me get some clarification on that. Would the 2 admin positions above the strategic initiative manager, the ones that are related to the coordination of, are those permanent or are those limited duration positions?
I think they're permanent positions, but they will, in the future, be dependent on funding.
Okay, so their funding will change. Okay,
Yeah, they'll be regular positions. The state will fund them for 2 years, and then the joint office has to determine how to fund them for an additional 3 years. And the thinking is once you have a 5-year, rather than having a 5-year limited duration position, you have a regular position. If they go away, they go away.
If you want me to try, I will, and then if I bork it up, then you can just not second it. So I move the adoption of Special requests already included in the fiscal year '23 proposed budget as follows: the addition of 1 FTE to the tax department, addition of 1 FTE to the property department, addition of 2 FTEs to the community development department, addition of 4 FTEs to the road department, addition of 1 FTE to the fair and expo department, addition of 1 FTE to human resources, addition of 3 FTEs to administration, addition of 1 FTE to health services, and the conversion of 9 health services positions as described in the special request. Oh, and finally, the conversion of 1 veteran services position as well.
I'll second.
That works as long as we just specify that all of the ones above the conversion, the 1.0 additions, were regular duration. So with that specification, that works.
All right.
Great job.
All right, we have a motion and a second. All in favor?
Aye.
Aye.
Opposed? Motion is approved.
Okey-dokey. So let's move on to the bottom half here, not included in the fiscal year '23 proposed budget. I figure we could just go one by one, and Bruce, if you want to take the lead on that, just starting at the DA's office, we can just go down the list from there.
So are we going to be asking for a motion to approve each one of these individually?
Mm-hmm. This would be a individual one.
Yeah, it's probably easiest to do it one at a time.
All right,
On
let's
page
start with
224.
DA's Office Administrative Supervisor, 1.0 FTE. Is there a motion to approve?
So moved.
And a second?
Second.
Is there any discussion?
Wasn't that woman in charge of like 25 different people or something, and so that didn't really seem to be.
So what I'll say, there's a couple of things that I'll throw out here that I heard that just hit my mind. I sympathize with anybody having to manage 25 people. I may have been in that position before. I'm not entirely sure 12 is significantly better, although it would help. The justification that I thought was interesting was because that's then is a path up for some of the legal analysts or some of the reportees to a potential second administration. What I wonder is, would it be more beneficial to have HR work with the department to actually offer rotational opportunities or other type of growth opportunities rather than the addition of 1, because that's, or maybe in addition to the 1, either way. But that gives, that's spreading hope a lot more across a stretched department than adding a manager. So I've said my piece on that.
Hasn't she been doing this like 5 years, though? I just feel like she's gonna walk.
But what Jim is proposing could also give relief, right? If you had that be a kind of rotating opportunity instead of just one person getting hired up and everyone else being left behind, I guess.
All right, all in favor?
Aye.
Aye.
Opposed?
Opposed.
1 opposed. Motion is approved. Is there a motion to approve 1.0 FTE in the DA's office for IT Analyst 1? We're calling for a motion.
I will move to approve the IT analyst position.
Is there a second?
Second.
We have a motion and a second. All in favor?
Aye.
Aye.
3 opposed?
Me.
Aye.
Me too.
2 opposed, 3. I didn't get all the counts.
I'm an aye.
That was an aye.
2, 3, 4. Okay, motion is approved. Thank you. Is there a motion to approve .30 FTE in the victim's assistance for a victim's advocate? This increases FTE to .30.
So moved.
Motion, is there a second?
Second.
Second. All in favor?
Aye.
Opposed? Motion is approved. And then we're asking for a motion for a 1.0 FTE in victims assistance for a victims advocate.
So moved.
Motion. And a second.
Second.
All those in favor?
Aye.
Aye.
Opposed?
Aye.
Aye.
3.
3 and 3, that's a fail.
Did we have 3 in favor?
Yeah, I think so. 3 in favor,
You
3
were in
against.
favor.
I mean, would
Okay,
it be
yes.
worthwhile to have some discussion and check again? or-
Yeah, do we need the motion first, or
I think we voted on it already.
it's
Yeah.
failed?
Yeah.
Okay,
Let's not pull an ODOT.
okay.
I mean,
What's Robert say about that? Jim?
You can refloat a motion and have discussion around it.
Well, I would refloat the motion then.
Okay, do you want to make the motion?
I move approval of the 1.0 FTE victims advocate position in the district attorney's office.
All right, we have a motion. And we need a second. I think it fails for lack of a second.
I mean, I will just say that, I don't think we're doing the best job of fully serving victims at the DA's office right now, and so I saw this position as pretty important from that perspective.
All right, we're looking for a motion for a 1.0 FTE in the sheriff's office for an administrative assistant.
So moved.
Motion and a,
Second.
all those in favor? Aye.
Aye.
Opposed? Motion is approved. We're looking for another 1.0 FTE administrative assistant in the sheriff's office. Motion
So
So-
moved.
Yeah, and second.
and a second. All in favor? Aye.
Aye.
Opposed? Motion is approved. We need a motion for a 1.0 FTE IT analyst 2 in the sheriff's office.
So moved. Second.
Okay, and we have a motion and a second. All in favor?
Aye.
Opposed? Motion is approved. We need a motion for a 1.0 FTE legal assistant in the sheriff's office.
So moved.
Motion.
Second.
Second. All in favor?
Well, hang on, just before brief discussion, I think
Yeah.
that this was, I'm a lot more comfortable with this after the conversation this morning, so I appreciate the sheriff's office coming down to work on that.
Harry was hoping he did a good job of it. So.
All right, go ahead.
I mean, I'd also say, like, I'm gonna vote in support of this position. I think they justified it well, but kind of the bigger questions that I raised about use of outside legal counsel, I still have concerns about that. There's just not really a leverage point in terms of our budget deliberations this week. So.
That's a great policy discussion to have this year.
All right, all in favor?
Aye.
Aye.
Opposed? Motion is approved. I think we're on 1.0 FTE legal assistant in the sheriff's, or no, we just did that one.
It's, I think
It's
the,
convert the,
I think
Convert,
the next two are the conversions.
yes, conversion.
let's do those together to convert JRI deputy sheriff and management analyst to regular.
So move.
Second.
All in favor?
Aye.
Aye. Opposed? Motion is approved. Okay, now we have health services.
Also move on the front office administrative support. They're their last priority, which I thought was so important.
Second.
And we had a second, I think?
Yes.
All right. All in favor?
Aye.
Aye. Opposed? Motion is approved. Have a health officer, .50, to regular.
So move.
Second.
A second. All in favor?
Aye.
Aye. Opposed?
No.
Okay.
So
So that motion passes.
Oh, was it 4 and 2?
4 to 2.
Okay. I know, I was like going, oh my gosh, are we ever going to get somebody?
Bruce said aye.
Are we moving slow enough for whoever needs to be capturing?
Yes, we have multiple people capturing, including HR on Zoom, so.
Yeah.
And it's on video.
Got some brilliant people.
And audio.
All right, and this Healthy Schools is, this is converting, isn't it, from 2.4 regular?
No,
This is an addition of 2.4.
Addition of 2.4?
Converting to 5 instead of, 48.48.
Right, okay. So a motion for that.
So moved.
Second?
Second.
All in favor?
I'd like to have a little bit of discussion.
Oh, let's discuss that.
Yeah, just, the comment I'll make on this is, if I was here last year, I probably would have voted no to start it. But from a risk management perspective, it's a bad idea to stop 2 years into a 3-year bet. I understand that we're not gonna have a lot of data on this, but I think for the spend, we're gonna collect data. It's gonna be data that spans beyond the county. This is information for a statewide and the addition to nationwide program. And I think that we've got a decision point ahead of us, a couple years from now on what we want to do, especially given where the prediction on this expands. But I'm going to call it forward and say that I think this is a very necessary thing, probably the most necessary special request in my mind.
Well, last year was the second year we actually voted on it. And I had voted on it the first year because I really feel like our kids truly need some more attention. And I know, Bruce, you feel, I would like them to be able to read, write, and do math, though, truly, besides worrying about their health, their mental health.
And I'm supportive, but I would caution moving forward that, these requests are coming in, not from health services, for all over the county, different areas, asking the county to partner, to fund programs, and then those partnerships may or may not, move forward in the future. I know the city, as an example, of Ben asked the county to do a partnership with them on a program, and they said, no, let the county fund the whole thing. So I just think of, philosophically, overall, the county needs to be cautious about entering into these without some solid commitments for long-term programs going forward.
I would concur, and I really hope that we're talking a lot more about this next year and the year after, in terms of what data that we can really get to start supporting, a positive direction on this.
They're supposed to be giving us feedback like
August of next year.
August of next year?
August of next year.
No, they actually came in a couple.
Well, and there might be
months
some
ago.
more things, but the promise from the school district was the data will be back August of next year. So we're
The fact that we're
blind for a
paying
couple years.
56% doesn't make me very happy. It was supposed to be a split, so.
And a lot, I think a caution about the longevity of partnerships is very prudent, and it's something that we want to be mindful of. Not on the flip side, but complementary to that, I would also say that partnerships are one of the ways that we address needs that kind of fall through the cracks in between one jurisdiction's authority and the other. And one of the things I'm excited about this initiative. I'm also excited about the school-based health center partnerships, because those two efforts restore partnership between county health services and schools that existed a long time ago and then
kind of disintegrated away, and now, has been identified as enough of an urgent need, and, the right fit of a partnership enough that we're hearing all sorts of requests to rebuild those relationships.
Good point.
I'm going to vote for this because it's a commitment that we made last year for a 3-year program. I agree with some of the concerns about follow-up. I felt and still feel it's an overreach of the health department to be in schools. I feel like the taxpayers are already paying for that service, and it should be provided at the level that they need by the people that are already being paid to do this kind of work. But it is a 3-year commitment, and I'll be interested to see how well it goes. I felt like there should have been a strategic plan in place before we launched it so that we would know what the strengths, weaknesses, opportunities, and threats are. And I shared all this with Nahad, that we don't know what what happens if there are weaknesses and threats that we can't address, and how effective will we be? Will we be more effective than the health instructors already in the school? That's my concern.
Well, and that's where I hope we're way ahead of this before this expands beyond just the Benville High School District.
Yeah, that was the other concern I had, is that the school embedded health programs, we started that, I don't know, maybe 8-10 years ago, and it was approved at some level, and by the time we got feedback after 3 years, it had expanded, and we were actually doing outreach into individual students' homes and providing service to people in the home. So it had gone way beyond what we had authorized it to be, and the funding was way beyond what we expected that was being funneled into that. So we had to actually pull this program back. So I'm cautious about that and concerned about it.
Mr. Chair, on the school-based health centers, part of it was the cost of the county, and so the county and the department restructured it so that the costs went down, because they got sponsors. They got St. Charles to sponsor one, Mosaic Medical.
Exactly. Okay.
So with that kind of pullback of the county, it's not like that the program shrank. It's just that more partners stepped in to keep those school-based health centers functioning.
Correct. Rather than the county being the sponsor for each one, the county and the health services department worked with those other providers to become the sponsors.
And at this point, well, like our niche is we provide the behavioral health services at the school-based health centers.
Any other discussion? All in favor?
Aye.
Opposed?
No.
One opposed. Motion is approved.
So just to follow up with that no vote, I mean, the comments I agree with in here is to say that the way it came to us, the way it's evolving, partnership is even getting a little different than we expected. So, but I agree with a lot of the comments that were made in support of that too.
Okay, motion to approve the 3.50 intellectual development disabilities in health services to regular.
So moved.
A second.
Second. All in favor?
Aye.
Opposed? Motion is approved. And then motion to convert to public information officer limited term to regular 1.0 FTE. Is there a motion to approve?
So moved.
There's a motion.
Second.
We have a second. All in favor?
Aye.
Opposed?
No.
No. So that motion is approved.
I really do hope there's an organizational discussion that goes around this and a few other things that have been approved in the special requests.
We're already scheduling it.
So how many votes were no for the conversion?
2. All right, Dan, where are we at?
Well, that was
About everything.
that was all the special requests. We did great. So, we're cruising along. I kind of hesitate to bring this up, but were there any, major additional items that perhaps anyone on the committee or anyone from staff thinks that they weren't addressed or would like to bring up? Discussion.
I mean, I sort of addressed, one question I specifically wanted to ask that relates to our capital investment needs was, again, this is very specific. When we sold the Connors property to Housing Works, the stated rationale for selling that land instead of making it a donation was that we were going to put that money into the courthouse or our capital project needs. And I'm curious whether we have actually structured the receipts from that property sale to contribute to our capital construction needs, or how we set that up. Because my major concern at the time was that we are, as Judy's picked up on, we've donated a lot of land in a lot of communities, but then when suddenly it came to a question of land in Bend, we wanted to sell it instead of donating it to affordable housing efforts. So, I had a lot of questions about that difference of approach between communities. But the rationale that was given was we need those dollars for
Didn't we donate
capital projects.
800,000 of ARPA funds to Bend Habitat? Wasn't that the number?
Yeah, so, I mean, it wasn't a location in Bend that would have been a driver for that decision for myself. I mean, I feel like you're pointing to your fellow commissioners saying because it's in Bend, we took money. So, I mean, it was Housing Works, it was a market rate offer, and there's an opportunity to receive value for a very high valuable, centrally located parcel instead of something on the perimeter of our county. So, it wasn't because of Bend. I mean, I don't understand the terminology there.
Dan, have you seen those funds? It's 1.3. I mean, I know there's some issues with the sale.
Sorry, I was kind of trying to communicate with HR and Health Services about the special request that just went through.
Okay.
I heard that we were talking about Connors. And, I'm not very familiar with those funds at this point in
I'm
time.
talking about Simpson, actually.
No, Connor.
Oh, the Connors? Oh, that million. Oh, yeah, we should have gotten that.
I would have to look it up, which I can do.
The question is,
Where'd the money go?
can we connect the dots between the Connors sale and our capital reserve dollars? As if that was the intention behind the sale of that property.
Do you know when that closed? Was that in the last few months?
Yeah.
Okay.
I think so.
Yep.
So this fiscal year then?
We can patch in Christie, or would she know, or would it be?
Yeah, Christie should
It
know.
would probably be Christie, and I was going to look up her account actuals, but we can also get that information to you as well at a later date if that's okay as also.
Yeah, I mean, and that flowed through to it wasn't the stated purpose of the receipts, but it also flowed through to when we looked at the Simpson property, we charged money for that as well.
We'll follow the money. Let's see where it went.
Sorry, I don't know off the
Bruce?
top of my head.
Who were the two no's for the conversion? Because
That's the last item,
yes.
Commissioner DeBone and myself.
Okay, I voted no, too.
Oh, you did?
Yeah, I didn't say it out loud, but I was like, and then I thought you counted me, but then I was thinking like you didn't.
No, I didn't.
So,
it's 3 noes.
yeah, so it's a tie.
This was on the PIO
Right.
conversion?
So it failed then, correct?
Well, it didn't pass.
Right, right.
Mhm.
Thank you. Motion. Oh, no, I know.
Yeah, it should be.
We truly need a PIO for the county.
More broadly, I am
So I can look
interested
at-
in, I am interested in affordable housing efforts, but what I wanted out of the budget committee was just the
Deposit the fund.
the financial capacity and flexibility to be able to.
This is the property
do
management
something
fund.
Okay.
That played out through other decisions. I don't need to say anything else about it.
So did
So-
you see where that money came in? or-
There's a,
I'm looking at it right now.
We have, we have just learned from Christie that the funds were deposited into Fund 090, which is the Project Development Fund. So, my first experience addressing this. So would this be the time to consider transferring that money to, what is it, 060, or to another fund, either for the courthouse or other capital project needs?
I think property sales go into that fund to be matched with whatever expenses are related to the sale of the property, and then there's a net, and then I'm not sure what happens to it after that, so.
Okay.
If there's direction to move that, then I think between finance and Christie, we could work that out. It'll be a net number, it won't be the whole amount, probably.
Okay, and so then would that decision be made by the budget committee or just by the board? Just by the board?
I think the
Okay.
board, that
Yeah.
seems
Okay.
like that's where the commitment was made.
That's pretty standard
I just wanted to know if that money was,
To do it.
was in our,
Net it out, yeah.
in our modeling for how we, you know, our capital expenditures. And it is.
For project development. So we can bring this question back to the Board of Commissioners, whether we keep it there or we transfer it into Fund 090.
So, yeah, it's
Right.
land, it says land proceeds, 1,000,000 to 202,352. So,
Yeah, I see it in 090 right now. It's a series of transactions, but I see the large $1 million transaction there, so.
Good, okay. So we'll bring that back for a board decision or consideration, and how you wish to decide that, okay.
So
Any other
Well,
discussion about?
So we determined the PIO did not pass? The
Yeah, we need to
change
get
to
clarification
Yes.
on that.
my vote wasn't counted before.
That was a tie vote, I guess.
Which was the tie vote?
The very last one, apparently that was a tie vote, a 3-3 vote on the conversion
I see,
of the
okay.
public information officer, so that would not pass.
That would not pass, and then, okay.
Are we close to?
I just actually have state charges
Through next fiscal year.
No, it goes through
Yeah.
December, to December.
Oh, it's just through December? I thought it was
Yeah, the
through-
current,
I
yeah.
thought it was through June 30.
That's what I thought.
Was it June?
23?
I thought it was through the next fiscal year, but I could be wrong. I just need to follow that.
So that means then the core funding hasn't come in
If that
yet.
matters, but if it's 3-3, then,
So Nick, that would mean the core, I think it's 1.3 million, that means that it hasn't come in yet, because it would go to 0902.
the core, correct. I don't think that has, that
That
has
one,
not.
we have not seen it yet.
I don't believe so. I think there's just ongoing discussions about
Right,
the
some
property.
issues.
Yeah.
Okay.
Yeah, on the special request for the PIO, under justification, it says in January of 2021, the board approved a 1-year extension to the 1.0 limited duration. So that would, the 1-year extension goes to December? No?
Just through December.
So I think it had already been approved from June 30th, 2022, when it was extended at that point in time. Cheryl is on the line and said that the duration of that position is June 30th, 2023.
All right, well, I will certainly defer to Cheryl.
Okay.
So it's actually approved then through 23?
To the very last day of fiscal year 23.
Okay.
Okay.
And so then we would get to our proposed budget approvals.
Can we take a 5-minute break?
Sure.
Oh, Bruce.
Before we have the big drum roll.
Why try to
Okay, Dan, now we're ready for you.
I think we gotta wait for.
Phil just left.
Oh, I missed that.
What do you think, which one could be wrong?
No, I think they're all.
They might all be wrong.
No, I use Worky, but.
Are we going to talk about the medical examiner or what?
I think they kind of.
Whitney could probably give you a quick 2-minute on medical examiner, Whitney. Bruce was asking about that.
Okay.
Do we want to wait for Commissioner Chang to return?
That'd be great.
At some point, Jim, we can revisit, we learned about the lump in the snake, tin cupping. We need to get,
Regurgitate, what was it, jiggering?
Rejiggering.
You know, the one I thought somewhere I would use this week that I haven't yet, and it's one of my favorite lines from one of my mentors, which is, Pfister, hope is not a strategy.
Hope is not a strategy.
It looks right to me, man. Don't be stressing me out like that.
You did say bork it up.
Yeah.
Picked up that one recently.
I used Brock once.
I had, yep.
Just hope.
Okay, it's my
just
cousin's
evidence of
birthday
things
today,
not
and I
seen.
would like to see her tonight sometime.
Just remember, the opposite of faith is sight.
I think we'll be out of,
So we need
out of
to
here
go
very
over the medical
quickly.
examiner?
3:30?
I think Bruce just wanted.
Waiting for, okay.
Yeah, let's talk a few minutes.
Since she's now retiring, no one else is allowed to die in Deschutes County. Please go to Crook or Jefferson, right? Or did she work there too, Whitney?
Yeah,
I think she works
covered
in
all
Jeff,
that.
I think it's one of the two, but it might be all three.
All right.
We're going to talk about this first.
Oh.
Summary. If you can have mine if you don't have one.
All right, let's find out all we need to know about the county medical examiner.
We're going to do our best. We may need to tag team this a bit, but as I mentioned yesterday, the county's contracted medical examiner, Dr. Jana Van Amberg, has indicated to staff that she plans to retire later this year. And so with that announcement, we've been coordinating with the district attorney's office and the sheriff's office and the state ME's office to talk about next steps and what that's going to look like for the future of this program. Dr. Van Amberg, as I mentioned, the county has a contract with her, and that contract encompasses administrative support. She has a great support in her administrator who helps her with some of her office functions, and a team that also helps support her in doing investigations. Right now, where we are in that process is that we're planning to meet with Dr. Van Amberg and the team I just mentioned of departments. She's identified someone who may be interested in taking on these duties, and that if that were to move forward, that would be a new contracted service that we would execute. We also are able to, if needed, kind of look broadly and see if there's other interest in the community in someone serving in the ME capacity, which is obviously pretty specialized. And I think given the schedule and all of those factors, just may not be the most traditional body of work. But we are coordinating closely on that. And so with respect to what's in the budget, we've kind of put a placeholder in place, but the budget really will be driven by the contract that we execute with the new medical examiner. And so Dr. Van Amberg put together this proposal, which I think is really helpful in terms of looking at growth of what she and her staff have been dealing with. They've seen an increase in the number of cases they're coming to them. And the state has recognized that as well. So I think we're cognizant of that we're growing, and along with our growth, that work is also growing, and we're just looking to move forward with consultation with the state and the district attorney, who plays an important role in this process, and other partners to hopefully execute a new contract and move forward. So if we need to come back to the board with respect to the medical examiner budget, we will do that. If we need to seek a budget adjustment to the funds that have been budgeted. Eric, is there anything I'm forgetting or anything that you'd like to add?
No, I think you covered it well.
Okay.
I think medical examiner was mentioned in that health director justification also. I don't know if that would be a duty of or just to interface with or something like that.
We've seen in some places that works, I think, right, in talking with the district attorney's office and the sheriff's office and the state ME's office. That group felt pretty comfortable with continuing to contract the service and that there was some benefit that that structure provided. But certainly, we've been looking to explore all the options that are available to us as we move through this process. And gratefully, I mentioned this yesterday, but Dr. Van Amberg has just been a great partner and she's actually extended the time, her original retirement date, to provide us some coverage and cross-training, and just really trying to make sure that this program gets handed off in a good way, so that we can pass along that historical knowledge of the program. So we're really grateful for that, and hopefully we'll have more updates for the board soon on kind of next steps.
Very fortunate to have her in the program, and the people that she works with are just phenomenal. They've been here before and made presentation, and they just are into what they do, and they don't get much compensation for it. So it's, I'm sure it's going to be a hard program to duplicate, but it'll be a different version of it. All right, Dan.
All right. Last thing, or second to last thing here, is the proposed budget approvals, which are, there's 3 of them. There's the motion to approve Deschutes County, the entire Deschutes County budget, less the service districts. And then there's countywide law enforcement district number 1 and rural law enforcement district number 2.
All right, so let's go ahead with a motion to approve the budget.
Is the number different now with the approvals?
No, we're just approving what was in the proposed, and then at the adopted, the number will change substantially based off of the.
Yeah.
Let me just clarify. The motion is to approve county budget adjusted for approved changes. So we don't know exactly what those are and what funds they all belong in. We'll fix that, and that's what will be advertised for the final hearing.
So the $583,189,773 is kind of the roll-up number at a point in time, and obviously it changed a little bit from all of our choices.
Right.
This is approving those approvals.
Yep.
So was that a motion almost?
I'll make it a motion. So I'll move to approve the Deschutes County budget of $583,189,773 adjusted for approved changes, and set the tax rate at $1.2183 per $1,000 of assessed value.
A second.
Okay, motion and a second. All in favor? Aye. Opposed? Motion is approved. I think we have to close the Deschutes County budget meeting. I'm reluctant to do that just because I enjoy it so much.
You could hang on to it for a little longer.
Yeah,
and
can
just
we
open
wait
the
till
next one and-
But
You got 2 more to open and close.
Yeah, exactly.
And we will open the public meeting for countywide law enforcement district 1 on 701. And we have time for public comment. Is there any public comment? Any budget discussion for countywide law enforcement district 1? All right. We can have a motion to approve that budget.
I would move to approve the countywide law enforcement county service district budget of $43,879,689 adjusted for approved changes, and set the tax rate at $1.05 per 1,000 of assessed valuation.
Second.
All right, we have a motion and a second. All in favor?
Aye.
Opposed? Motion is approved. So we will close the countywide law enforcement district budget meeting and open the public meeting for rural law enforcement district 2. Is there any public comment? Hearing none, we can have budget discussion if there is any.
Well, that's me after 4 years of 9 cents less, right?
Yeah.
So now we're going back up.
Yeah. Exactly. All right, we can accept a motion to approve that budget.
I move to approve the rural law enforcement county service district budget of $14,804,277 adjusted for approved changes, and set the tax rate at $1.43 per 1,000 of assessed valuation.
I will say.
We do have a second. All in favor?
Aye.
Aye. Opposed? Motion is approved. We will close the Rural Law Enforcement County District Budget Meeting. And if I had a gavel, I'd hammer it, but I don't, so. Congratulations.
Yeah. Thank you
Well,
very
thank
much,
the
everybody.
staff for all the work you guys put into this. I know it's a lot. You did a good job.
It made it very easy to come jumping into this with all the prep work that you did. And, you know, thanks for giving me 500-plus pages to read. I read them. Can't wait for the next 500.
I just want to invite feedback from any or all of you on our process. Betsy's already scheduling a debrief for us at the staff level next week so we can learn from this. And I really welcome your thoughts, perspectives, what we can do better. This is my first experience going through this in my new role, and I know it is for a couple of our budget committee members. It is for Whitney, a new role, and Betsy, Dan, great to have Wayne back, and Kathleen, as always, who's here virtually with us. So
I just
thank
want
you.
to, can I say something? I just want to say it's so much nicer to have it the week before the 3-day weekend because you know it's going to rain all weekend, right? Anyway, no, truly, it does feel better. You know, like it seemed like before Friday afternoon, we were like here at 5, 6, whatever, and yeah, it definitely added, you know, because at least we had tomorrow if we needed it.
Real
So
quick,
thank you for making that change.
I also.
Dan, if you did that, thank you so much.
No, that was Betsy. I just wanted to thank some of the people that aren't in the room too, all the departments that do their departmental budgets and work with finance, and then Sharon Keith, our eye in the sky, and Carol and the staff up there that did are recording this and organized the food and lots of other things. So
There were two things that I heard mentioned, you know, just in terms of mechanical budget items. Tony, and a couple times, and I at least once brought up, it would be nice to see some summaries of the transfers in, transfers out. In the very least, understanding where TRT is going there was the general fund one, but understanding where the TRT is going would be useful. And the other thing I would very much like to see predicted actuals for the year, next year, also included as a column item. And that's not to then judge the budget, but that's just to get an understanding of, one, how frugal the county is being in terms of spending judiciously on the budget, but also just to understand that would help me really understand a lot more of where the holes are and how we can address them. Because it's one thing to have a budget, but then not having the opportunity to actually staff that and appropriately move forward on it is something that probably could be helpfully addressed by the finance committee or budget committee long term.
So, and a couple thoughts, you know, the times just got dynamic. As to say, there was a 10-year run since I've been in office and, you know, around the country and the world where it was just kind of slow growth out of a great recession, and all of a sudden a worldwide pandemic, and now, you know, transition to electric vehicles, the cost of fuel and inflation is happening, world population, conflict overseas. I mean, it's all happening at the same time. So having good conversations at this table is going to be very important for the people of Deschutes County. But it's Deschutes County, 105, 6 years of just moving forward and growing the whole time, you know. Tourist place, great place to work, live, and play, you might say. But we're going to get through it together. But, I mean, it just got dynamic. You know, we're talking about the balance in the general fund, and if we don't have any capital to, you know, dive into the next big building project in the next couple of years, that is a huge difference. It wasn't like that for a long time.
We've been very fortunate to have the tax base that we've had and a good bunch of decisions over the years. Dave looked it up. I think my first appointment was letter 2006. At that, you know, it was just as you described at that point, but I think by 2008, thereabouts, we started seeing a downturn. We could sense it. We weren't sure what was going to happen. And I think by the time you got here, Wayne, we were in the throes of it and had to really rein it in, and we lost a bunch of people. CDD was trying to survive. We used a bunch of reserves, and we got smarter after that in terms of reserves and what it was going to take to survive the next time around. But fortunately, we haven't had that happen, and we're on the other end of it where we've just seen rapid growth. Anything can happen, but I appreciate the Commissioner's comments about the capital needs going forward. I think that's our next big challenge, so good luck, guys.
And I think I forgot to look this direction, the person who's been here the longest, who's Eric.
Thank you.
Your institutional knowledge, serving in dual roles. Hopefully we have that middle person up there with the Health Services Director between behavioral and public health staff next year.
It's funny you mentioned, I was just thinking, when I started 14 years ago, the biggest challenges at the time were, what are we going to do about jail expansion? Ultimately, we said, we just need to move forward with it. We'll figure out a way to pay for it. The Humane Society of the Redmond Humane Society and the outstanding loan, and then the Bethlehem Inn. Those were like the three biggest things for the first couple of years, and we got through those, and we'll get through the other things just mentioned.
So as long as we're on Eric, I mean, that guy can stand in for anything.
Yes.
I remember one county administrator run that he had. He did a great job, and obviously doing a great job now, so appreciate his energy.
Thank you.
All right, folks, any other thoughts?
It was really nice to have Whitney at the table as part of our team, so I really appreciate that she's here.
And I just want to personally say thanks for considering me for this, and you might be regretting it after a week's worth of questions. But
Great.
I'll do this as long as you let me. And if there's anything that I can do to help, especially the county or anything else, so that I don't have to ask so many questions next time. I still will, but so that I don't have to. I'm at your disposal if there's some out of the box thinking that you'd like to have happen.
Didn't you get the longer appointment?
Yes.
I think so.
If I'm not in the state legislature next year, I'm happy to help.
I was just reflecting that last year I sat next to Mike Meyer.
Oh, yeah.
And
Wait, is this better or worse?
well, the volume of comments and questions was about the same.
Yeah.
But
Okay, good job.
I'm glad I can be a spiritual successor.
but a lot of times with Mike, it was very, very important questions, and great historical context, and then sometimes there was just a lot of very colorful language too. So while the quantity of discussion was similar, like I very much appreciate all the insightful questions that helped us work through challenging things that we had to get our head around. So thank you.
Well, in memory of Mike, also remember that he told me he would be around as long as you would have him, and then he bailed, so. So much for that.
Well, he's still here, though.
Is he?
I mean, he's in Arizona, so we said in memory of Mike.
Oh, yeah.
Well, he's still
Oh,
part of,
I have fond memories of Mike.
We did meet with Mike for.
He did inform some of my questions.
Oh, nice.
He gave us a list.
How many four-letter words do you use in the?
A few. My customer mode when being recorded requires me to limit my number of four-letter words, although not my otherwise creative or colorful analogies.
Great. All right, good luck, folks. We're here if you need us.
Thank you so much.
thank you, guys.
The county is in good hands, thank you.
And this is yours.
Oh,